to get that assistance. And that, not only do we have it in the HEROES Act, but a couple weeks ago, we passed it on the floor of the House as a separate bill. $200 billion, $100 billion to help with renters, $75 billion in addressing the mortgage forbearance, foreclosure forbearance issue, and then the rest of it for homelessness and special rural housing programs and the rest. They really have to do this. This is very urgent. Now, that would be something they haven't voted for before, haven't supported before, as well as they haven't supported a strong worker protection OSHA standard. But other than that, they've supported state and local. They've supported testing. They've supported direct payments. They've supported unemployment benefits. One time they even supported food stamps. They've resisted since then, even though people who've never been to a food line before, a food bank before, are long lines to get in. You would think they'd have some sensitivity on emergency food initiatives, including SNAP, the food bank. So that would be one where they resisted, but they have voted for it before.
But have you spoken to Meadows or Mnuchin or anybody in the administration about what their feeling is?
Well, we have conversations on individual things, and Republican senators have approached me about individual things. They know there's going to be a bill, and we first it was going to be no bill, and then it was going to be some little bill. Now it's 1.3. It's not enough. It's not enough. And when they say it's too expensive, how can they say such a thing when right now the Fed is propping up the stock market? Stock market looks good, huh? Well, federal dollars are helping to make that happen. And that's okay. And that's a good thing for the economy. But we should have trillions of dollars to prop up workers. We've never seen anything like this. So on one subject or another, but it also just gets me that they say, oh, it's too expensive. $2 trillion, that's what they added to the deficit to pass their tax scam a couple years ago, which gave 83% of the benefits to the top 1%. I mean, they're like in a caste system mode. Whatever we can do at the top, that's what we really like to do. Perhaps it will trickle down. If it does, that would be good. If it doesn't, as they have said, so be it. But we have to make the fight, and we know that it will happen. They have to do unemployment insurance. Democrats and Republicans across the country are calling out for them to do the state and local. Republican mayors and county executives, governors, they need that money. They have outlays for coronavirus, and they have revenue lost because of coronavirus. So they'll be there. Yes.
Thank you, Madam Speaker. The administration and some Republicans are proposing the idea of back to work, return to work bonuses for employees. What's your thought on that, and would you consider including that in the next bill?
I don't know if they know what they're talking about, so I can't really thoughtfully address what you just asked. But I will say this, testing. People do not want to risk their lives and that of their families by going to work that isn't safe. We can open the economy if we make it for people to go back to work. Are they going to pay people to risk their lives without any OSHA standard and the rest? People are not staying home. They want to work. They want to go to work in a safe place. So the direction that the president should be asking for is, how do we open our economy to make it safe for people to go to work? And it is so self-evident. Anybody? Yes, sir.
Madam Speaker, I have a question, and I have a colleague who has a second question, if you'll allow for that.
Is that person here?
No, they're not able to be here. One per outlet.
Well, that's up to the rest of you. Do you want somebody who would have a question before you do? Yes, Megan.
My question is just that, a few months ago, it was hard to predict that we would have such severe spikes, I guess, now in July. Other countries clearly have handled this in a way that we have not. Moving forward, if in the next couple of months we still don't have a full grasp on it, is there a point where trillions more in stimulus just becomes unsustainable?
No, I mean, the point is if we don't invest the money now, it'll be much worse. If we don't in further testing and getting the equipment to do it, it will be worse. If we don't put in the pockets of the American people with our direct payments and unemployment insurance, it will be much worse. If people are being fired at the state and local level, being healthcare workers, transport workers, teachers, sanitation workers, and the rest, it will be much worse. So this is what is about survival of our economy. It is about spending the money in a way that brings us back. And don't take it from me, the chairman of the Fed, he even recommended state and local. He said, I call to Congress's attention state and local government. Really? We already have it in the HEROES Act. The Secretary of the Treasury knows that we have to do more to prop up our economy, or else it will be worse. It will be worse. Your next question.
The president today is going to be talking about how his administration has been rolling back regulation over the past 4 years and helping Americans rise out of poverty. He's doing that from the White House today. Doesn't see, I don't know.
I'm sorry, I don't know what he's doing today. What's he doing today?
Today, the president is supposed to be talking about his administration rolling back regulation and helping Americans rise out of poverty.
Okay. I don't know what he's doing, but I want to tell you something. What he did this week in terms of NEPA and what Richard Nixon put in place to protect our environment and therefore the good health of the American people. Oh, some of the, shall we say, polluters were saluted, but it was the wrong thing to do. So I don't know what specific to the environment or the health and well-being of America's families and workers he's considering today. But if it's anything like what he has been doing, that's most unfortunate. But I'll tell you this, he's done a lot of bad things, but nobody, you can't tell whether it's methane or mercury or what he's doing to the environment once or twice a week, terrible things that have an impact on the health and well-being of the American people, the air our children breathe, the water they drink. But what does he do but say, I got beans on my desk, and that's what people cover, instead of the danger that he is proposing to our and his administration. He has the henchmen of the polluters in his cabinet, always has, and he's implementing an agenda that's he's going to rise up people from poverty by making them breathe foul air. I get it. Yes. Anyone else? Yes, sir.
On unemployment, you mentioned that the benefit is going to end even before the 1st of August, the way that the system is structured. And yesterday seemed to indicate some flexibility on the $600 figure that had been a demand of the Democrats. What would be an appropriate replacement for that $600 figure if you were to reduce that a little bit?
No, I'm all for this $100. But again, what I said was the whole package will depend on the what we do also for direct payments, which are so essential. It may be hard for them to understand why they're so busy giving 83% of the benefits to the top 1% in our country, that people really do need this money. Baby needs a pair of shoes. This is urgent. They need to buy food. These are necessities. And when people lose that money for necessities, they inject demand into the economy and create jobs. So it is a stimulus, but it's more than a stimulus. It is a necessity right now. So when they're giving away big money and they worry about $600 for families who need it desperately, it just makes you wonder, who are they here for? I always say, I haven't quoted him lately. Maybe I have. St. Augustine, 1,700 years ago, 17 centuries ago, St. Augustine said, any government that is not formed to promote justice is just a bunch of thieves. This is about justice. It's so hard for people. They have so many challenges. Fear of catching a virus that could be deadly, nonetheless debilitating, and have pre-existing condition challenges for them as they go forward. Economic insecurity that they have, uncertainty about their children going to school. Is that safe? While the president is threatening to take away money from the poorest kids, by the way, in many cases. Title I, funding for children in economically disadvantaged areas. Separate from that, but including some of that, children with disabilities, homeless children. That's a chunk of what the federal government puts into it. So we're at a moment of making a judgment. Where is this? Where's justice in the environment as they roll back environmental standards of clean air, clean water, which affect communities of color in a disproportionate way? Where's the justice of taking away funding from many of the poorest kids or children with disabilities to act like the big guy? Where's the justice in not having the testing of the coronavirus so that we can see, and the statistics, the data, so that we can see the disproportionate impact that it has on people of color, and it does? Where's the justice of them taking down the website, practically, I understand, of CDC so that we can see what the challenges are to hospitals and the rest, and then saying we're not going to have people report to the CDC, a scientific organization. We're going to have them report to the administration. And where is the transparency? What are they going to tell us about that? In one of the bills, the second PPP bill, when we put more testing in there, we required that they would have collect the data and report the data as to how, especially communities of color, were affected, because we didn't have much of that. And because that's a place where there hasn't been a commensurate amount of testing. Hispanic community and the African American community. We're all Americans. We're all Americans, and everybody, all of our children are important to us. All of our people are. And because we are Americans, we're going to beat this. But we have to beat it scientifically. And in order to do that, you have to believe in science, and you have to believe in governance. Now, our friend who asked the question about how they're going to lift up everybody out of poverty by taking away regulations probably would not like me to hear me say that they don't believe in governance. If you don't believe in governance and you don't believe in science, you don't want to do anything, and you don't have to because you don't have the data that you accept. So we're in a very critical place. I yearn for other Republican presidents. While we may have disagreed on many points, at least had a shared commitment to the governance of our country. Richard Nixon signed legislation. So in any case, I said yesterday, we're at another critical point, but this is getting to be, as I said to you, look at all the number of people. 50 million more people have died since they haven't taken up the bill, and a large number more have become infected. Let me see. Next week, though, we're going to have some 137,000 since we passed them. 137,000 are dead now, but 1,000 added to that, and then 2 million more people infected, adding to 3.4. But let me just tell you, next week, what you're going to see, we're going to have child care bills on the floor to ensure that parents can go back to work and child care workers can keep their jobs. This is very important and a very high priority for us. And then we're going to have the Great Outdoors Act, a bipartisan bill that passed the Senate, and we will be protecting our natural heritage with that, and honoring our values with the No Ban Act. We'll be passing the No Ban Act and access to counsel act. So we have a number of things, including we're going to be passing bills next week or the next about removing statues from the Capitol of people who have committed treason against the United States of America. So we're busy, we're full, but nothing more important in the lives of our children, and their ability to go back to school, which we all want them to do, and they want to do, and teachers want them to do, and parents want them to do, but they can't do it if it isn't safe. It can be safe if the president executes the Defense Production Act to make sure it does. Thank you all very much.
Speaker of the House, Nancy Pelosi, as we continue to bring you worldwide coverage here on coronavirusnow.com. Let's go out to D.C. We got Attorney General William Barr right now.
Allows the Chinese government to elevate its influence campaigns and put a friendly face on its pro-regime policies. The legislator or the policymaker who hears from these American businessmen is properly more sympathetic to the constituent than to a foreigner. And by masking its participation in the process, the PRC avoids for its influence efforts, public outcry that might result if its lobbying were exposed. America's corporate leaders might not think of themselves as lobbyists. You might think, for example, that cultivating a mutually beneficial relationship is just part of Guangxi, the system of influential social networking necessary to do business in the PRC, to how you might be used efforts on behalf of a foreign company or government could implicate the Foreign Agents Registration Act. FARA does not prohibit any speech or conduct. It does require those who are acting as agents of foreign principals publicly disclose that relationship and their political or other similar activities, registering with the Justice Department, allowing the audience to take into account the origin of the speech when evaluating credibility. By focusing on American business leaders, I don't mean to suggest that they are the only targets of these influence operations, but they are principal targets today of Chinese operations in the United States. The Chinese Communist Party also seeks to infiltrate, censor, or co-opt American academic and research institutions. For example, dozens of American universities host Chinese government-funded Confucian Institutes, which have been accused of pressuring host cities to silence discussion or cancel events on topics considered crucial. Universities stand up for each other, refuse to let the CCP
And as you can see, well, it looks like that's wrapping up, no doubt about it. Let's continue on worldwide here for you while we do wait for some live events. I should say, everyone, about an hour and 15 minutes away from a White House news briefing. Of course, I'll have that for you in full, as always, right here on News Now.
Dr. Mike Srigliano with Penn joining us out of Philadelphia. Good to see you, Dr. Mike.
Always a pleasure, Thomas.
Let's start with some encouraging news on the vaccination front. The first vaccine tested in the U.S. kind of revved up people's immune system.
Well, this is very encouraging news, and it couldn't come any sooner with all that's going on now. Moderna's vaccine is showing great success in terms of safety and production of antibodies. In fact, in the patients that they are studying, they have found that the antibody response was similar to those folks who actually had the virus. So this is excellent, excellent news. Appears to be safe. Now what they're going to do is give it to a whole lot of people, and we'll see if it actually can mitigate, reduce the symptoms and risks of the natural infection of this virus, which is what we all need and are hoping for.
This is a partnership with Moderna and the NIH. Side effects, fever, aches, those are normal and acceptable, right?
Well, Thomas, with any vaccine, there are always going to be some side effects, and some are more than others. You can get low-grade fever, you can get local soreness, you can feel achy and feel fatigued. But I'll tell you what, Thomas, I'd much rather have those symptoms for 24 hours or so than end up on a ventilator in an intensive care unit. So this is the way to go. And we must say this, Thomas, that vaccinations will get us through this. And there has been debate for years by people who don't believe in vaccinations. This is not the time for that. And I'm taking a stand here because if you look at one of the best ways in public health to prevent illness, it is through vaccination, whether it be measles, mumps, rubella, whether it be bordetella, pertussis, whether it be polio, whether it be anything. If you look through history and time, this prevents death and illness, and this is the way to go.
Are you concerned, it's a good point, that too many Americans simply won't take the vaccine out of concerns about its safety?
Well, I'm very concerned about that. We had that problem even before the pandemic, where people just think they are dangerous. They are part of a conspiracy. They are just not, they don't work. The bottom line is that we must base everything on science, just like with masks, Thomas. We know now that if you wear a mask, it reduces transmission dramatically. And with vaccination, we can get out of the hole that we're in right now.
And we talk about what's next. There's this clinical trial, this vaccination. I know 30,000 people will receive it in about 2 weeks. Is that the final phase of this trial?
Well, that phase can take up to 6 months. So yes, if that be a proof of concept, if you will, that patients who get this vaccine have safety and efficacy, then they will be ramping up production. Now, that's a whole nother can of worms, Thomas. How do we vaccinate the entire planet? How do we do that? Well, I think what's going to happen is there will be shared information. There will be manufacturing that will gear up with many different manufacturers all throughout the world to get this under control. And it's a matter of production and a matter of getting people to get the vaccine. If we can do that, then I think there is light at the end of the tunnel.
And we talk about the efficacy rate, as you mentioned. What would be an acceptable rate, 50%?
Anything better than zero, in my opinion, Thomas. I deal with this every year with the flu shot. And people will say, well, Dr. Mike, the flu shot was only 30% effective this year. Well, guess what? 30% is better than zero. And if it helps a certain percentage of patients get a mild illness, then let's do it. Because right now we have nothing in terms of a vaccine. And this is really what we need to do to get through this.
One final on the vaccination front. Is it possible we could see a vaccination in multiple doses?
Well, Thomas, there's a lot of unknowns out there. We don't know whether antibodies last, whether they're protective. There's some disconcerting news that came out this week from England. People who actually had the virus have, in some cases, antibodies that are not protective, that reduce in either efficacy or number after 30 days. So there's a lot that we need to learn about this. But if it means that we do multiple vaccination protocols, fine. Let's do it. Let's make it happen. And let's move on with our lives. I don't know about you, Thomas. I'm kind of tired of the whole pandemic thing. I'm tired of the coronavirus. I want to move on, but it doesn't mean we just ignore the coronavirus like we seem to be doing. We have to deal with it head on in a scientifically proved way.
Have we been able to crack that very important question, why do some people who are exposed develop while others don't?
Well, Thomas, not really. There are people, at least in my own practice, I have 80-year-olds who thought they had a cold and they were positive, and I have had 50-year-olds who run and work out and take care of themselves very well who ended up on a ventilator for a month. It really depends on the individual risk factors, how your body responds. We're seeing this with kids. Certain kids who had the virus end up developing this fairly dramatic immune response. Not in every case this happened. So we need to learn more, and boy, will we keep learning a lot from this. It's almost tantamount to trying to get to the moon. So if you think about it, yes, the objective was getting to the moon, but if you think about the technology and the learning and the knowledge and the rapid advance in education from that project, it had led to many, many, many different outshoots, if you will, whether it be calculators and all of that. So we're going to learn a lot of this, and there is a silver lining with this coronavirus.
Yeah, we're learning more and more every day. The studies that are coming out, I know there's new research. It was published in the Journal of Adolescent Health that found that 1 in 3 young adults, Dr. Mike, is at risk of severe COVID-19, and smoking plays a big part in that risk.
Well, Thomas, we've known that smoking and vaping are both not a good even before the pandemic came. And if you remember, there were upticks and outbreaks of young people developing severe lung disease, some of them in transplants after vaping. And we were really looking into the chemical components of some of the vaping oils and material that went into the lungs. And so the young people who get this virus can get very sick. Those who smoke or vape are at especially higher risk of developing problems.
And we're also seeing reports that as far as our younger population, the young, not only are they getting sick, but they're experiencing symptoms longer. Do we know why?
Well, we don't know why. Many people are experiencing symptoms that are long lasting. Some of the people that I have taken care of, who I've seen in the office after illness, continue to have things like cough, continue to have findings on chest x-rays that indicate early fibrosis or scarring. So there's a lot to be said for the fact that there may be long-lasting effects, and not to forget the emotional toll that this is taking, not only in people who got the virus, but also the quarantine, the whole debate about school, kids being home, a decrease in their education and goals. All of that will have long-term effects.
Let's talk about schools for just a moment, and perhaps a myth versus fact here, because there are some reports out there who say our very young simply can't get sick. They can't be exposed.
Well, that's not necessarily true, and we know that for a fact that young people can get sick. Some people, young people can die, and some young people will need lung transplants. We've seen all of that. I'm not making it up. It's true. It is the truth. It is a true. Okay? So that being said, we need to find a way to safely educate our young people and not have them get into trouble. But also, Thomas, and I'm a big stickler on this, our teachers, our administrators, our people that are involved with our children, many of them have underlying health problems. And in my humble opinion, they need to be educated on proper use of personal protective equipment, just like doctors and healthcare workers are. They need to be made aware and educated on proper techniques to protect themselves when they are in the school, and that means wearing masks, and in my humble opinion, protection for the eyes. When I see patients, I wear these. And the bottom line is that we know for a fact, and we've talked about this, Thomas, that the virus can get into the eyes and lead to an infection.
Yeah, your mouth, your nose, your eyes as well. So as a parent, do you think it's safe to send our children back in the fall?
Well, Thomas, the homeschooling issue was very challenging for my two children. I have a 12-year-old and an 8-year-old. And so I believe that if we do it right, if we stage it properly so that there is social distancing, kids need to wear masks that are high quality, that cloth, that are 2-layer, that are high thread count, that even may involve 2 different materials like cotton and silk or cotton and flannel. If we do that, I think we get through this safely, but it's going to be challenging, unprecedented, and really a frontier. We are learning. We're all going to learn. We're going to make mistakes. Bottom line is, I think it's in the best interest of everyone to try.
Yeah, and a reminder once again, I mean, talking about the symptoms in our young here, they have developed an inflammatory syndrome very similar to Kawasaki disease.
Thomas, if I have a child, especially if they're in a school setting, they develop a fever, we are not going to say, well, it's just a cold. In this day and age, I want my patients to call me with any symptoms of upper respiratory infection, fever, muscle aches, rash, anything like that needs to be dealt with immediately, because the earlier the diagnosis in that particular condition, the children's multi-system inflammatory syndrome, that be dealt with early on, and better outcomes occur when it is dealt with, diagnosed, and treated early on.
And as we head toward the fall months here and back to school, who's eligible, who's should be getting a flu shot this fall season?
Everyone over the age of 6 months is eligible for the flu shot, and everyone should get it unless there is a good reason why you can't, whether it be that you had an allergic reaction to it before. There are conditions like Guillain-Barré where you have an immune condition that maybe precludes you from getting it. Those are the types of patients that you worry about, but leave that to health providers and experts to decide where your loved one should get it. But the bottom line is, for the vast, vast majority, we all need to get the flu shot.
Something to consider. Our daily reminder, Dr. Mike, on staying safe.
Well, Thomas, I want to mention this. There was recently a study looking at 2 hairstylists who treated a large number of people, didn't treat to cut their hair, styled it, just like you, an amazing hairstyle. And the line is that they wore masks and they did not transmit the virus, even though they were later found to be positive for the virus. So my take-home message today, Thomas, masks. Everyone needs to wear a mask. It is the way to go. Social distance, mask, wait for the vaccine, and we will get through this.
Added a layer of protection. Dr. Mike Sirigliano out of Penn Medicine, Philadelphia. Great to see you, Dr. Mike.
Always a pleasure, Thomas. You take care.
For an important announcement, and we have 2 people. Dr. Levine is with me, and we have Dr. David Rubin, who's going to be on TV soon. So let me start. During the past week, we have seen an unsettling climb in new COVID-19 cases throughout Pennsylvania. During the past, that has especially been bad. When we hit our peak on April 9th, we had nearly 2,000 new cases that day, with other cases hovering around 1,000. That was our peak, 2,000. Medical experts looking at our current trajectory are projecting that a new surge is in the offing. And what we're seeing right now could soon be even worse than what we saw before. We had 994 cases just yesterday in Pennsylvania. So before, we succeeded at flattening the curve back in the spring, and we did that by working together, all of us. And we actually broke transmission links. So we got down to the point where we were actually in the 300 to 400 new cases per day. And Pennsylvania, as you recall, was one of the continues to be, but still was one of the best states in the country when it came to dealing with the COVID virus. We didn't know as much about the virus then as we do now, so we had to take a broad approach, sort of a blunt instrument approach to eliminating points of contact. But with our current rapid increases, we need to act again, but this time we have more knowledge and we can act in a more focused manner. Because we have a better sense of how this virus is affecting Pennsylvanians. Through contact tracing, we've identified 3 catalysts for our case increases. This is where we think the case increases are coming from. First, some Pennsylvanians have been ignoring mask-wearing requirements and social distancing when they're visiting Pennsylvania bars and restaurants. They are unknowingly spreading or unknowingly picking up the virus. And this carelessness has resulted in pockets of super spreading. Second is out-of-state travel, both by Pennsylvanians who are returning from places they visited out of state and by out-of-state folks coming to Pennsylvania to visit us here. And the third catalyst for this new upsurge is a lack of national coordination. And that has resulted in states in the South and Southwest especially not committing to the things they should have done to keep this virus from spreading. Unfortunately, this virus does not respect state boundaries. And so we are paying the price in different ways for what states and places have not done. We see that, for example, in testing. Sometimes takes as many as 10 days to get test results back. And that's not because of anything we've done. It's because national test places are being overwhelmed by the cases that they've seen in other states. We're paying the price. We did everything we should have done. We were responsible, yet we're paying a price right now. So the result is that other states have become petri dishes for COVID-19 during the time when we were all working hard here in Pennsylvania to suppress the spread. Some of these states actually now have hospitals at maximum capacity due to the COVID-19. And this virus knows no boundaries, no borders, as I said, so it's been spreading northward, eastward, across the country, and has reached our Commonwealth once again, this time from the west, the south, and the southwest. Together, these three catalysts have turned our downward trend to an alarming escalation. And we're already at a tipping point where we really have to act. We don't want to become Florida. We don't want to become Texas. We don't want to become Arizona. We have got to act now. So today I'm going to be signing an executive order that will implement the following mitigation efforts across Pennsylvania. First, restaurants will reduce their capacity to 25%. The current outdoor dining rules remain in effect just as they are. Second, on-premises alcohol consumption will be limited to service with meals only. Cocktails to go and carry-out beverages are allowed. Third, telework must be implemented whenever possible. And fourth, indoor gatherings will be limited to 25 people, and outdoor gatherings remain at a maximum of 250 people. As I've said, we are using the information we have gathered over the past few months to create these mitigation efforts based on how the virus spreads, how it's spreading in actuality right now in Pennsylvania. We know that the virus appears to be primarily airborne, so we're placing limits on indoor activities. We know that the virus spreads rapidly in crowds. We're limiting crowd sizes in situations where people are likely to gather close together. This is the virus speaking. The virus is making the rules here. We're just trying to anticipate what those are and doing what we can to reduce the risk that that virus is going to do a lot of damage in Pennsylvania. Now, these new mitigation efforts are in addition to existing actions. They don't take away the importance of our personal responsibility to do our part, each of us, 13 million Pennsylvanians, to reduce the possibility that we are spreading COVID-19. It includes wearing a mask when we're out in public. It includes washing our hands, using hand sanitizer frequently. It includes social distancing as much as possible. We have seen these efforts during the first wave in the spring. They worked. And they're going to work again if we all do our part. So I want to say thanks to every Pennsylvanian for your continued patience and your support. I know all of us, I am and you are, eager to get back to life as normal. That's the way it goes. But this is what we have to do. It may feel like a step backwards, but it isn't. It's just a reminder that we need to get back on the course of mask wearing, social distancing, and successfully negating COVID-19. Pennsylvanians should consider that even with indoor dining limited and bars closed for on-premises alcohol consumption, cocktails to go are still permitted, and there's no shortage of outdoor dining options. Small gatherings of friends in the backyard or at a local park, they're still permitted. And children and families are encouraged to responsibly take advantage of or more of the 121 Pennsylvania state parks or other outdoor and local fitness options. Children can visit local playgrounds, community pools. They can enjoy outdoor activities with their families. Gyms and fitness centers can remain open and are encouraged to offer more outdoor fitness options. I want people time together, but I want them to do so while they're practicing social distancing, while they're wearing masks when required, When you leave your home and you're not participating in an outdoor fitness exercise, wear a mask. Every minute that passes is 1 minute closer to the end of this pandemic. That's what we're trying to achieve. And many researchers and many medical professionals are working diligently to find more treatments, maybe a vaccine, maybe a cure for COVID-19. So thank you, Pennsylvania, for everything that you've done, every sacrifice you've made. Let's keep working together. Let's keep working together as I know we can to protect ourselves, our families, our friends, our businesses, and our communities from a further spread of COVID-19. Now I'm going to turn things over to Secretary Dr. Rachel Levine. Secretary Levine.
Good afternoon. Thank you, Governor, and thank you for your leadership and support. Here is our latest update on COVID-19 in Pennsylvania. At 12 a.m. this morning, we have 994 new cases of COVID-19 being reported, and this brings our statewide total to 97,665 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 6,957 deaths have been attributed to COVID-19 now in Pennsylvania. As I explained on Monday, we have seen case counts increase in 43 counties in Pennsylvania, and the percent positivity rate has increased in 28 counties over a 7-day period. Over the last day, we have recorded our single highest day in tests being completed, with more than 28,000 test results reported. Currently, we have a total of 649 trained contact tracers across the state, including our community health nurses, local municipal health departments, and our committed volunteers. And we're working to increase that every day, every week. Through all of these efforts, we are still seeing increases in cases of COVID-19 in 19 to 24-year-olds throughout Pennsylvania and in 25 to 49-year-olds in Pennsylvania. The actions that the Governor and I are taking today are designed to be surgical and precise to prevent repeating the cycle that we saw in the spring. As the Governor mentioned, we have gained a great deal of experience since this outbreak, and have learned from best practices from other states and counties in Pennsylvania. New York and New Jersey, as well as Allegheny and Philadelphia counties, have taken a similar approach. In addition, states like Texas, Arizona, Florida, and California in the past have not taken this approach and are now seeing the surges. This action is necessary now to stop the spread of COVID-19 and stop the disease transmission cycle from repeating. We know what will happen if we hold fast and wait until cases rise exponentially before taking action. The numbers would continue to increase, and our entire state would then potentially have to quarantine. And so by acting now and making these specific and targeted mitigation efforts statewide, we can get ahead of the curve and ensure that not only will our hospitals and healthcare system be available to us, but that our economy will survive while still saving lives. There are things that you can do right now to stop this cycle. First, wear a mask. Really, if you're thinking that you might need to wear a mask, don't think so hard. Wear the mask. If you're in a store where people are not following the mandatory mask order, make a choice to leave. If you're getting together with people who've been pretty vocal about not changing their lifestyle and are refusing to wear a mask, make a choice not to see them. As much as our efforts are about laws and mandates and orders for safety, they're all about your choices. Pennsylvanians want to be at work. Pennsylvanian children want to go back to school. But it is our actions as a community that will impact our ability and their ability to do those things. So be safe, adapt your activities to protect against COVID-19, and please wear a mask. Here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to say happy birthday twice. Please use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Programs Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. Most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay alert, and stay safe. And now it is my pleasure to introduce Dr. David Rubin. Dr. Rubin is a pediatrician. He is director of the CHOP Policy Lab and director of Population Health Innovation at the Children's Hospital of Philadelphia. Dr. Rubin.
Governor Wolf, Secretary Levine, thank you for having me today. As the director of our policy lab and our population health program for a health system at the Children's Hospital of Philadelphia that sees over 600,000 children and adolescents per year, our teams mobilized very quickly in March and April to begin developing local area forecasts at the county level, because even though it was extremely important that we have national and state data that really impressed upon our communities the magnitude of what was coming, it was also important, we foresaw, that we would need to do local area knowledge so that we could get areas opened as soon as possible and as safely as possible. At CHOP, we represent the interests of working families. We knew that our families would be seeing the direct impacts of COVID, particularly to caregivers. We have a lot of grandparents throughout the state, that our teachers and our staff within the schools would be thinking about their own risks, and that children did not live in a vacuum. And as much as we knew that we needed to get families back and children to schools, we also recognized that we had to do it as safely as possible. The models that we have now developed, which forecast, and particularly the viral activity throughout over 500 counties in the United States, and which can be found at policylab.chop.edu, along with other resources for families, have actually allowed us to understand how this virus moves across the country and how it sometimes and often spares rural areas, and even as we struggle in some of our more urban areas. The modeling has also helped early on. We were one of the that were really trying to challenge state governments to reopen some areas safely that were ready, even as our cities remained more cautious and were struggling with disease activity in their local areas. Our models now have been helpful to the White Virus Task Force as we've been helping them to understand potential impacts of stronger mitigation strategies to try to curb this next wave of the epidemic that has been sweeping the country. And so for a long time, we've helped advise and consult to both state and national leadership to help people make important decisions that affect the lives of people every day. But we also promised that we'd be back if we saw incontrovertible evidence that the resurgence was coming. And sadly enough, I'm here today to let people know that that evidence is now clear. And even as we focus on Texas, Arizona, Florida, and other areas, Southeast and Southwest, it is very clear that the disease resurgence is moving quickly into the Northeast region and to the upper Midwest. And if I can share my screen, I'm going to show you exactly how we don't rely on single pieces of information to make that assessment, but we see through neighboring regions, we see it in multiple counties sharing the same disease resurgence, and we see it in our testing positivity rates, as Secretary Levine has discussed. The goal here, I would remind everyone, the goal here is we have about 6 weeks left in summer, and all of our school reopening plans, of which our teams at CHOP have been very much involved, entirely dependent on us keeping disease transmission down so that we instill in our public the confidence that they can safely put their children on a school bus and return to school, and that our teachers and our staff can feel that they will be safe when they go to educate our children. So with that, I'll try to share my screen, and if I can't, I'll give you the general comments, and I'm going to start by focusing in on Allegheny County. So I'm going to assume that that people in the room can see what I am sharing now on the screen. Is that correct? Lacking someone tell me otherwise, I'm just going to start preparing my comments. The
No,
graphs
we just see you.
Oh, you just see me, so you can't see my screen. Let me try. So I don't think this is going to work on the screen here, so I will just contextualize the comments. Over the last couple of weeks, we've seen significant disease resurgence in the Pittsburgh area, not just in Allegheny County, but in the neighboring counties around. We have applauded as we've watched people in the Pittsburgh area begin to distance more and do a lot of the individual activities that Dr. Levine has spoken about today. And they may, in fact, be curbing the epidemic that is quickly spreading there. However, this was not an isolated outbreak. Prior to the resurgence in the Pittsburgh area, we've seen multiple cities now in the state of Ohio, including Cleveland, including Columbus, Ohio, with significant resurgence that continues to climb. They have widespread community transmission, which is washing over our western border of Pennsylvania in waves, particularly as people travel in a season of American vacations. And if that were only the case, we would have enough to be concerned about what's coming east. But even more worrisome now is a lot of the pressure from the south is really moving quickly up the I-95 corridor. We're seeing increased disease transmission in the Washington, D.C. metro area, in the Baltimore, Maryland area. Those areas just a couple weeks ago looked much more like us or New England, where it was fairly quiet. And within a couple of weeks, they now resemble like the cities in North Carolina that have lost control of the epidemic. For people to view on our website, the Virginia Beach projection for the next weeks, we'll see what epidemic transmission looks like and how quickly cases can grow within. Over the last week or two, we've now also been watching very closely the Philadelphia area, and it is very certain over multiple weeks that the collar counties and the surrounding counties in southern Jersey are all now reflecting increased diseased activity and are conferring risk as well to Philadelphia proper. This last week or two, we've seen elevated transmission rates in throughout the Philadelphia, and we're seeing very clear evidence of increasing case identification in Philadelphia. This is also not isolated to just Philadelphia and to Pittsburgh as well. Because of the increased risk now and transmission we're seeing throughout the state of Maryland, up the Route 15 corridor towards Harrisburg, we are now seeing significant pressure on York County and into central Pennsylvania. Simply stated, we are seeing now widespread community transmission throughout the Northeast area. It's also extending up into northern New York as well. And it's of sufficient concern now that if we do not act decisively in these next 6 weeks, we may not be in the favorable vein we had hoped to be in, to be able to convince the public and to assure the public that opening schools will be safe after Labor Day. Make no mistake, the time is now for action. And I'm going to hand back the decisions and the questioning back to Governor Wolf. to Secretary Levine, and I thank them for having me here today. I'd be happy to answer your questions as well.
Questions? Yes.
So, why is this a statewide order after you previously stated that you were going to take a more targeted approach to counties that were seeing in cases? Obviously, the more rural counties are not seeing the same influx in cases. Why are those businesses being forced to occupy with the same limits as businesses in larger counties, more cases?
Okay, first of all, this is a very targeted approach because we know more about the disease, because we have contact tracing. We know where this disease is spreading from. We also know that the disease is not respecting boundaries, county, state, national boundaries. So we are trying to do what we need to do in a targeted fashion. As for the geographic spread, most of the counties in Pennsylvania actually are seeing an increase, not to the extent that Allegheny County, Philadelphia County, but this is something that extends across the Commonwealth. But as Dr. Rubin and Dr. Levine said, we're trying to make sure that we do things we need to do right now so that when schools it comes time to open, we get back to the fall, that we're in a position to. Again, we're trying to follow the dictate of this virus, and this virus is saying, I'm back. And you might have done everything you needed to do in Pennsylvania, but you couldn't control what happens in these other states. You couldn't control who's going to be going across state borders. You couldn't control who's going to congregate in bars. I don't like this any more than anybody else does, but this is what we're trying to do. This is what we need to do if we want to stop this in its tracks right now, so that by the time we get to the opening of schools, we can do that. Dr. Rubin or Dr. Levine, you want to say anything?
Well, to echo the governor's comments, I think that, and the data that Dr. Rubin is presenting, I think the threat is statewide. And so that is why this is a statewide effort. And as the governor said, this is a targeted mitigation effort. This is not red, yellow, green, where many different segments of the population were affected. We're really looking at the data, not only in Pennsylvania, but the data nationally is that the virus is starting in younger people, so the 19 to 24 age group, but also the 20-49 age group, and that is particularly being spread, and sometimes in these super spreader events, in restaurants, in bars where people are not practicing social distancing, they're not masking, and they're putting themselves and their families and the community at risk. And that's what we've been seeing in Allegheny County. We've had extensive discussions with Dr. Bogan, have strongly supported the mitigation efforts that Dr. Bogan has put in place, strongly supported the mitigation efforts that Dr. Lee in Philadelphia has continued, actually, over the last number of weeks. And I just want to contrast the efforts that Governor Wolf's leadership is taking in the administration to Florida, because in Florida, you can see what happens when you don't do any mitigation efforts, basically let the virus burn. And so they are seeing, last week was, Saturday was over 15,000 cases. Yesterday, I think it was over 10 or 11,000, close to 10,000 today. You can see that their hospitals are threatened in many different areas around the state. Their death rate is now increasing. That's what happens when you just let this burn. We cannot be Florida.
If I can just follow up, what if this, people are going to be asking, I'm sure, what if this doesn't work? What if we don't get to where we want to be? Mm-hmm. Are we going to see more businesses affected or an occupancy limit, brought down? Because many of these restaurants will say, we can't survive at 25% occupancy.
So it is absolutely, and the governor can speak about this as well, extremely challenging for those businesses and for the people and the employees and the owners of those businesses. And we certainly realize that. But this is where the virus is spreading now, and this is where we have to take action. It's hard for me to predict what we're going to do in the future. We are positive and optimistic that this action will be successful. But we cannot be Florida. We will not let the state go and letting it burn, and so we'll do whatever is necessary. But this is what is necessary now. Governor?
No, I couldn't agree more. This whole process, we've had an array of choices, and they've all been bad. What we've been given is what the decision as to what's the less bad option. Clearly, this is a bad thing for the businesses we're targeting here. The question is, would we be in even a worse position if we allow what happens in Florida, where no one going to restaurants, they're not going to bars anymore. And as long as the hospitals are being overwhelmed, they're not recovering from the disease. I mean, none of those things is good for any part of any economy. We're trying to mitigate, and yes, it's focused and targeted right now. It's a bad thing. Hope we do this and get through this phase as quickly as possible. If we do nothing, I can guarantee you we'll be looking a lot more like Florida than we looked like Pennsylvania by acting decisively early on. I want to get through this, and we need to get through this quickly. This is where the virus is being spread, and that's where we need to do our work. Yeah.
You mentioned that a lot of these new efforts are targeting indoor events, but as Dr. Rubin said, there's only a few more weeks left of summer. What's going to happen when it starts getting cold? Do people need to plan that they're going to keep staying outside, or will they be able to have more things inside?
Yeah, well, two things. First of all, we're trying to actually stop this virus in its tracks. And right now, because we are we have the information that we know where this seems to be spreading, we're targeting that. If we do that, we don't have to be as focused on this when we get into the return to school. And that's the hope, that we can actually do what we need to do now so that we don't have to, I mean, we don't want to wait another 4 weeks. Let's act now in the hopes that this makes it so that we don't have to do draconian things when we get to the fall. Yeah.
The spring of the virus, the first cases appeared here, and the numbers of the cases started escalating quickly. It seemed like the overriding goal was to protect the healthcare system, to limit the virus spread so the healthcare system wouldn't be overwhelmed. The last 10 days or so, the hospitalizations in Pennsylvania, according to the dashboard, have been pretty steady. They haven't skyrocketed, they've been steady. So if the state's hospitals are doing pretty much okay, why do a statewide virus?
First of all, the objective is to keep people safe. And one of the means to doing that is that our healthcare system, just one of the means, was to make sure our healthcare system, do everything we could to make our health system not be overwhelmed. And we did that. And I think you're right. Right now, we're doing that. If we don't do anything right now, if we do what Arizona and Texas and Florida did, we're going to see that healthcare system, just as they are, being quickly overwhelmed. We don't want to get to that point. So that wasn't the goal, but it was a means to the goal of keeping people safe. So far, we've done a good job, and I think our healthcare system is in pretty good shape. Remember when I keep bringing this up, we were using ventilators as a reflection of how many ventilators were we using compared to how many we had. We have 5,300 and some ventilators out there in the healthcare system right now. As of today, we are only using 88 of them for COVID-19 patients. Now, part of that's because the standard of care has changed. But part of it is because our healthcare capacities. We have millions of N95 masks and millions more on the way. We were concerned about gowns. We now have over 1 million, maybe 2 million gowns. We're looking for warehouse space. Hospitals and healthcare systems can't take any more inventory because they have a lot of inventory. So we have the capacity now. And I think that's a good thing. We don't want to get to the point where we were concerned back in the early stages that our healthcare system would be overwhelmed, because that would be one more reason why this virus was going to overwhelm us. We're trying to keep safe. We're trying to keep people safe here with what we're doing right now. And part of that is to make sure that we don't let our healthcare system be overwhelmed.
Follow-up, the Associated Press reported that the county governments have received an email from your office saying that bars and restaurants that are not serving to be closed. Are you closing bars or ordering bars and restaurants that don't serve meals to be closed?
Yes.
Okay.
I call them nightclubs. I mean, I think if you have a place where you can go get a hamburger with the beer, that's fine. I don't care what you call it yourself. But if you're just a dive bar or a nightclub and you do is serve drinks, that's not going to work. Yes.
I'd like to get Dr. Levine's latest assessment and perhaps Dr. Rubin's.
Yeah, why don't you pick on Dr. Rubin a little bit here, too? That'd be great.
Regarding this surge that we're seeing, what is your latest assessment on what is happening in terms of medical impacts? Are you seeing any signs whatsoever of people getting sicker or the death trend go up or
this is for both of you?
Sure.
So I'll speak briefly, and then I'm going to toss it to Dr. Rubin. So there have been some increased hospitalization rates in Allegheny County, but you understand that all that gets delayed, meaning you don't usually contract COVID-19 and immediately get so sick that you have to go be in the hospital. First of all, the incubation period of the virus is 2 to 14 days, on average 5 days. And then after a number of maybe a week or 2 weeks, then you're getting sicker and sicker and you end up in the hospital. And then if someone might pass away, often that can be several weeks after that. And so that is what Florida saw. Florida increasing numbers. And then a time later, several weeks later, now that their hospital system is challenged, and then now they're just starting to see the increase in deaths in Florida. So any report, I want to clarify this, any report that the virus is less severe or less virulent, I completely disagree with. There is no evidence that the virus is less severe or less virulent than it was before. In fact, there is some genetic evidence, although it's controversial, that it's actually somewhat more contagious. That the variant that we're seeing, primarily that came from Europe, might be a little bit more contagious. But that we have not seen the hospitalizations because until the last number of weeks we didn't see the numbers. Now we're starting to see some small increased numbers in Allegheny County, and we, as the governor is saying, we don't want to wait until exponential growth is going up and then our hospital system is challenged. Dr. Rubin.
Yeah, I'd like to just add a couple of things because at Policy Lab we've had the benefit of watching the cautionary tales of what's going on in the South and other regions of this country. We've worked very closely and hard to get communities reopened and keep them open, and it's been one of the an extremely common calculus is we're going to keep pushing through our gates until we see our hospitals full, and that has been a rabbit hole. Has not worked at all. Leaders in the South have failed to recognize these increasing transmission rates. And the time for action is when you're doubling from 50 to 100, is not when you're doubling from 500 to 1,000 cases a day. We've also seen transmission cycles now where younger people are getting infected and then infecting older people in their community due to people being fatigued, et cetera, not distancing enough, which has been the most important strategy that we have. And that, again, delays the hospitalizations rising. And the problem that happened in Texas and Arizona and now in California and in Florida is by the time their leaders recognized, oh my gosh, we're 85% full, they're in the thousands, and those thousands are doubling every day. And when that happens, you get overrun. So waiting for the hospitals to fill is not the way to try to use a dimmer switch. The fuse blows on a dimmer switch when you're in the thousands of your cases daily. The time for action is now, and with the urgency around school reopenings just around the corner, if we do not get communities' transmission rates down, we're really threatening the most important reopenings that we have coming around Labor Day.
Governor?
Yes.
Well, you said earlier that it's imperative that Pennsylvanians do their part, but just like we've seen since the beginning of the pandemic, there are people who aren't going to follow that. So what about the nightclubs and the bars and the patrons that visit those locations? Is there going to be a consequence to not doing what the order states?
Yeah, there are legal consequences. We actually have liquor enforcement officers that have made thousands of inspections and actually issued some warnings. For the most part, though, most establishments have actually done the right thing. Second thing is that I think, I don't know if you've all noticed, but more and more people are wearing masks out there, and more people are getting, I think it's like seatbelts. More and more people are saying, yeah, I don't like this any more than you do, but that virus is out to get me, and I want to reduce the risk. And so more and more people are doing the right things, and I think part of what is going to happen, people are just going to say, I don't want to assume the risk of getting this disease. So instead of going to that nightclub tonight, maybe I'll stay home. And the more people who decide, the better we're going to be. And I think that's what's happening. Right now, when this started back in March, we were in a very different place than we are now. Right now, people are wearing this. People are actually looking out for each other in a way that they weren't just 3 months ago. And I think we're learning about, we learn about this disease, the more each and every one of us, 13 million Pennsylvanians, are doing the right thing. And as we do the right thing, I don't care what your economic incentive is, you're going to find it hard to remain. You're going to be shamed into doing the right thing. Are there going to be exceptions? Absolutely. Are there going to be that no enforcement officer has the time to go to? Sure. Are there going to be cases that figure out ways to skirt this? Yeah. But for the most part, we are moving more and more where all of us are, in fact, working together to attack and defeat this virus.
And Governor, follow-up to that, what should residents do if they want to call out that person? Because that's a question we're getting in the newsroom all the time, is where can people report businesses and individuals who are not following guidelines?
That's a great question. I think individual residents, if they see something that's wrong, they ought to and the more they report that, the more the people who are responsible, local law enforcement, state law enforcement, are going to do something about it. I think one of the things that happened early on, nobody was standing up, or few people were standing up, and so someone say, hey, I'm going to be a tough guy, I'm going to stand open up, this is my First Amendment right, or whatever. And it's like, I think if someone stands up and says, I don't think you ought to be doing that, you're going to be finding more and more people saying, yeah, I think you're right. I want to do the right thing here. That's what we're really aiming for. This is going to work when 13 million Pennsylvanians, all of us, decide that we want to hold on to our lives, we want to reduce risks for our loved ones, our neighbors, our coworkers, all those things. And as that happens, I think you're going to find fewer and fewer people, as we're already finding, want to violate the law. Yeah. Yeah.
Thanks. So thanks for being here. I wanted to ask about testing. The last time I was here was in May, and that was where Dr. Levine said that one plan for the fall plans for the fall included having rapid response testing.
Right.
I was just wondering, is that still, are there still Pennsylvania firms working on that?
No,
is that
absolutely.
likely for the fall?
Absolutely. We thought it was going to be August. I'll let Dr. Levine talk about it, but this is something we are working on. We actually have the Department of Community and Economic Development working with a specific company. We're taking a gamble here, but focused on a Pennsylvania company where we control our own destiny and say, we want a rapid turnaround test. What does it mean when you get tested and it takes 10 days to get the result? The answer is it means, because within that 10-day period, you might have tested negative. By the time you get the test results back, you might be positive, but you don't know it. So we need to get a test that's easy to administer, hopefully oral, that you can do yourself, and where we get an accurate response or results within, say, 15 to 20, 25 minutes. We're not there yet. There is no place in the country that's there yet. We were, the company working for originally, we thought maybe we could get it by August. It looks like they're now saying October. We're not holding our breaths, but we need to work on that, and that's the kind of testing we have to get toward.
What's the company?
It's cold. Am I allowed to say this?
I don't know.
I don't know.
Was it publicly bid? How did you choose the company?
That's a good question. We'll get back to you and figure out how we did that. This is one of those areas where I'm trying to move as quickly as I can, not go, wait and spend a lot of time. So I am sure if there were some things that we did that moved faster than in ordinary times, I'm sure that we did. And it is a gamble, and the hope is that it works in Pennsylvania. I'm trying to keep Pennsylvanians safe, and this is something we desperately need. Every state needs. We need it here in Pennsylvania. We cannot, as we're seeing right now, we cannot continue to rely on national testing organizations. Yeah.
Governor Wolf, I have two questions. One, logistically, you can answer yes or no. So even if bars have like outdoor seating, but they don't sell food, does that mean they're still going to be closed for this?
The order is, even if you're outdoors and you're serving alcohol, you have to serve food with it.
Okay, that's great. And the next is, I know that 6 weeks from now we have that benchmark of the school year opening, and I know many teachers are concerned, thinking that they won't be safe going in the building, but lots of parents are concerned because they need their kids to go. It's obviously, I don't want to tell you, huge issue. Are you prepared to pull the plug on the school year in person if we don't reach these benchmarks and we still keep going up in attendance?
Yeah, I mean, ultimately, I think it's going to be me pulling the plug. It's going to be exactly what you said. Teachers not wanting to come back to school. It's parents not wanting to send their kids to school. The same thing is happening in universities. We can wave all the buttons we want and flick all the switches we want. If they don't make individual decisions, I feel it's safe to go back. They're not going to go back. And that's why what we're doing here is so important. We need to nip this in the bud. We cannot, as Dr. Levine calls it, let it burn like Florida. We've got to take decisive action so that we have a fighting chance to be able to get to a point where parents are going to feel comfortable and confident that they can send their children to school. Yeah.
Governor, thank you. The Red Cross, as part of the testing you all have, doing the antibody testing, there's a concern that those cases would come back as a positive, which means they've had COVID, now they have the antibody. Can you give Pennsylvanians an assurance that those numbers are not being counted twice, positive COVID and positive for antibody?
I'll turn it to Dr. Levine too, but yeah, we actually came up back in March or April, and we are not. We understand that there are two different types of tests, but a negative in one is not the same thing as a negative in the other, and you can't conflate those things.
Sure. So first I'll answer that. I want to mention about the general testing. So we know exactly who has the antibody tests, and we know exactly who have had the PCR tests, and so we don't double count them. But also I want to emphasize is that the antibody test results is listed as a probable case. And so we only make decisions when we're deciding about mitigation and other factors. We're only making that decision based upon confirmed cases, and that are only the PCR results. And so it is, and we separate it all in terms of our website. So it is apples and oranges. We're only looking at confirmed cases when we look at county case counts or regional case counts and things when we're making any type of decision like we're making today. And we make sure that we don't double count our total numbers. I also want to mention in terms of you mentioned about the testing. So, you know, we have reporting 28,000 tests. That's the most we've ever reported that have come back today. That's very good news that we've been increasing our testing. We've increasing our testing in terms of our community testing, but also we are testing every patient and every staff member in every nursing home in Pennsylvania, and we're working to complete that by the 24th of July. And then we're working with the Department of Human Services to test every patient and every staff member in all the other long-term care living facilities sometime in August. And then we're going to test on an individual basis depending upon the results and then their location. And so we're very pleased with the increase in testing. We've worked with many other companies such as Rite Aid and Walmart and CVS in terms of testing. So we have a capacity to do about 1,000 tests a day at our laboratory in Exton. Those are priority tests that we do, for instance, with a priority nursing home might have some issues, and we get those back in 24 to 48 hours. The hospitals and health systems, of course, do their testing. They get those results back in 24 to 48 hours. The concern that the governor was mentioning is the national testing laboratories. So, you know, many community tests, they're being obtained at potential federally qualified health center or one of the companies that has testing. They're sent to national companies, for example, Quest and LabCorp. Now, they are doing a fantastic job, but they are overwhelmed with tests now, particularly tests coming from California, from Arizona, from Texas, from Florida, but not only those, and Dr. Rubin could probably tell us the other states that are particularly impacted and affected. So the lag time for those national test results has crept up a week and then sometimes more than a week, 10 days, and that limits the utility of the results, as the governor was saying. We do have calls in to LabCorp and Quest to talk about the challenges and to brainstorm with them, but this is a national issue in terms of the number of tests that are coming to these national companies, and we'll really need a national response in terms of helping them decrease their turnover, decrease the time in terms of we get the results.
The cases that are reported every day, I mean, can you give any kind of sense of how up-to-date data is if we're seeing this lag, and how are the lags affecting our new case counts? And there's a reason to believe that case counts are really higher than they are, or will surge as we work through the backlog.
So, I mean, most labs are not 2 weeks. Most of the test results are not 2 weeks out, but many of them are certainly within the last week. There are concerns with that lag time. Dr. Rubin, would you like? You had talked about your concerns about the test lag time.
Well, we used to think that, you know, wherever you were today or what you saw today in your tests, you're probably 2 weeks behind. And, you know, with the increasing lag times and increasing reports of people waiting 7, 10 days, first of all, at the individual level, it's hard to make decisions. about how to get kids back to school or people back to work based on those types of decisions, and people live with a lot of anxiety. That's bad enough as it is. But from the perspective of trying to be ahead of this epidemic, when you add extra delays to the tests that we're not now seeing because of the surges in the South, that means we may be further behind than just 2 weeks. And so whatever we're seeing today, we're probably a few weeks behind what's actually happening on the ground. And that should worry us, and why we need to be a little bit more decisive and ahead of the game, if you will, in terms of responding right now.
Yes.
The 25-person indoor limit apply to religious institutions?
No.
Governor?
No. John?
That was actually the question.
Plagiarism. Yes.
Right now, the hospitals right now, the health systems are really making a case, like right now, to try to persuade people to come to the hospital. Do you have, in light of what we've been talking about today, do you have any concerns about that right now?
Let me, I'll turn. Let me just say that actually is a problem with restaurants and bars and retail establishments and manufacturers who want to give the people who either work there or are going to be customers or patients or students the confidence that they can come back. This is a general problem, and the problem you're talking about is one that I've heard a number of hospital executives talk about, and that is, how do we get people confident that they can come to, of all places, a hospital, to be treated for things that they might just sort of let slide and stay home. They're afraid of going to a hospital right now. They're afraid of doing so many things. Why what we're doing here is so important. We've got to take steps to actually build that confidence that we can get back to as close to normal as we possibly can, and that's what acting decisively and early is. Dr. Levine?
So I would agree with the governor 100%, is that we want people to get the primary care and the other services that they need. We want people, if they have hypertension, if they have diabetes or heart disease or lung disease, to see their doctors. We want children to get their pediatric visits and to visit their family physicians. We want children to make sure they get their necessary immunizations, which is absolutely critical. So we want all that primary care, all that secondary and tertiary care to continue. We want them to feel safe to be able to go to the hospital, have quote-unquote elective procedures. That elective doesn't always mean that it's really elective, but it's something that could wait a couple weeks but then has to be done. So we support the hospitals completely. We want people, their physicians and their healthcare providers, and to get the care that they need, which, as the governor said, highlights why it's so important to put in this targeted mitigation now, so that we don't threaten our hospitals the way Florida has, where now they can't do those, and they've started in Texas, in some areas, they're starting in Arizona, the crisis standards of care, because their hospitals are overwhelmed and threatened. If you wait to that point, as Dr. Rubin was saying, you've missed the boat. Dr. Rubin, would you like to comment?
Yeah, a couple things. I just wanted to note that back in March and April, when I returned to my own pediatric practice, I remember being terrified. I think all of our staff were as well. Our nurses, our nursing assistants, we were worried. I mean, no one, we all felt the same way, terrified that we were going to a very uncertain environment. And then to watch what Children's Hospital did and what our health providers did to provide the adequate protective equipment, the protocols, and the decision-making really helped leave a lot of anxiety. And I think of the same way for our teachers. I feel safest when I'm at my practice right now, and Pennsylvanians should feel safe going into your healthcare systems. They've worked very hard to make it a safe environment, and their protocols are pretty impressive. But I also say to the teachers out there, our job as Pennsylvanians is to get our case transmission rates down. That's step one, to reduce the burden so people feel safe, and the likelihood that they're going to accidentally get infected goes way down. The second thing is to say is to have strong protocols for masking and distancing in your schools. And if you feel confident about your protocols, and with low disease transmission, I think our teachers and our staff should feel just as safe as our nurses and our nursing assistants and doctors do when they walk in the doors of the Children's Hospital of Philadelphia.
It sounds like you don't have any immediate concerns that we're headed for a capacity problem then?
The goal, as we've been saying, is to prevent, which is why we're putting the mitigation.
I have a concern about that. If we do nothing, we are going to overwhelm our healthcare system. That's why we need to act now. One of the reasons we need to act right now. Okay, thank you.
One quick question. A lot of people in the legislature support a bill about the right to know law and it being effective, or right to know request being answered during an emergency. Earlier in the spring, you said the process is secondary was one. Will you sign that bill that the entire House approved and that is moving forward in the Senate now?
No. I think that bill has some flaws. I am for transparency, and I will stack my record of transparency up against members of the General Assembly any day of the week. I think that particular bill has some flaws. Let's actually get to a point where we are transparent. And by the way, we are answering all right to know and open records, I think, right now. Is that right?
Is the Capitol going to close under this new order, and so will the right to know process change? Will state workers be teleworking now?
To the extent they can, but I'm not sure that open records necessarily limited by teleworking. To the extent you need to have specific concrete files, I think there's still enough people who are going to be working that can do it. We'll figure out how to do that.
What about what limited it in the spring, though?
Excuse me?
I thought that was what limited the right to know in the spring, was people were working from home, and so.
Well, we had fewer people working, period. People working from home, that's true. We also had fewer people working, and that put a limit on it. We needed to figure out a way to deal with this, as we did in so many other the processes in light of this COVID-19 pandemic. And I think we've done that now, and so moving forward, I think we should be in pretty good shape. Thank you very much.
Well, good morning, everyone. I'm Dr. Grant Colfax, Director of Health for the City and County of San Francisco. Today, I'm going to provide an update on the COVID pandemic in San Francisco, looking at health indicators and other data. Unfortunately, we are experiencing a surge in COVID-19 infections that is affecting our community's health and our reopening plans. As a result, we are forced to continue to pause our reopening plans until conditions improve. We have been, and we continue to be in a period of uncertainty. And I want to acknowledge that that is a really hard place to be. We all need to continue to do what we know works. We have flattened the curve, and we can do it again. But if we do not, the consequences could be dire. In terms of where we stand today, both locally, regionally, and nationally, in San Francisco, we have 4,696 cases diagnosed of COVID-19, and sadly, 50 deaths. In the Bay Area region, approximately 37,500 cases and 667 deaths. Across the state, 346,000 cases and over 7,000 deaths. And across the nation, cases and deaths continue to rise. 3.4 million cases and nearly 137,000 deaths. The virus is not only still out there, it is out there more than ever before. It continues to spread locally, community, and throughout the Bay Area region. We are working with researchers who are seeing the reproductive rate of the virus continue to climb above 1. Right now, we estimate that number is now approximately 1.3. That means that each person who is infected with COVID-19 is passing the virus on, transmitting the virus on average, to more than one person. It is key that we get that reproductive number to 1 or lower. It is key for us to move forward. Now, 1.3 doesn't seem that different from 1, that far from 1, but if we do not do better, we are looking at major problems by late August and September, with an average peak of 900 hospitalized patients by early October. And just to put this in some frame of reference, on our last surge in April, we peaked at 94 cases. This average scenario of 900 cases is nearly 10 times worse. It's certainly not the worst case scenario that we could have by that time. Models show that we could have thousands of hospitalized cases by then. Today's tracker showed that there are 92 COVID positive patients in San Francisco hospitals. That includes 76 San Francisco residents and 16 transfers. Let's look at the health indicator. Let's look at the health indicators we are using to monitor our COVID-19 response in the city. These are available on the San Francisco Data Tracker, and you can see them from our department's website. They are scored by color: green, yellow, orange, and red, to make it easier to see at a glance where we stand. And there is detailed data available for people who want to dig a little deeper. Right now, the indicators show that we have reason to be concerned. Our cases per 100,000, our case rate has increased to 7.7. That is in the red zone. Our goal is to keep that case rate at around 1.8. We are red. In terms of our hospital system, the rate of COVID-19 infections, which really represents the slope of that curve that we worked so hard and successfully early on to flatten, that rate is now increasing at a 33% rate. That is red, a cause for grave concern. Our goal is to keep that curve increasing by less than 10%. Our other hospital indicators are thankfully still green. That is our capacity to take care of people across our 9 hospital systems in the city. Right now, we have 27% of our acute care beds available and 28% of our intensive care units available. With regard to testing, our testing indicator is green. We are averaging 2,950 tests a day across the city, with our far exceeding our goal of 1,800 tests. Certainly, as we are seeing across the region, across the state, and nationally, our testing system is experiencing delays in access and getting results, both within our city system and with private providers. Our numbers, however.
All right, everybody worldwide here, about to start off on coronavirusnow.com. In just moments, everyone, we do have a little preview here, what you're going to expect in an hour now. White House news briefing. And let's start it off here on Fox 10 Extra. Welcome everyone here to News Now. 2 hours of nonstop coverage from around. I'm your host, Mike Pace. Thanks so much for joining us here today. We truly appreciate it. Busy day once again here on the News Now desk. Coming up in an hour, we'll have White House news briefing underway. Of course, we will for that for you in its entirety. Once we do get Kayleigh at the podium, we'll feature that for you. But in the meantime, let's get right into it. We have a live news conference, really a roundtable discussion in Florida with the governor and other state officials. So let's get going here on News Now.
That we're still coming to terms with, and quite frankly, they're going to be with us for a long time. One I've talked about, and much every physician you talk about around hospitals in the state of Florida will talk about alarming decrease in people in March, particularly March and April, of people who were going to the ED for heart and stroke symptoms. Whether that was out of fear of catching coronavirus, whether it was belief that there weren't going to be medical services, that has basically allowed some conditions to worsen. And so now you look in ICUs, you have people with those conditions now in Florida and across the country who are in more critical condition than they probably been had they gotten the care. So the message from those hospitals and from me has been, if you have those, you do need to get care. You also look at what we've done to do things like protecting our nursing homes. We were one of the first states to not allow outside visitors into nursing homes. We feared the entrance of the virus into a population which is by far the most vulnerable to COVID-19. And I think we had to do that, but we also have to recognize that that comes at a significant cost in terms of mental well-being, family connection. Now, we in the state, and I know organizations have tried to lessen that by providing things like iPads so that the residents can see their family members, and I think that that's good, but that has been a really significant price to pay. You also look at hospitals when people are in the hospital, not being able to family members come in many hospitals. I mean, I've encouraged to try to have the visit because I think it's important, but you're looking at a situation where you don't want to see this virus be introduced into a hospital situation. So I totally understand that. But that's at a cost because you're having these real critical moments in people's lives, and then they're cut off from physical presence of their loved ones. And so that comes at a significant cost. We also have our youth who, when you move to distance learning, we're going to school, we're not seeing their friends as much, and they've had to really see some major changes in their life. So these are all really significant issues. These are all issues that we've got to face in a very direct way. And I'm glad that the folks are here today to have this discussion. We in this most recent legislative session, we really focused on a couple things, but one of them was Senate Bill 1326. The First Lady was involved with that. Chad was involved with it. Senator Simpson was involved with it. And it's really a comprehensive bill, number of issues, not just with mental health, but with child welfare. We had a lot of tough choices to make in the budget. As you know, the revenue situation is different than it was looking in January or February. I had to veto a record amount, $1 billion, but I tried to preserve the things that we really view as significant achievements. We talked yesterday at the State Board of Education about the increase in teacher compensation to make us number 5 in the nation for average minimum salary. I talked about doing some of the things we've done for waterways, very, very important. In this year's budget, even after the vetoes, we were increased mental health funding in K through 12 public schools by $25 million. So that's a total of $100 million. We have $5.5 million for youth mental health awareness and assistance training for school personnel, and $4 million for mental health services via telehealth. It's very important that we have this funding. It's critical, and we also worked very hard at breaking down some of the regulations that prevented there to be more telehealth and more innovation, and we want to continue to do that because it really is important. I'm going to turn it over to the First Lady, but I think it's really will be instructive about what's the call volume like with COVID? How is this affecting things? Seeing at DCF, how is it affecting veterans? Obviously, Dr. and Wilton. So I'll kick it over to her, but I want to thank everybody. We're going to have to continue. We're going to have to be on multiple fronts on this thing, and the mental health component is one that is going to be with us for a long time.
Yeah. Well, first of all, I want to say it's good to see you. Usually don't see them very often. He was out the door very early this morning, which he is typically. He missed a doozy on his way out the door because, if many of you may know, we have 3 children, 3 and under. So we have a 3-year-old, a 2-year-old, and a 4-month-old. So it's a little busy in the DeSantis household, and my daughter decided that she wanted to make a stroller parade. So I'm happy that we were here on time because my daughter was very particular about who got what stroller and what was on what. And, so being a parent, you get it, right? Everybody can sponsor themselves. But we made it here in one piece. And so But I just appreciate you guys taking the time to come here. I think this is going to be a great discussion. You know, I was talking to a friend the other day who is doing distant learning in another state, and she has 2 girls who are 10 years old. And I said, you know, how are the girls doing? How are you holding? And she told me, she goes, well, there's a lot of tears. And I said, oh, are the girls okay? And she goes, no. It was, and she's really having a difficult time. And so that's something to take into consideration when we talk about our kids. But we need to talk about the parents, and that everyone is enduring this crisis. And so there's no doubt about it that it's having an impact on our mental health. Before the pandemic, many of you may know that this was a passion I was talking about mental wellness and what does that mean for our first responders? What does that mean for our children? What does that mean for our educators? What does that mean just for anyone who just needs to find help? How do they do that simplistically? Now.
All right, so the audio, not the best right there. So we are going to continue on here on Fox 10 Extra and News Now. What we'll do is we'll take you out to the White House, live look at the briefing room where we're set to go in about 45 minutes here. In the meantime, we're going to take a short break. Then we're going to have Dr. Mike on deck with the latest on the COVID-19 pandemic and some updates along the way. We got you covered right here. We'll be back in just 2 minutes.
Our lives going forward. The pandemic has certainly speeded those things up. So I'm hopeful that, you know, with our children, that we can make sure that we're providing the right type of technology to where they can have virtual friends when they can't be in person. But I hope we get back to normal in a reasonable period of time. And obviously our pharmaceutical industry is doing a great job. Hope we may have a vaccine here in a few months. If you know, we're successful, Moderna's successful. And so we're looking forward to coming into the next legislative session with all of these things in mind, telemedicine, telehealth for our mental health, and to make sure that we can bring our children into some more of a stable and permanency. And then the ones that have permanency that just want to go, hopefully we can get those children back to normal, going to school, hanging out with them, and all those things are very important. And we really appreciate your help in these areas.
And Dr. Reeve from Tallahassee, I'll give you a little background on who he is. He's serving currently as the CEO of the Appalachia Center in Tallahassee. I think he's been doing that, now, for like 15 years?
15 years.
But prior to that, he was a senior psychologist at Bradley Hospital in Rhode Island. He also was a clinical assistant professor at Brown University. And Dr. Reeve, you have a bachelor from Tufts, master's, PhD from Harvard University. And I know this is something, recently you had a pretty big announcement partnering with the FSU University and your center to provide services to the community of Tallahassee for mood and anxiety. A couple of things. One, you've seen an uptick in people.
Welcome back, everyone, here on Fox 10 Extra. 10-day Foxcast looking like this. 110 degrees, pretty much going to be the same all along there. And you can see next week, early on in the next week, looks like we're getting a little bit below 100s, which is a very welcome sign. As long as we don't see any more of those 115-16s that we saw last week, I think we'll all be a little bit more happier about that. Hi, everyone. Mike Page here. Welcome back here on News Now, always bringing you the top stories from coast to coast. Right now, we're still waiting on Dr. Mike, so we'll give an update on that in just a little bit. He'll be on deck in a little bit later. But in the meantime, let's go to Capitol Hill. Speaker of the House, Nancy Pelosi, just a little bit ago.
The president has made so many bad executive decisions. We wish he would make a good executive decision and do that. Observing his behavior, I have concluded that he is like the man who refuses to ask for directions. All of the answers are there. The scientists have the answers. We know that testing, tracing, treating, distancing, masking, sanitation can stop the spread of this virus. And yet the president continues to go down the wrong path and refuses to ask for directions. Scientists who know better than any of us. So again, we observed that it was 2 months. In that period of time, 2 million more people, 2 million more Americans have become infected, for a total of 3.5 million people infected. Since that time, 50,000 more people have died, for a total of over 137,000. Tens of millions of people are still out of work, and UI benefits expire soon. And today we marked the 17th straight weeks of more than 1 million people filing for UI benefits. And we still don't have the needed testing and PE. And the president refuses to use the full power of the Defense Production Act needed for reopening our schools, reopening our economy, and the rest. So many people have said, I've had a test, but it's taken me at least a week, or sometimes 2 weeks, in order to get the results. You know why? Because there's not enough equipment. So many people have said, I couldn't get a test because I was not qualifying with a disposition or precondition, whatever it is, an impending operation. You know why? Because there isn't enough equipment. So why, for what reason does the president not fully implement the defense bill? And in hospitals and in places that are giving care to people, there is not enough PPE, personal protective equipment. There is not enough equipment. But we could have it if the president executed the Defense Production Act. We called for it in the CARES Act yesterday. The 14th. A number of our colleagues wrote to the Secretary of Defense and the Secretary of Health and Human Services and asked why was this the DPA, the defense, not in the way that was called for in the legislation. An assessment amount of each of the categories that we need: PPE, diagnostic, serologic, and other COVID test, treatment for COVID-19, other medical supplies and equipment, the list goes on. This is such a massive dereliction of duty. People are dying. And so what we are saying to the Senate, join us and the president to use executive action for good instead of ill, as he has done, and pass the HEROES Act, which, as you know, supports but let's just focus on what it would mean for our schools. Because across the country, the angst that people are reporting to us, children to school. What does the president do? The negative. We're not going to give you money unless you open up. No, you give schools, money to open up. And that is precisely what we do in the HEROES Act. We have $100 billion education stabilization fund specifically geared to the coronavirus. Quite frankly, with the time that has gone by and the attitude that the president has had, the negative attitude the president has had, we probably will need more money. We do have in the moving forward legislation that we passed, our infrastructure bill. We have another $100 billion for school construction. What was important even before coronavirus? It was about ventilation. It's about wiring. It's about getting rid of lead poisoning in the schools. It's about meeting all the needs of our students. We tell our children that education is important, that they must study for their own to reach their own personal aspirations and for the good of our country. But we send them a different message when we send them to schools that are not wired with the technology for them to learn properly and modernly, when there's lead poisoning that makes them sick and diminishes their capacity to learn. When the ventilation systems are such that it exacerbates the situation. And now, all of that exacerbated by the coronavirus. So if we add that, and then, of course, we have the resources to honor our heroes by supporting our state and local government. And much of what state and local government does is the education of our children. But they've had opportunity loss, their revenue loss because of the coronavirus, their revenue loss, their outlays of cost because of having to pay for coronavirus care, et cetera, has given them serious budget deficits. So let us honor our heroes by doing that. Let us open our schools and open our economy by testing, tracing, treating, isolation. I mean, these schools are saying they should be 6 feet apart, that's for sure. You're going to need fewer people in the classroom, so you need more space. Therefore, you need more teachers. And the president is saying, if you don't open up, we're going to deprive you of the 8-point-something% that the federal government provides to state to schools in our country. State and local do over 90% of it, and they have, again, serious budget deficits because of the coronavirus. So again, we need the DPA to open up schools, to open up the economy, and we need to help America's families. Actually, if you put it all together in our two packages, we have $230 billion specifically for the schools. And then we have nearly $1 trillion for state and local government, which I remind you is 1/2 of what they gave away in their tax break. 83% of the benefits going to the top 1%. So in any case, Mr. President, admit it, you've gone down the wrong path. Ask for direction. Ask for direction from our scientists who know better. They knew better. As we urge the President and the GOP Senate to get on it and help the American people, help our state and local governments by honoring our heroes, open up our economy and our schools by having the equipment needed to do it and the funds to facilitate that, put money in the pockets of the American people. The time is running out on that. This is drastic. I know we keep saying this over and over, but it still persists. And the clock is running out on it. But as we urge them to do that, House Democrats are still working very hard for the people. This week, the Appropriations Committee has been marking up the fiscal year 2021 legislation, put it on track to have passed legislation to fund 96% of the government in July. For the second time in 2 years, we have been on schedule. We will pass those bills next week. They're being marked up this week and last week. We're holding nearly 30 hearings and markups, as we are here now, across committees, including Energy and Commerce markup yesterday, at this time, some of it yesterday, 30 health-related bills and hearings on COVID relief and vaccine pandemic preparedness, environmental justice in the era of COVID, and much more. So we have a lot going on. We will be taking these votes to the floor next week to be on schedule to meet the needs of the American people. And again, the clock is ticking. The unemployment insurance will run out by the end of the month, even before the end of the month. We need to have the direct payments to people. But on the subject of the kids, you know, I'm a grandmother, a mom, 5 kids, 9 grandchildren, all ages. The youngest one is in public school in San Francisco. We're very concerned, not only for her, but for her classmates. They don't all have all of the technology that would be needed for distance learning. All of them, many of them go to school for meals. Now they go to school to learn, but they get their food there. And so with all the concern that we have for all children, we have to make sure all of that is in place, but that's a situation that's replicated across the country. And so instead of threatening schools, instead of the Secretary of Education saying children should take risks, astronauts take risks. Oh, really? Oh, really? So in any event, this is personal. It's about our children. And at the very least, the president could say we're going to have the equipment necessary. Any questions? Yes, ma'am.
Madam Speaker, you're talking about spending billions, if not trillions more
Yes.
money on this bill. You and Mitch McConnell still have not agreed on a chair for the oversight of this money. What's the holdup?
We had different suggestions about it, and we came to a conclusion about an excellent person, and he agreed. But there's some process in the Senate, which I was not aware of, that takes a lot of time, and that was a deterrent for the person staying on board that long.
General Dunford?
Yes. Yes.
So who's your second choice?
Well, I've proposed someone to the leader, and we'll see if he accepts. But I won't be announcing it right here. But this is, it's a funny thing. You would think it should be the easiest thing in the world to come to such a conclusion. And I was particularly proud that General Dunford was interested in considering this, because I do think that a person of his stature and in the military, person who knows how to manage things, a leader, completely apolitical, would have been the perfect person. I just don't know, how the word got out about him before there was an announcement, which then made, well, what are we waiting for? Part of the issue. So I would hope that we would have somebody. There are plenty of people in the military who would, I think, be willing to exercise their patriotic duty in an apolitical way with their management skills and the rest, and that's what I'm hoping will happen. Yes, sir.
Do you have any contact with anyone in the administration over this next package, coronavirus package?
Everything in this package, except for, say, 95% of what is in this package, is what we have had in previous bills. So nobody is being asked to vote for something they haven't voted for before. The one thing that is different is they have resisted in the past any strong OSHA standard. And that is absolutely essential for us to have to protect our workers at all times, but an intense a strong, even stronger one at the time of coronavirus. So they know what they have to do. There is another piece that they have resisted that is very urgent now. They resisted in the CARES, but very urgent now, and that is the assistance for renters. The moratorium is going to end or has ended in some places, and we really need to get that assistance. And that, not only do we have it in the HEROES Act, but a couple of weeks ago, we passed it on the floor of the House as a separate bill. $200 billion, $100 billion to help with renters, $75 billion in addressing the mortgage forbearance, foreclosure forbearance issue, and then the rest of it for homelessness and special rural housing programs and the rest. They really have to do this. This is very, very urgent. Now, that would be something they haven't voted for before, haven't supported before, as well as they haven't supported a strong worker protection OSHA standard. But other than that, they've supported state and local government. They've supported testing. They've supported direct payments. They've supported unemployment benefits. One time they even supported food stamps. they've resisted since then, even though people who've never been to a food line before, a food bank before, are in long lines to get in. You would think they'd have some sensitivity on emergency food initiatives, including SNAP, the food bank. So that would be one where they have resisted, but they have voted for it before.
But have you spoken to Meadows or Mnuchin or anybody in the administration about what their feeling is?
Well, we have conversations on individual things, and Republican senators have approached me about individual things. They know there's going to be a bill, and we first it was going to be no bill, and then it was going to be some little bill. Now it's 1.3. It's not enough. It's not enough. And when they say it's too expensive, how can they say such a thing when right now the Fed is just propping up the stock market? Stock market looks good, huh? Well, federal dollars are helping to make that happen. And that's okay. And that's a good thing for the economy. But we should have trillions of dollars to prop up workers. We've never seen anything like this. So on one subject or another, but it also just gets me that they say, oh, it's too expensive. $2 trillion, that's what they added to the deficit to pass their tax scam a couple of years ago, which gave 83% of the benefits to the top 1%. I mean, they're like in a caste system mode. Whatever we can do at the top, that's what we really like to do. Perhaps it will trickle down. If it does, that would be good. If it doesn't, as they have said, so be it. But we have to make the fight, and we know that it will happen. They have to do unemployment insurance. Democrats and Republicans across the country are calling out for them to do the state and local. Republican mayors and county executives, governors, they need that money. They have outlays for coronavirus, and they have revenue loss because of coronavirus. So they'll be there. Yes.
Thank you, Madam Speaker. The administration and some Republicans are proposing the idea of back to work, return to work bonuses for employees. What's your thought on that, and would you consider including that in the next bill?
I don't know if they know what they're talking about, so I can't really thoughtfully address what you just asked. But I will say this, testing. People do not want to risk their lives and that of their families by going to work that isn't safe. We can open the economy if we make it safe for people to go back to work. Are they going to pay people to risk their lives without any OSHA standard and the rest? People are not staying home. They want to work. They want to go to work in a safe place. So the direction that the president should be asking for is how do we open our economy to make it safe for people to go to work? And it is so self-evident. Anybody? Yes, sir.
Madam Speaker, I have a question, and I have a colleague who has a second question, if you'll allow for that.
Is that person here?
No, they're not able to be here. One per outlet.
Well, that's up to the rest of you. Do you want somebody who isn't here to have a question before you do? Yes,
my question is just that, a few months ago, it was hard to predict that we would have such severe spikes, I guess, now in July. Other countries clearly have handled this in a way that we have not. Moving forward, if in the next couple of months we still don't have a full grasp on it, is there a point where trillions more in stimulus just becomes unsustainable?
No, I mean, the point is if we don't invest the money now, it'll be much worse. If we don't invest in further testing and getting the equipment to do it, it will be worse. If we don't put money in the pockets of the American people with our direct payments and unemployment insurance, it will be much worse. If people are being fired at the state and local level, being healthcare workers, transit workers, teachers, sanitation workers, and the rest, it will be much worse. So this is what is about survival of our economy. And it is about spending the money in a way that brings us back. And don't take it from me, the chairman of the Fed, he even recommended state and local. He said, I call to Congress's attention state and local government. Really? We already have it in the HEROES Act. The Secretary of the Treasury knows that we have to do more to prop up our economy, or else it will be worse. It will be worse. Your next question.
The president today is going to be talking about how his administration has been rolling back regulation over the past 4 years and helping Americans rise out of poverty. He's doing that from the White House today. I don't know.
I'm sorry, I don't know what he's doing today. What's he doing today?
Today, the president is supposed to be talking about his administration rolling back regulation and helping Americans rise out of poverty.
Okay. I don't know what he's doing, but I want to tell you something. What he did this week in terms of NEPA and what Richard Nixon put in place to protect our environment and therefore the good health of the American people. Oh, some of the, shall we say, polluters were saluting it, but it was the wrong thing to do. So I don't know what specific danger to the environment or the health and well-being of America's families and workers he's considering today. But if it's anything like what he has been doing, that's most unfortunate. But I'll tell you this, he's done a lot of bad things, but nobody, you can't tell whether it's methane or mercury or what he's doing to the environment once or twice a week, terrible things that have an impact on the health and well-being of the American people, the air our children breathe, the water they drink. But what does he do but say, I got beans on my desk, and that's what people cover, instead of the danger that he is proposing to our country and his administration. He has the henchmen of the polluters in his cabinet, always has, and he's implementing an agenda that's he's going to rise up people from poverty by making them breathe foul air. I don't get it. Yes? Anyone else? Yes, sir.
On unemployment, you mentioned that the benefit is going to end even before the 1st of August, the way that the system is structured. And yesterday you seemed to indicate some flexibility on the $600 figure that had been a demand of the Democrats. What would be an appropriate replacement for that $600 figure if you were to reduce that a little bit?
No, I'm all for the $600. But again, what I said was the whole package will depend on the what we do also for direct payments, which are so essential. It may be hard for them to understand why they're so busy giving 83% of the benefits to the top 1% in our country, that people really do need this money. Baby needs a pair of shoes. This is urgent. They need to buy food. These are necessities. And when people use that money for necessities, they inject demand into the economy and create jobs. So it is a stimulus, but it's more than a stimulus. It is a necessity right now. So when they're giving away all this big money and they worry about $600 for families who need it so desperately, it just makes you wonder, who are they here for? I always say, I haven't quoted him lately, maybe I have, St. Augustine. 1,700 years ago, 17 centuries ago, St. Augustine said, any government that is not formed to promote justice is just a bunch of thieves. This is about justice. It's so hard for people. They have so many challenges. Fear of catching a virus that could be deadly, but nonetheless debilitating, and have pre-existing condition challenges for them as they go forward. Economic insecurity that they have, uncertainty about their children going to school, and is that safe? While the president is threatening to take away money from the poorest kids, by the way, in many cases, Title I, funding for children in economically disadvantaged areas. Separate from that, but including some of that, children with disabilities, homeless children. That's a chunk of what the federal government puts into it. So we're at a moment of making a judgment. Where is justice? Where's justice in the environment as they roll back environmental standards of clean air, clean water, which affect communities of color in a disproportionate way? Where's the justice of taking away funding from many of the poorest kids or children with disabilities to act like a big guy? Where's the justice in not having the testing of the coronavirus so that we can see, and the statistics, the data, so that we can see the disproportionate impact that it has on people of color, and it does? Where's the justice of them taking down the website, practically, I understand, of CDC so that we can see what the challenges are to hospitals and the rest, and then saying we're not going to have people report to the CDC, a scientific organization. We're going to have them report to the administration. And where is the transparency? What are they going to tell us about that? In one of the bills, the second PPP bill, when we put more testing in there, we required that they would have collect the data and report the data as to how especially communities of color were affected, because we didn't have much of that. And because that's a place where there hasn't been a commensurate amount of testing. The Hispanic community and the African American community. We're all Americans. We're all Americans, and everybody, and all of our children are important to us. All of our people are. And because we are Americans, we're going to beat this. But we have to beat it scientifically. And in order to do that, you have to believe in science, and you have to believe in governance. Now, our friend who asked the question about how they're going to lift up everybody out of poverty by taking away regulations probably would not like me to hear me say that they don't believe in governance. If you don't believe in governance and you don't believe in science, you don't want to do anything, and you don't have to because you don't have the data that you accept. So we're in a very critical place. I yearn for other Republican presidents. While we may have disagreed on many points, at least we had a shared commitment to the governance of our country. Richard Nixon signed the NEPA legislation. So in any case, I said yesterday, we're at another critical point, but this is getting to be, as I said to you, look at all the number of people. 50 million more people have died since they haven't taken up the bill, and a large number more have become infected. Let me see. Next week, though, we're going to have some 137,000 since we passed the bill. 137,000 are dead now, but 50,000 added to that, and then 2 million more people infected, adding to 3.4. But let me just tell you, next week, what you're going to see, we're going to have child care bills on the floor to ensure that parents can go back to work and child care workers can keep their jobs. This is very important and a very high priority for us. And then we're going to have the Great Outdoors Act, a bipartisan bill that passed the Senate, and we will be protecting our natural heritage with that, and then honoring our values with the No Ban Act. We'll be passing the No Ban Act and access to counsel act. So we have a number of things, including we're going to be passing bills next week or the next about removing statues from the Capitol of people who have committed treason against the United States of America. So we're busy, we're full, but nothing more important than the lives of our children, and their ability to go back to school, which we all want them to do, and they want to do, and teachers want them to do, and parents want them to do, but they can't do it if it isn't safe. It can be safe if the president executes the Defense Production Act to make sure it does. Thank you all very much.
Everyone on coronavirusnow.com, we are awaiting. Supposed to be in about 15 minutes. We'll see if that comes out. Let's go back out to Florida while we wait.
A lot of people in the state of Florida never contracted the virus. Maybe don't even know anybody who has. And so maybe have had no personal impacts at all in terms of the actual illness, but who have been profoundly impacted with the changes, that have occurred in society. You're worried about a paycheck. You're worried about kids. You're worried about family members. There's a lot of anxiety out there. And I think that folks hear that. I understand that. And that is something that we're going to continue to put a lot of attention on as well. Now, we need folks to be able to be on their feet. We need people to be able to be productive. We need our kids to be able to have opportunities to grow and thrive. All of those are very important. And the effects that we've seen over the last many months in dealing with the pandemic, have been significant. And yes, they are more indirect, but they're very real nonetheless. And they're problems that deserve our attention. And we're here to do that. And the mental health is just one part of it, but it is a big part of it. And it is a part of it that is likely to persist in the months and months to come. So thanks everyone for being here. With that, yes, ma'am.
Martha Sadie, WFLA, thank you so much for being here, Governor. Governor, I get that there's a lot of data. The Department of Health just realized that dozens of labs are not reported negatives. One, specifically, who is in charge of checking the data? And two, if something so simple is overlooked, how can we trust the rest of the numbers?
So here's the thing. When people are doing the test, the labs report it into a system, okay? So you may run 1,000 tests, and you may report 100 positives. If you have 5 extra positives that you don't put in there, that's really on the lab to comply with the law.
Welcome back, everyone, here on Fox 10 Extra and coronavirusnow.com. I'm your host, Mike Page. Always great to be here with you as we continue to roll on throughout the day. Right now, let's go out to Fox 29 in Philadelphia. We have Dr. Mike on deck with the latest on the COVID-19 pandemic. Let's get it going.
Dr. Mike Sferigliano with Penn Medicine joining us out of Philadelphia. Good to see you, Dr. Mike.
Always a pleasure, Thomas.
Here we are, midsummer. Health leaders, though, are looking ahead, and they're warning us to prepare for winter COVID-19 now. Is the worst yet to come?
Well, it is for people like me, Thomas, because what we're going to do in the fall and the winter is add into the mess of COVID-19 the flu, sinus infections, other kinds of infections. There's a cornucopia of upper respiratory illnesses that usually plague people like me throughout the winter. And then you throw in COVID-19, and what we have now is a party. Okay, so it's going to be wild, and hopefully everyone will heed our warnings, get their flu shot, so that at least the majority of people will be somewhat protected from the routine stuff like influenza.
A couple of months ago, we were looking at the summer heat possibly to kill the virus. Looking ahead to the winter months, are there concerns that the virus perhaps could last or survive longer in colder conditions?
Well, we know for a fact, Thomas, that the virus does seem to be affected by climate somewhat. What we are concerned, though, typically in the winter is people being closely associated and indoors in inclement weather. So when it's cold, people tend to stay inside, and that leads to an increased risk of transmission. So that's the theory there. Even though many things have been shut down and we hear about restaurants opening and closing and limitations. Sure. The fact of the matter is that when it's nice outside, lots of people go outdoors. Then you throw in the opening of schools, which typically adds to the risk because you have all of these kids intermingling, and then they bring things home and spread viral infections at home. So it's going to be a wild time in River City, I can tell you that.
How are hospitals preparing for a possible second wave?
Well, I think that we are better prepared in terms of readiness when it comes to personal protective equipment and ventilators, things to that nature, or things of that nature. The thing is, Thomas, that you can never really be prepared for an ultimate surge. If things get out of hand, no matter what, you can only stockpile and prepare so much before you get overwhelmed. And so that's where we need to be concerned. The good news is typically things like the flu, other more benign coronaviruses, rhinoviruses, the other typical run-of-the-mill things don't lead to large numbers of people needing ventilator support. So that's good. But I think we'll be more prepared than we were in the springtime, but any system can be overwhelmed.
I know, that's why you stressed the flu shot could help eliminate that stress on the system here. I want to look at a couple of studies that are out. Actually, there are more reports out that show younger people, Dr. Mike, are developing blood clots. What's causing this?
Well, we know for a fact, Thomas, that this virus tends to infect and damage endothelial cells. These are the cells that line blood vessels. And what we think happens is that they damage those cells, leading to an increased risk of blood clotting. Also, when you have lots of inflammatory markers, inflammation in the body, that can also lead to an increase in clotting. And so many people who are hospitalized on ventilators have evidence of microemboli. That's where you have little blood clots in the lungs, and that's thought to add to the pulmonary problems that we see. Some people are being anticoagulated, especially if they were really sick in the hospital for a period of time. I have a number of patients who were very, very ill and put on blood thinners. One in particular had a stroke. Same theoretical concerns. There could be a blood clot. So these people are being anticoagulated and then being monitored even after they are off the ventilator and doing better.
So on that note, what exactly is the virus doing to the lungs, and at what point are you placed on a ventilator?
Thomas, what happens with the lungs and this virus, it tends to cause an inflammatory type pneumonia. It's not a bacterial pneumonia. It's not something that's caused by a bacteria. This is purely the virus. And the thought is that there's the initial attack of the virus, but then the body has what's called a cytokine storm. And in some individuals, there's a tremendous inflammatory response. And there are characteristic findings on scans of people with COVID-19 pulmonary issues. There is what we call ground glass opacities. You see these changes in the periphery of the lungs. And that is fairly dramatic in some people. And that it leads to low oxygen levels and a significant difficulty in keeping and maintaining blood oxygen levels, requiring people to be put on a ventilator.
Low oxygen levels, is that what's causing the hallucinations as well? I know hallucinations are also being reported.
Well, hallucinations can be caused by many, many things. We know that the virus can cross the blood-brain barrier and can cause some issues with mentation and even depression. So that's one possibility. The other possibility is that people, when they get very, very sick, they're in an intensive care unit and they can get ICU psychosis. That's another possibility. But when you do get very low oxygen levels, you also have changes in mental status. So there's a multitude of reasons why people would have changes in their mental status.
We've been talking about testing now for several months. How would you grade, Dr. Mike, our overall testing capabilities right now?
Well, they were a D. I would say that they're at best a C+. All you do on the news is see these lines all over the country where people, it goes for miles to be tested. In many cases, it takes up to a week or two to get the results. Now, not to brag, but my institution has been able, when one of my patients is sick and I'm worried about it, I will send them for a test, and believe it or not, the next day, the results come back. So there are glimmers of hope, and there are institutions and entities out there that are really making it happen. But for the most part, if you go to a location, it may be up to 10 to 14 days before you get a result.
Certainly discouraging in some parts. I know there's been talk in the administration, Dr. Mike, about pool testing. What does that mean?
Well, pool testing, Thomas, is where you can actually get more bang for your buck, if you will. So say you have 100 employees in a factory or something like that. What they'll do is they'll take 10 people at a time and get all of the samples. It wouldn't be for individual people, but those group of 10 will be tested. And if any of them are positive, they will bring those 10 people back and then individually test them. So if they are all negative, then that group moves on. That means the whole group was negative. So it would be a way to more effectively and efficiently test more and more people and in small groups. And then if there is a positive test, go back and individually find out which one of those 10 people were positive. So this might be a way down the road to efficiently and effectively, say, for instance, test a company's employees to see if anyone is asymptomatic and positive.
Interesting. Let's stay on testing for a moment. Is it worth the time and money right now to get an antibody test when we still don't know about long-term immunity?
Well, Thomas, I really have gotten to the point where I'm discouraging people from getting antibody tests. I mean, it's one, with all of the most recent data, we don't know how long an antibody will protect someone. And there's some research indicating that it may only be up to 30 days. So we don't know. And my fear, Thomas, is that it may give people a false sense of security. So that's the bottom line.
As we return to work, how concerned should we be about possible exposure through the ventilation systems, the airborne transmission here? I know one Harvard researcher suggested that we should be taking a closer look at our air conditioning in the buildings.
Well, this is a matter of great debate. The World Health Organization basically said, look, we need to look into this some more. There are researchers who believe that the virus can be aerosolized up through ventilation systems. And there are studies of restaurants, for instance, where if you and I are at a table in one part of the restaurant, there have been studies where if one of us is positive, then that virus gets through a ventilation system and goes and infects people at a table almost into the adjoining room because the ventilation system blows air that way. So there's a lot of gnashing of teeth, if you will, about that. So yes, I think there's lots more to be done in terms of research, looking at how we handle buildings and how we handle people. Now, one of the things that I am experiencing, lots of people are working off-site. Many people, I think it's going to be a permanent change. And that has some pluses to it. One, they don't have to get in a car. They can improve the environment of the planet by decreasing carbon monoxide and all of that by not having to drive and commute to work. So that's one issue. The other issue is we really need to look at how we can do better with air quality in buildings and, for that matter, even airplanes. How can we effectively rid that air, especially if it's recirculated, from circulating virus?
And until we get to that point, let's talk about mask here. I know there's still much debate about whether or not to wear a mask. As we move forward, if everyone wore a mask, Dr. Mike, along with social distancing, how much of a dent would that make?
Tremendous dent in this. Some studies say by as much as 75%. I mean, the bottom line is, Thomas, that if everyone did their duty, in my opinion, wore a mask, believed in the concept that the virus is real, the virus is a virus, and if you wear a mask, a well-prepared mask, that being 2 layers of high thread count cotton or different materials on your face, you reduce the transmission of virus from feet to about 2.5 inches from your nose. So that would be a dramatic improvement. So everyone needs to wear a mask.
As we navigate down this road, Dr. Mike, what's your biggest worry, your biggest concern?
Well, we're seeing my biggest worry right now, Thomas, the fact that many people don't take this seriously. Just yesterday, I had a patient come in who believes that this is all a hoax. It's not real. It's not, it's fake. It's made up. It's political. And that worries me because people just don't get it. This is a real thing. It is a virus. We are in a pandemic, the likes of which we have not seen since 1918. And the bottom line is we all need to take it seriously, of all ages, of all socioeconomic backgrounds. And if we do it right, we will get through this. But what we're seeing are large numbers of people who don't think that this is the big thing. It's not a big deal, and they're being very cavalier about it, and it's harming people. I had another patient, Thomas, who had a daughter who went to the shore, came back after being at a party, and guess what? Her mother now, who is my patient, has the virus. And so that has sent a trickle effect. Now we have to worry about the young person's father. Now we have to worry about everybody that he works with. It goes on and on. There are tremendous ramifications from the actions of a few.
On your previous thought, I'm curious, what did you tell your patient?
Basically, I told my patient that, look, you need to talk to your youngins, if you will, and make sure that they know that if they go away to beaches and parties and things and take this cavalierly, it can have great ramifications. My patient, who's now positive, is self-quarantining for 14 days and checking their oxygen levels and their temperature and calling me every day. If they start to get worse, their oxygen levels go down, then they will be forced to go to the hospital and be monitored and possibly, God forbid, end up on a ventilator. Regarding my patient's husband, who is also my patient, they're being tested today. This all went down yesterday, and we shall see.
For those who are self-isolating at home, how do they check their oxygen levels?
Well, Thomas, I'm a big fan of these little pulse oximeter devices, which are readily available and very inexpensive. And what you do is you buy them, you put it on your finger, and it measures your oxygen level. Now, they're not 100% accurate, but they give us a good idea of where you stand. It's almost like a home blood pressure monitor. And I had two patients who were monitoring their oxygen levels. They were going along okay, and then all of a sudden, about 7 or 8 days into their illness, their oxygen levels went down. I sent them to the hospital, and they ended up on a ventilator later that day. They are both alive, Thomas. I believe that that saved their lives by doing that. And what happens with this virus, you can go along and appear to be talking and no problems, but your oxygen levels are very dangerously low. So for that reason, I think it's a good idea to not only have a good thermometer at home, but also a pulse oximeter, which you can buy at drugstores, online, all over the place.
Could make a major difference. All right, Dr. Mike, our daily advice on staying safe?
Well, Thomas, as we just mentioned, we need to deal with this as we are all one. And by the way, we are. We are all on the planet. We're all dealing with a pandemic, and we're all at risk. And even if you're a young person and you are impervious to all of this, you need to realize that your actions can have serious consequences. So let's take this.
Welcome back, everyone, here to News Now, Fox 10 Extra, and of course, coronavirusnow.com. We're taking a live look at the White House briefing room, where we are expecting at any moment this briefing to get going. And of course, we will show it to you in its entirety right here on News Now. It's 11 o'clock here in Arizona, 2 o'clock out in D.C. as we get rolling in the next hour here of News Now. I'm your host, Mike Page. Always great to be here with you. As soon as I see Kaylee, we'll bring it to you right here on News Now. In the meantime, everybody, let's go back out to Florida. It looked like the governor was taking some questions there moments ago, and we'll get you that roundtable discussion while we do wait for this briefing. If it happens during it, we'll go right to it.
Terms with, and quite frankly, they're going to be with us for a long time. One I've talked about, and pretty much every physician you talk about around hospitals in the state of Florida will talk about the alarming decrease in people in March, particularly March and April, of people who were going to the ED for heart and stroke symptoms. Whether that was out of fear of catching coronavirus, whether it was a belief that there weren't going to be medical services, that has basically allowed some conditions to worsen. And so now you look in ICUs, you have people with those conditions now in Florida and across the country who are in more critical condition than they probably would have been had they gotten the care. So the message from those hospitals and from me has been, if you have those, you do need to get care. You also look at what we've done to do things like protecting our nursing homes. We were one of the first states to not allow outside visitors into nursing homes. We feared the introduction of the virus into a population which is by far the most vulnerable to COVID-19. And I think we had to do that. But we also have to recognize that that comes at a significant cost in terms of mental well-being, family connection. Now, we in the state, and I know other organizations have tried to lessen that by providing things like iPads so that the residents can speak to their family members, and I think that that's good, but that has been a really significant price to pay. You also look at hospitals when people are in the hospital, not being able to have family members come in many hospitals. I mean, I've encouraged to try to have the visitation because I think it's important, but you're looking at a situation where you don't want to see this virus be introduced into a hospital situation. And so I totally understand that. But that comes at a cost because you're having these real critical moments in people's lives, and then they're cut off from physical presence of their loved ones. And so that comes at a significant cost. We also have our youth who, when you move to distance learning, we're not going to school, we're not seeing their friends as much, and they've had to really see some major changes in their life. So these are all really significant issues. These are all issues that we've got to face in a very direct way. And I'm glad that the folks are here today to have this discussion. We in this most recent legislative session, we really focused on a couple things, but one of them was Senate Bill 1326. The First Lady was involved with that. Chad was involved with it. Senator Simpson was involved with it. And it's really a comprehensive bill tackling a number of issues, not just with mental health, but with child welfare. We had a lot of tough choices to make in the budget. As you know, the revenue situation is different than it was looking in January or February. I had to veto a record amount, $1 billion, but I tried to preserve the things that we really view as significant achievements. And so we talked yesterday at the State Board of Education about the increase in teacher compensation to make us number 5 in the nation for average minimum salary. I talked about doing some of the things we've done for our waterways, very, very important. In this year's budget, even after the vetoes, we were able to increase mental health funding in K through 12 public schools by $25 million. So that's a total of $100 million. We have $5.5 million for youth mental health awareness and assistance training for school personnel, and $4 million for mental health services via telehealth. It's very important that we have this funding. It's critical, and we also worked very hard at breaking down some of the regulations that prevented there to be more telehealth and more innovation, and we want to continue to do that because it really is important. I'm going to turn it over to the First Lady, but I think it's really will be instructive about what's the call volume like with COVID? How is this affecting things? What are you seeing at DCF? How is it affecting veterans? Obviously, the doctor and Wilton. So I'll kick it over to her, but I want to thank everyone.
All right, folks, we do still wait right now for the White House briefing. That was the opening statement from the governor there of Florida, but I want to see when he was taking the questions as well. Let's go back to that.
Have been significant, and yes, they are more indirect, but they're very real nonetheless, and they're problems that deserve our attention, and we're here to do that. And the mental health is just one part of it, but it is a big part of it, and it is a part of it that is likely to persist in the months and months to come. So thanks everyone for being here. With that, yes, ma'am.
Martha Sadie, WFLA, thank you so much for being here, Governor. Governor, I get that there's a lot of data. The Department of Health just realized that dozens of labs are not reporting negatives. One, specifically, who is in charge of checking the data? And two, if something so simple is overlooked, how can we trust the rest of the numbers?
So here's the thing, when people are doing the test, the labs report it into a system, okay? So you may run 1,000 tests and you may report 100 positives. If you have 5 extra positives that you don't put in there, I mean, that's really on the lab to comply with the law. So the positives they're used to doing, what we've seen because of some of the backlogs is sometimes they want to get the positives out because obviously that's important, and then the negatives get backlogged. Now sometimes they'll do a big negative dump, and sometimes, as we've seen on some of these, you may not see. But it's not the Department of Health per se. It is the labs that are inputting this, and some of those labs on there have inputted under multiple different entries. And so obviously I want every single thing reported perfectly by the labs, but as we've seen in this process, we have a system, and the state's only doing, we do some testing, the hospitals do a lot of testing, there's a lot of testing going on. That stuff gets sent, a lot of it's the commercial labs. Our state labs can do stuff, but they only do a limited bandwidth, we're trying to expand it. So you do that, and you'd like to get the results back timely. I announced yesterday, we're having to sever ties with one of the labs because they weren't getting us, the patients weren't getting the results back in a timely fashion. So we're working with one, that can. And so that's what you're trying to do. But I would say anything that's being reported from the labs, yeah, there may be negatives backlog. We've seen that before. We had in the second or third week of May, I remember, we got like 60,000 negatives dumped, and those negatives span the previous 6 weeks that had been done with some of the major commercial labs. But that is not the state running those labs. Those are those labs doing it and then either complying with the law or not complying with the order.
Who's checking the state's report? These are the numbers that are not accurate. It's your report.
What do you mean, which numbers aren't accurate?
So everything that I've highlighted in yellow, these are labs that are...
All right, well, let's just, I get what you're saying, but let's just be clear. You shouldn't put an impression in the public that somehow, if people are tested positive, hospitalization, fatality, that somehow that's like wild. What you're talking about is labs reporting positives and then not reporting all the negatives, okay? And the negatives are important, and that is something, but it's not throwing off the general disease prevalence or any of the things else that we're talking about. So obviously, I want all the negatives there. That's better to have more negatives, and so I certainly would want to do that. But I also know that there's just a lot of labs throwing in a lot of information into the system. It's their responsibility to do it. They are required under our binding orders, and I think that they should be doing it. Yes, ma'am.
Jen Titus, the CBS affiliate from Tampa Bay. Looking at today's data, Governor, the state percent positive hasn't seen a daily rate under 12% in 2 weeks. It's showing our rate of testing isn't keeping up with the rate of infection. Are you considering rolling back more counties to phase 1, like Hillsborough County, which has the fourth highest number of cases right now in the state?
So I don't think that that's actually true. When you look at the percent positive, obviously, if you're retesting, those are not ones that really should be. So if you look, 7-9 was 12.7, then 12.6, 11.2, 11.5. We did have 15.
On the 13th, we had more than 18% that day.
15%. Yeah, it was 15%. Yeah, you're counting the retest. You're counting the retest, which is fine, but...
We aren't testing as fast as the infection is spreading?
Well, no, I think what you're seeing is, you're seeing 2 weeks ago, we were pretty much at that 15, 16% positivity. And again, you look at the report, look at the last bar on that report. Those are all that doesn't include retests if you're testing multiple times, because that obviously doesn't impact disease prevalence. If you're positive and you're testing to get out of quarantine and you pop positive 3 more times, Well, that's not a good barometer of disease prevalence. So these are the ones to try to do that. So we were in the 15 all the way up to 18, and then what we've seen in the last 4 or 5 days has been more in the 11 to 13. We did have one day at 15. So I think at a minimum, that's a stabilization. We obviously would like to see, I think if you take out Miami-Dade and Broward, you do see a gap for the rest of the state. Miami-Dade has been, about 20%, have been positive very consistently. It's obviously an issue. I was down there meeting with all the local officials. We want to, work with them as best we can. But there has been a stabilization on the percent positive. It is a little bit lower this week than it was last week. Obviously, we had all of May and the beginning of June, we were under 5%. And that's where we want to be. I think we'll get there, but it's going to take more work going forward. I would also say that the percent positive is important. If you look, we had 116,000 test results today, so that's an incredible amount of test results. That's more than the country was doing if you go back into like the middle of March on a daily basis, and we're testing at a clip that nobody thought we would ever be testing at. And so it's just important to know. And I think consequently, you have more disease prevalence, obviously, than you did at the beginning of June, because we see that in the syndromatic indicators. But at the same time, we are capturing a higher percentage of the infections. You go back in March, you had to be symptomatic and usually a certain age to get a test. So there were way more people who were actually infected who never even got tested. Now we have mass community-based testing regardless of symptoms. So I do think that we are capturing a larger share of the people who are actually infected. There's still more above and beyond that, but I don't think it was like at the beginning of April where for every one case, there were probably 10, 15, or 20 times as number of infections. And so I think that, and then if you also look at the syndromatic indicators, the ED visits to ED for COVID-like illness, we've seen that decline over the past week, and in pretty considerable decline. So that's a good sign as well. So we're working with all the localities, but I do think you've seen stabilization in the Tampa Bay area in terms of their percent positive. Yes, sir.
Steve McConnell, Tampa Bay Times. More and more the science is suggesting that the people who are thought to be asymptomatic have long-term health effects that we're just only starting to understand. And the Palm Beach Health Department said that they're really concerned that there might be these issues in children that we don't understand. And today it came out that...
Well, which science are you referencing?
There's long-term lung damage.
I know, but which science? Has there been a study done on that?
There's been multiple reports that have come out.
Well, report, but has there been a study, a peer-reviewed study on that yet?
I mean, this is just what we're hearing from medical experts.
Okay, well, we hear a lot of things. So, but is there? But no, you're putting something out that there's going to be long term, and I obviously can't say either way because I don't think we have enough information. But is there a scientific study, or is it just some people surmising that it may be? I'm just trying to get the basis of the question.
It's something that we're hearing more and more from public health experts. I don't have a specific study to name, but I'm curious if that is something you're hearing from your public health experts.
Well, so basically, I think the answer is you can't rule anything out, but you also nothing's been substantiated in that regard. So it would be irresponsible for me to say there'll never be any long term because we just don't know. But I think it's also problematic to say in 20 years there's going to be all these problems when we just don't know that. And so I think that's something that remains to be seen. This is obviously not the same as other families of coronaviruses. Influenza can have some impact as well. So I certainly wouldn't rule it out, but I don't think that's been substantiated. So I just think that the public should be understanding where this is right now in terms of this, and really focus on actual facts as they come in.
Well, if I could follow up and ask this then, if the unknowns about the virus, how do they factor into your long-term strategy for controlling and containing this? When there is so much that we still don't know about it?
Well, we know a lot more, I think, than we did a few months ago. I mean, I think that, I think we have a better sense of the transmissibility. I think we have a better sense of the groups that are the most at risk. I think we know some of the environments where you've tended to see outbreaks. And so as that comes in, you obviously put that into practice. I mean, I think that Initially there was a lot of concern about touching things, and I'm not saying you don't keep things clean, but I think if you look at the transmission, I mean, it's the respiratory droplets in close contact that is doing the lion's share of these infections. And so we kind of understand that now. We understand, the enclosed environments. We understand all these things. So you got to, obviously, as new things come down the pike, you've got to consider that and do things accordingly. Yes, ma'am.
A question about remdesivir. We're hearing all these shortages, these hospitals across the state. Sarasota Memorial Hospital just told me on Monday they're not getting their next shipment in until July 28th. Baycare is saying the same thing. Their hospitals are seeing these shortages. And Marco Rubio just tweeted that there is a bad disconnect 3 hours ago, he said, between what the federal government thinks we need and what we actually need here in the state of Florida.
So we heard that from them, and I spoke with the White House, the Vice President, and so the recent shipments were expedited. Those were not actually supposed to be there, I think, until the end of this week. So we're able to do that. And then I spoke with the Vice President last night about the need to continue to supply. So he understands it, and he understands, and basically I think his thought was, look, we're looking at Southern California, Arizona, Texas, and Florida as kind of the priorities on this. And so I do anticipate, that we'll be able to get it. We obviously said we want to get it as soon as possible. Their advice, I think, is, we did have some treatments of it where you were going beyond the 5 days, which obviously uses up more vials. And I'm not saying Sarasota was doing that, but basically, I think the White House's view is scientifically, we think the 5 day, the 5 day regimen can be beneficial. They don't have much evidence that going beyond that tends to be beneficial. So that could be one way too, to just make sure that the regimen's there for what it works. But when you go beyond that, they didn't seem to think that it was that it was something that had been terribly effective. So but we are working on that. That was the number one thing I talked to the Vice President about last night. They understand, and so I wouldn't say that there's a disconnect in terms of them understanding, that this is something that a lot of physicians are prescribing now. We do have some other things that have been done that have been gotten pretty good reviews, like convalescent plasma. But I think as this has come online, it's kind of defaulted to the standard of care. So as people come in, I think they're tending to get prescribed the remdesivir. So we obviously want to help with that, and we want to try to get it. Now, it had been for the initial parts with remdesivir where they would send it to the state health department. So initially, the state of Florida was sending it out. But then what happened in the more recent shipment, and this is how HHS is doing it going forward, they are having the stuff go straight to the hospitals. And so the state, we really, I'm there now as an advocate to try to get this stuff shipped to our hospitals. But it's not going to be the state that's distributing it per HHS practice. So they're going to be doing it, and we want to get it as soon as possible. And I think that I believe giving the doctors all the tools that are available is really what we need to do. And the good thing about what's happened over the last month or two across our country in terms of the persistence of this, and obviously an increase in Florida, is that there are better options for patients now than there were in March. And that should be, and we're not out of the woods on it. Obviously, there's more that needs to be done in developing different types of additional treatments, but you actually have now an arsenal of things that they can do that I think have been proven to reduce mortality and morbidity, and that's a good thing. And I really applaud the folks throughout the state of Florida for all that they've been doing. So thanks, everybody.
Can we get one question about schools, Governor? How do you plan to fund schools with all the safety measures needed to reopen? We'll get one.
Well, wow. We continue to wait right here on Fox 10 Extra, coronavirusnow.com for this White House briefing. When will it happen? We just don't know. It was supposed to happen at 11. We continue to wait. That is okay. That is okay. We do hope everyone is having a great Thursday as we continue to roll on here. CoronavirusNow.com on our YouTube. Hey, we got Trump a little bit later this afternoon. We'll feature that. We're still waiting on this news briefing. We got an update coming a little bit later. So you're in the right spot, everyone. I'll tell you that much. Welcome back, everyone, here on News Now. Still awaiting this White House news briefing. While we do wait for that, let's continue to roll on here on coronavirusnow.com, show you our sister station right here in Atlanta with some coverage as we do wait for the briefing.
Stolen four-wheelers at the center of a months-long investigation, and local authorities say the thieves are crossing.
Since yesterday, 28 people have died. For the first time, data reveals that 1 in every 10 Georgians have tested positive for the virus since the pandemic began. Tonight, a huge step forward in our fight against COVID-19.
This evening, researchers at Emory University reported anxiously awaited findings from phase 1 of the first human trial for a vaccine. Fox 5 anchor Christine Spiro joins us now. And Christine, these results are encouraging, to say the least.
Yeah, that's right, Courtney. Scientists say after getting the shot, patients produced antibodies to fight coronavirus. Now the question is whether it will protect against infection and how long those antibodies last.
It has also shown that the vaccine is able to induce a good immune response.
Emory, Kaiser Permanente, Washington, and the Vaccine Research Center at the NIH are testing this experimental vaccine made by the biotech Moderna.
Within 6 weeks, they actually had a vaccine that was ready to be given in humans. And by mid-March, we had the first subject enrolled.
A 65-year-old Decatur man was one of the first enrolled to test this experimental vaccine.
So the vaccine is 2 doses. One is given now, and again, another dose in 4 weeks.
Local trial participant Norman Hume received the first injection in April, then the second in May.
Kind of getting a flu shot. They just kind of put in your, the arm of your choice in the upper deltoid muscle. So I have to keep a diary of any other thing, like pains or headaches or any nausea.
Have you had any of those issues?
No, I haven't.
Unlike Hume, researchers say more than half the study participants reported flu-like reactions to the shot.
As far as side effects, we've seen the subject mentioning pain at the injection site, but also mentioning some systemic symptoms such as feeling fatigue, having some chills, having some headaches.
Some of those reactions are similar to coronavirus symptoms, but they're temporary, lasting about a day and occur right after vaccination. Overall, scientists say they're pleased the vaccine provided a hoped-for immune boost.
We were pleasantly surprised that the vaccine was well tolerated. I think we were also pleasantly surprised that it did induce an immunity similar to convalescent people that recovered from the disease.
Now, phase 2 is still ongoing, and phase 3 will start around July 27th. It's a 30,000-person study to prove if the shots are really strong enough to protect against the coronavirus. If you're interested in participating in the vaccine trials, we've provided a direct link to our website. Just go to fox5atlanta.com. Courtney?
Fascinating stuff, Christine. Thanks. Allegations of falsifying COVID-19 tests at an Athens Clark County hospital have been cleared. 4 nurses filed a lawsuit against the Landmark Hospital of Athens, claiming administrative staff retested patients who had already tested positive and sent them to a lab. An investigation by the state found the hospital did nothing wrong.
New tonight, an Atlanta area church chooses to close its doors for in-person worship for the rest of the year.
The pastor of North Point Community Church made the announcement on the church's Facebook page. Fox 5's Brooke Zahner spoke to him about his decision.
Like many other churches, North Point Community Church has been reaching people solely online since the coronavirus pandemic. They had planned to open their buildings up this summer, that is, until coronavirus cases started going up.
Our churches have not closed. We've simply suspended gathering on Sunday morning at 9 and 11 o'clock.
Pastor Andy Stanley says the choice to keep North Point Community Church's buildings closed through 2020 was not a hard decision to make.
And everybody agreed we cannot do contact tracing. We cannot guarantee the safety of everybody who comes in the building.
Since the start of the pandemic, North Point has been reaching people online and over Zoom, even in people's driveways and the church parking lot.
I didn't have to talk anybody into this. They were like, no, that's not what we're about. We are outward facing, so let's outward face and do things that we've not had an opportunity to do before.
The announcement came in this video to the church.
We've decided to suspend in-person adult worship services for the remainder of the year.
Pastor Stanley acknowledges not everyone is happy about the decision.
For others of you, this seems like an unnecessary precaution, perhaps a lack of faith on my part.
In a non-COVID-19 world, thousands of people attend church at North Point Ministries locations. They say they will do small gatherings, but trying to bring people back to the building isn't a good idea for them.
We're going to do some limited physical gatherings between now and Christmas for sure, but we're just not going to open up our buildings, primarily because our responsibility is to keep people safe.
Stanley says he sees this time as an opportunity to reach more people and help the community.
We're committed to doing things for our community. And if we open, we may accidentally do something to our community that's not positive.
At this point, in-person services at North Point Community will resume again in 2021. For now, Stanley says they will continue to reach people virtually. Reporting in Atlanta, Brooks Honor, Fox 5 News.
Developing tonight, the Trump administration has reversed its decision that would have forced international college students to leave the U.S. if they were only taking online classes this fall. The unexpected announcement from ICE came just as arguments were set to begin during a court hearing. Several states and universities had filed lawsuits against the government to block the rule. Many students will be taking all online classes in the fall, and now some parents are scrambling to find tutoring and other resources.
And as Fox 5's Deidre Dukes explains now, they're worried their children will suffer academically without in-person instruction and are now looking for additional support.
Clayton County School Superintendent Dr. Morsees Beasley took to YouTube Tuesday afternoon to detail the school district's plan to help ensure families are ready for virtual learning when classes begin August 10th. Clayton and Atlanta Public Schools among the metro area school districts opting to begin the year with virtual instruction. Fulton County Schools has offered parents the choice of sending their children to school or to learn online at home.
It's leaning for me towards going virtually, but while, if I lean towards going virtually, I have to have some type of assistance with my kids.
Carla O'Denny's children attend Fulton County Schools. Like so many other parents, the mother of two and her husband struggled with the demands of homeschooling last spring.
It was frustrating. Many days I felt like I just didn't know what I was doing. I was emailing teachers, just trying to see what schoolwork needed to be turned in, what resources we had, how should I be helping them.
The O'Dennys are now searching for a tutor for their kindergartner and 8th grade student to help bridge the gap.
And having a tutor, somebody who may have an education background and could best help my kids.
All parents are being faced with something they never thought that they'd be experiencing.
Felicia Zorn, who is Director of Business Development for USA Test Prep, encourages concerned parents in search of a tutor to reach out to their student's school for recommendations.
There are systems and school districts out there that have lists of tutors that are available that are former teachers or retired teachers.
Zorn says there are lots of online resources available to help students and parents. Websites like USA Test Prep have content that align to the state standards and allow parents to track student success. Deidre Dukes, Fox 5 News.
And this breaking story just into the Fox 5 newsroom. The attorney for Justin Conley tells Fox 5 that Atlanta police have notified him this morning. They have 2 warrants for the 19-year-old's arrest.
All right, folks, now let's go on to the White House. Kaylee, just starting up.
Remarks on rolling back regulations to help all Americans.
Deregulation has been a top priority of this president. The president reversed the disastrous overregulation of the Obama-Biden administration. Under President Trump, 7 deregulatory actions have been taken for every 1 new regulation. This amounted to $50 billion in regulatory cost savings, and it is important to note that this deregulation agenda lowers the cost for every American. The cost of these burdensome regulations fall disproportionately and benefit disproportionately lower income Americans. So this president took action to roll back the burdensome regulations that harm low income communities and make sure that these lower income Americans are taken care of. For example, the president's deregulatory agenda will boost household income by $3,100 annually. Thanks to President Trump's rolling back of the Obama-Biden era CAFE standards, families will have access to cheaper cars. The president's healthcare deregulation will also save patients nearly 10% on prescription drug costs. These real wins for the American people will disappear with a re-regulation agenda, which is why President Trump will continue to pursue his historic deregulation activity. On another note, we saw encouraging news yesterday on vaccines. Moderna's vaccine candidate is showing promising signs. It produced a positive neutral immune response among the 45 participants in the study. This is comparable to what we see in recovered patients. And the bottom line is that so far we are seeing exactly what you would hope to see in a vaccine. They're expected, the Moderna vaccine in particular, is expected to reach phase 3 by late July with 30,000 participants. And finally, on the therapeutics front, I just want to note a very encouraging Regeneron contract, a $450 million contract for monoclonal antibody cocktail. This is a bioengineered version of convalescent plasma. One of the several therapeutics available to treat COVID, can be used for prophylaxis and treatment, and they say they could have up to 70 to 300,000 vials of this by the end of the summer or early fall. So Operation Warp Speed continues. We continue to see encouraging news on the therapeutics front, and with that, I will take your questions. Jeff.
Thank you, Kayla. Maryland Governor Larry Hogan said today that President Trump has left states to fend for themselves during this pandemic. He accused the president of not listening to medical experts. That is quite a takedown coming from a Republican governor.
Yeah, it's really striking, his comments, especially when you compare them to his past comments. This is revisionist history by Governor Hogan, and it stands in stark contrast to what he said on March 19th, where he praised the great communication that the president has had with governors. On March 19th, he also said, thank you, there's been tremendous cooperation. And what is so striking to me about reading that op-ed is Governor Hogan begins with this dramatic April 18th scene where South Korea delivered tests, but just the day prior, he said something entirely different. He, in fact, thanked the president for the progress we've seen in federal and state coordination in recent weeks and went on to praise testing capabilities. He said with regard to some of the top needs of states, including ventilators and testing capabilities. So 24 hours before this dramatic opening scene of his op-ed, he literally was praising the president of the United States for delivering on testing.
And how do you explain that President Trump is trailing his opponent by double digits both nationally and in battleground states, with majorities disapproving of his handling of race relations and the coronavirus?
So that would be a question for the campaign when it comes to campaign polling. But what I would say is we believe this president has great approval in this country. His historic COVID response speaks for itself with delivering on ventilators and testing, leading the world in the amount of testing we've provided, therapeutics, the 13 vaccine candidates, the Moderna example that I pointed out to you. This president's response has been historic, and we believe his support in this country reflects that. But with pertaining to battleground polling or campaign-related polling, I'd refer you there. Yes.
Haley, we've seen the president hold a range of public events this week, but none of those events have been focused on the coronavirus. Why not?
The president's routinely focused on the coronavirus. I think you'll be hearing more about what we're doing in the coming week. He's hard at work. We talk about COVID every day from this podium. The task force is hard at work, and I'm glad you asked about COVID in particular, because I just want to read through some of the things that we are doing, which I think is most important than what we're saying is what we're doing. And the White House has engaged in travel, Dr. Birx, to Louisiana, Mississippi, Alabama, Georgia, and South Carolina. I spoke with Dr. Birx this morning. She's in Georgia today. heading to South Carolina tomorrow. HHS has deployed 19 teams across the country. We identify not where we see embers, but pre that. We identify where we might see an emergence, and we send teams there to address it in advance. So we're proactive. Dr. Birx routinely sends real-time data to governors. She gives them governors' reports on remdesivir. We've surged it to Texas, Florida, California, Arizona. 65,000 vials went to these 4 states, and we're also surging testing sites. So we're doing stuff each and every day.
But Kayleigh, surely you'd agree this is the biggest challenge facing the public right now. Why aren't we seeing it as the president's biggest public priority?
The president's focusing on a lot. Look, the president just yesterday held a big press conference, if you will, or an unveil in the Oval Office about MS-13. COVID is something that we're focused on. It is a top priority of this administration. It's why the task force meets. It's why I mentioned to you we're taking all those steps. But there are other things the president has to focus on, namely Democrat cities not controlling their streets, namely the mayor of Chicago, people dying on the streets of her city every weekend, and the president sent her a letter saying you must secure your city. The president's involved in Operation Legend in honor of Legend Taliaferro, a young man who lost his life, sending federal assistance to St. Louis, a city that has asked for our help, and he's shown up. The president's focused on MS-13, who tragically maimed and killed those 2 young little girls, and he's held their killer accountable, the leader of that ring. So the president's focused on COVID. It's a top priority. He's focused on the violence in the streets. He's doing a lot of things at once, and that's the great thing about the Trump administration.
Quickly, when's the last time he attended a task force briefing?
The president is briefed on coronavirus each and every day. Yes, Darlene.
Thank you. Does the White House agree that it's not helpful for people to wait 7 days or longer to get the results of their coronavirus tests? And is the White House going to do anything to try to shorten those wait times so that people can get their results sooner?
So we've done more than any country in the world on testing. There's no doubt about that. 42 million tests. The country with the next highest number is India at 12 million. There are various different types of tests in this country. Some take longer to process than others, but we have surged testing to the states. We encourage them to use it to their best ability and to process those tests as quickly as possible. Yes,
thank you. To follow up on that, it's not just about the quantity of testing, it's about the quality of testing. So is the administration doing anything specifically to make all the tests out there return quicker results? Because, you know, a lot of health experts are worried that when people have to wait 7 days or longer, they're out here spreading the disease unknowingly.
So as I noted, there are several different types of tests. There's the Abbott rapid response test. There are other tests that take longer. Dr. Birx and Admiral Joie are constantly out there advising on testing and how to process these tests. Ultimately, we can give the states the supplies, but they've got to use them in the best way possible to get results as quickly as possible. But rest assured, our team's fully engaged, from Admiral Joie to Dr. Birx and others. And Admiral Joie shared with me, we have 552 sites testing in America in 48 states and the District of Columbia. 65% of these sites are located in counties with moderate to high social vulnerability, and 201 additional sites will be going live this week, and that's on top of the 1,300 federally qualified health centers that are out there testing as well, and the commercial testing sites at CBS.
I have another question. Kayleigh, in an interview with CBS News, President Trump said more white people are killed as an answer to why black people are still being killed by police officers. But by population percentages, black people are about 3 times more likely than white people to die in a police encounter. If the president won't even acknowledge that, how can he fix the problem?
The president has routinely acknowledged and expressed the absolute atrocity of the case of George Floyd, and his heart goes out to that family still. He was noting a fact that there were, when you look at unarmed killings with police interactions in this country, that you had 9 unarmed black individuals who were fatally shot and 19 unarmed white individuals. That's down from 38 and 32 respectively in 2015. So the numbers have actually come down since the Obama administration. He was making that point. But one point he wants to strongly make is this, that black men and women who die of homicide, they are likely to die of homicide at 8 times greater than that of white individuals and Hispanics combined. That's the rate combined. So that's an extraordinary thing that we want to look at. I've listed for you the names of these kids who have died across this country. It is unacceptable and under this president, he'll take action, and the derelict mayor of Chicago should step up and ask for federal help because she's doing a very poor job at securing her streets.
Talking about people who are dying at the hands of police officers.
Is the president considering travel bans for members of the Communist Party to enter the U.S.? And is he concerned about escalation of tensions with China?
So I have no announcements on that front, but rest assured we keep every option on the table with regard to China.
Has he ruled out any options at all?
He's not ruled out any options with regard to China. Yes. Jeff.
Thanks, Kayleigh. Does the White House have a reaction to the hacking of Twitter last night? And do you have any broader concerns, or does the president have any broader concerns about using that platform to issue not only his own opinions, but official policy pronouncements, given its apparent vulnerability to hacking?
Yeah, so I spoke with Dan Scavino before coming out here. My team did, and Dan has been, and his team in digital have been in constant contact with Twitter over the last 18 hours to keep Twitter secure, the president's Twitter feed. The president will remain on Twitter, but his account was secure and not jeopardized during these attacks.
Okay, and just one follow-up to Luigi's question. I guess I didn't follow the data that you were just referring to. Are you saying that the president did have data to back up his claim that more white people are killed by police officers than black people?
Yeah, and I've already read out that data to you.
I don't think we followed it.
I've already read out that data to you, and you can go fact check on the Washington Post. Yes.
Kayleigh, two quick questions. First, Congressman Steve Watkins of Kansas has been charged with 3 felonies in a voter fraud case. Obviously, the president campaigned with him in 2018, and he's repeatedly expressed concern with voter fraud. So does he have a reaction to that?
That's the first I'm hearing of that. I haven't spoken to the president of it. He does have very real concerns about voter fraud, and he's mentioned several of those. And there's yet more information that there is rampant voter fraud when you have mass mail-in voting. In 2016, as the president has noted, about 1% of absentee ballots nationwide were thrown out, and it could be much higher this year as many people vote by mail for the first time. That's one of the flaws with mass mail-in voting. But beyond that, we've seen a number of reports out of New Jersey that found a U.S. Postal Service vehicle that may have been carrying mail-in ballots that was caught on fire, this truck. This was recent. Also in the New Jersey Star-Ledger on June 22nd, this was very striking. 500 to 700 Republicans received ballots with all Democrat candidates. They were erroneous mail-in ballots that had been voided and then reissued. And the slate of candidates on these ballots was all Democrat from Joe Biden down to dog catcher, and these were supposed to be Republican ballots. Those are 3 recent examples, and there are many more.
A quick second question, Kayleigh. When the president made the initial decision to move the Republican National Convention from Charlotte to Florida, he said that it was because the North Carolina governor was in a shutdown mood and that he was playing politics because he didn't want to pack an indoor stadium to full capacity. He also said that the cost to North Carolinians would be, and I'm quoting the president now, all of the jobs and the economic development the convention would bring. So all of that money, all of that time, all of that cost to jobs and economic development to North Carolinians for the same result, right? Because they're shrinking the convention in Florida. What does the president have to say to North Carolinians?
The president loves the people of North Carolina. They're well aware of that. The president wanted to be able to hold his convention, which is why it was moved to Jacksonville. And for anything further, I'd refer you to the RNC. Yes.
Thank you, Kayleigh. The president has talked about an executive order on immigration coming soon. He's also talked about protections for DACA recipients. It's been unclear, though, whether those protections, the path to citizenship that the president talked about, will be included in the executive order. So I was hoping you could clarify. Will the path to citizenship protections for DACA be part of the executive order?
So what I would say is this, as the president announced, he's working on an executive order to establish a merit-based immigration system. That will be the intent of the executive order. But the president has long said that he would look for a legislative solution on DACA, and he would work with Congress to pursue that legislative solution, and one that could include citizenship along with other strong border security and permanent merit-based reforms. So that is something he would work with Congress on. Yeah, and the executive order would pertain to the merit-based portion of that.
A second question on the schools. The vice president talked about some of the new guidelines or new pages of documents for CDC coming out this week. Is that still the plan? Are those going to come out this week? Is there any chance that this is being rethought at this time?
So those are CDC guidelines you're referencing, so I'll leave it to CDC as to when those guidelines come out. But we really would like to see schools open. As has been clear, we don't think our children should be locked up at home with devastating consequences when it's perfectly safe for them to go to school, as emphasized by many medical experts. So the president is very keen on seeing schools reopen. It's the only thing that's fair to America's children. Yes.
Thanks, Kaylee. 2 quick questions for you. On Wednesday, the CDC director said, quote, "If all of us would put on a face covering now for the next 4 weeks, 6 weeks, I think we could drive this epidemic into the ground." Admiral Giroir has made similar comments. The CDC director called it our, quote, major defense. I'm wondering if the president would consider at any point a nationwide mask mandate.
Well, the president has said that he would wear a mask if he was in a place where he couldn't be appropriately social distanced. He did wear a mask this weekend when he visited the hospital. So he has shown that he'll wear a mask, and not only that, that he would wear one if he wasn't socially distanced, as evidenced by his own actions. We leave it to localities to make the decisions with regard to face coverings, and the CDC guidelines remain the same today, recommended but not required.
And a quick second question for you. You were saying earlier that the president is very concerned about local officials who are not taking actions about deaths in their cities. You also said he was appalled by what happened to George Floyd. In March, a 26-year-old black woman named Breonna Taylor was killed while sleeping in her home. The 3 officers involved in that case in Kentucky have not been arrested or fired. Is the president monitoring that case at all, and does he want to see justice for Breonna Taylor?
Yeah, I won't weigh into that other than to say I'd refer you to the DOJ, who takes federal action where necessary, where the facts merit, but our hearts grieve for Breonna Taylor's family.
Thank you. Another question on China. President Trump is the only U.S. president to have stood strong against China, which is of great comfort to countries like India and his other allies in the Asian neighborhood. Does he has a message to China on this? And has he spoken to China, other countries, how to collaborate against China?
Thank you, Lalit. I did see your question earlier, and I brought it to the president, and he said, I love the people of India, and I love the people of China, and I want to do everything possible to keep the peace for the people. Thank you.
Yes, a question that flows from 2 events that we saw recently that we wouldn't have seen at previous White Houses. The first was the campaign meeting in the cabinet room last month, and then the political speech in the Rose Garden this week. Can you talk about your understanding of what the White House policy is for this White House as far as politics? Is there any place in the White House where you think politics is inappropriate? I mean, where do you draw the line?
We act in accordance with the Hatch Act. It's well established that the president and vice president are not subject to the Hatch Act. It says this much in the Hatch Act. It says that the Hatch Act applies to executive branch employees, which is defined in the Hatch Act as employee, meaning any individual other than the president and the vice president. So his speech in the Rose Garden was entirely appropriate.
The Hatch Act has nothing to do with this, though.
What? It has everything to do with this. Go read the Hatch Act. That's what you're alleging that is problematic for the president.
Stating
but your real problem was the fact that the president gave a very good, powerful speech from the Rose Garden. Owen.
Well, you talked about it earlier with school districts, but we're seeing more school districts, at least in Virginia, for example, last night, deciding to go online only. What does the president say to parents out there who are now going, okay, what do I do with my kids?
Yeah, the president has said unmistakably that he wants schools to open, and I was just in the Oval talking to him about that. And when he says open, he means open and full, kids being able to attend each and every day at their school. The science should not stand in the way of this. And as Dr. Scott Atlas said, I thought this was a good quote. Of course we can do it. Everyone else in the Western world, our peer nations, are doing it. We are the outlier here. The science is very clear on this. That, for instance, you look at the JAMA pediatric study of 46 pediatric hospitals in North America that said the risk of critical illness from COVID is far less for children than that of seasonal flu. The science is on our side here, and we encourage for localities and states to just simply follow the science, open our schools. It's very damaging to our children. There's a lack of reporting of abuse. There's mental depressions that are not addressed, suicidal ideations that are not addressed when students are not in school. Our schools are extremely important. They're essential, and they must reopen. Yes.
Thanks.
Thanks, Kaylee. The U.S., Canada, and the U.K. today accused Russia of trying to hack coronavirus research, vaccine research. I was wondering if the president has a response to Russia to that.
Yes, so the one thing I would say about that, and it was announced earlier today, is that we worked very closely with our allies to ensure that we would take measures to keep that information safe, and we continue to do so, and we're aware of those activities. Yes, Chanel.
Thanks, Kaylee. On the CDC, on the movement of data going straight from CDC to HHS now, understanding that HHS needs access to real-time data, was there also any concern whatsoever undergirding this decision regarding CDC's possible manipulation of data? There were some reports coming out of Florida. Certain states were coming out and saying mid-level CDC reports were not necessarily accurate. And so did that have any effect in this decision to send data straight to HHS?
No, the intent for this decision, and I talked extensively today with Dr. Birx, with Secretary Azar, and with Dr. Redfield about this. The intent of this is we need to make sure that there is daily data that is being given to Dr. Birx and others who are running point on a lot of our actions with remdesivir and identifying hotspots. And I would point out, and I just want to explain this because I think there's been some confusion in the press, that there are two methods of data collection. The one is the National Healthcare Safety Network, and this is a CDC system, and this is where hospitals voluntarily report their data, and about 81% of hospitals were reporting their data. So we don't need 81% of hospitals reporting data. We need 100% of hospitals reporting data because it is critical that Dr. Birx and others receive the daily admissions, ICU use, and PPE numbers. And when you're only getting 81% of hospital data, that means you've got 19% of hospitals that were unaware of their needs. So what happened is we also have a second method of tracking this data, and it's the TeleTracker database, and this is an HHS system. And this was initially used for purposes of provider relief funding, and we asked hospitals to tell us about their COVID admissions so that we could identify possible hotspots. And as it turns out, this data ended up being more complete, more up to date with information. And so ensuring that hospitals are reporting into this system where we're getting more complete data was the reason that HHS has had this transition where they've asked hospitals to transition reporting to the TeleTracker system. It's important, especially with remdesivir distribution, that we know exactly where the needs are so we can surge them. So this
will still have access to this data.
Yes, that's right. So I did confirm that with Dr. Redfield, that this is completely open source data available to the CDC. Secretary Azar says we insist that they use it, and no one, and Dr. Redfield confirmed this, no one is taking access or data away from the CDC, and that data is routinely published so that the American people are fully informed. Yes.
So I wanted to follow on that briefly. There's been some complaints, particularly among independent modelers who are using the CDC data that was updated daily to sort of put out their public models, some of which the White House has relied on, that now those dashboards have been taken down. So I'm wondering if the administration would sort of commit to making the broader database a bit more available to the public.
The CDC database is the public data that's been out there. It'll continue to be public. It should be public. And this is all about getting more data out there, not less data, and ensuring in particular that our doctors get that daily data. And one thing that I'd also like to point out for everyone is just with regard to testing, we've done more than 42 million tests, as I noted. The second highest number is 12 million from India. We're leading the world in testing. It's a very stark contrast, and the president mentioned this yesterday, so I just wanted to put some additional information out there. It was actually CBS reporting that in 2009, under Obama-Biden, quote, and this is CBS reporting, CDC abruptly advised states to stop testing for H1N1 flu and stop counting individual cases. So while this president surged testing under the Obama administration, they stopped testing entirely. And Ron Klain, Vice President Biden's former chief of staff, said this: "It is purely a fortuity that H1N1 isn't one of the great mass casualty events in American history. It had nothing to do with us doing anything right." This is former VP Biden's chief of staff. It just had to do with luck. Contrary to that, this president led the world in testing, led the world in ventilators, redistributing ventilators, 4 therapeutics, 13 vaccine candidates, 1 going into phase 3 clinical trial. This response has been extraordinary and historic. We didn't pause testing. The Obama-Biden administration did, and that was a shameful decision. Thank you.
All right, Kaylee, wrapping up there at the White House. Now let's go out live, everybody, on coronavirusnow.com to the update in Ohio from the governor there.
Who are wearing masks. So one very tangible way is to see how many people are wearing masks. And look, I get calls, I get texts from people who say, look, my child can't wear a mask. There's a medical reason. So I would just say, look, if we're all in this together, if there's a child or there is someone who is not wearing a mask, do not assume that they are in defiance of what the order is, and don't assume that they don't care about other people. So, but I would say, the vast, vast majority of us can wear a mask, at least when we go into a store. And that's really what we're asking people to do, is to make a minimal commitment, a minimal sacrifice, a short-term sacrifice for a long-term gain. And the long-term gain is kids will be back in school in the fall. Long-term gain could be our kids can play football, our kids can play basketball, whatever it is. Look, we don't know what the future is, but we can impact that future, certainly by what each one of us do. So that's really what we're looking for. We're looking for people and what they do every day. And again, when I see significant companies in the state of Ohio who are saying, you come into our retail establishment, you will wear a mask. Everybody's starting to get it. And again, you may have a small number of people who, for some reason, can't. God bless them if they can't wear a mask, that's fine. But the vast majority of people can wear a mask, and we're asking them to do it. And I think we're starting to see some certainly movement in that direction.
What's the or else scenario of do this or else? What's going to happen if the numbers don't get better?
Look, as I said last night, as governor of the state of Ohio, I will do what I have to do to protect the people of Ohio, and that's what I'm going to do. Now we're going to constantly look and see. I had a good conversation, for example, today on the phone. We had most of the health directors from all over the state, and just asking them, what are you seeing? What type of things are causing the problems? So these are the notes I wrote down. These are my notes. I wrote them in the car, and I'll just read them in no particular order. And I don't think they're not meant to be in order, but these what came up: block parties, literally people getting together in block parties, neighborhood get-togethers, bars, churches. Mention, of course, about young people, and the data's clear. 20 to 29-year-olds, the numbers have gone up, dramatically. Travel, people coming back from traveling, and from hotspot states, restaurants. These are just some of the things that I wrote down. John, I don't know if you had any more. You were on the same call I was, but
it was. Look, it's. As you listen to that list, and I heard, I was listening to the same call the governor was, what people are saying is that what we're hearing from health officials is just people's individual responsibility. In some cases, they're not living up to it in the sense that they are not following the rules that we all have encouraged people to follow of the distancing and not gathering together in large groups. And I get it. It's like you see your family like, well, this is my family. They don't. Well, your members of your family, my family, anybody's family who hasn't been following the recommendations and exposing themselves can then turn quickly and expose 10 of their family members to it. And it's what people do. You may say, I'm doing great 8 hours a day at work. There's a great working environment. But if just one of you in that group kind of deviated from that, went out, did something that maybe was a little more risky, contracted coronavirus, you're walking around asymptomatic, you're shaking hands, giving hugs, doing the things you've always done. That's a recipe for disaster, for the spread, and it can happen just like that, where one person gives it to four give it to 12, and it can spread pretty quickly. So it's just everybody in their personal lives making good decisions so that they don't put each other at risk. And that's what we were hearing from the health department officials today, that they were really on the governor about just share that message about people needing to do these things. And he does it every day. I don't know that the governor could implore people to do this more than he has. He does it every day. And the more we listen to his advice, the better off we're going to be in the long run.
Andy, let me just answer the question this way. And one of the things that we're seeing, and this came up on this call, and that is people say, well, people's own home, and they have in the backyard or inside, obviously more dangerous, 75 people. And, because we don't restrict what people do in their own home, people look at that and say, well, that's not part of the order, and I don't have to do it. And so what we're really asking people to think about is, don't think so much about what the order is, but rather think about, does this make any sense for my family? Does this make any sense for everybody else? And so to answer your question directly, I will do whatever it takes to keep people in Ohio safe.
Thank you.
Hesitated before, I'm not going to hesitate again. But the better pathway, obviously, is if people will look at these colors. If you're yellow, try to keep from going into orange, and if you're orange, try to keep going into red. And if you're red, do everything you can to push it back. So we're trying to inform people with this.
Hello, Governor. Kevin Landers, WBNS 10 TV. I'd like you just to clarify again what purple means. Does that mean a county could possibly shelter in place? Does that mean you would institute a quarantine for people who are leaving the state, for example, going to Florida? What exactly does that purple trigger? And then, we have a state of 11.7 million people. We had 1,000 new cases today. That's not a large percentage of the population. Can you explain why that is such a concern?
Why which is such a concern, Kevin? I'm sorry.
We have 1,000 cases, 11.7 million people. That's not a large percentage. Can you explain why that is such a concern?
Talked about this last night, and I understand it doesn't look like a huge number, but we are basically where Florida was a month ago. Florida was at this level. If you look at positivity, if you look at number of cases, look at all kinds of different ways, and see where Florida is today. And so, look, we see these things coming. This system was designed. The color red was picked for a reason. It is a danger. We have challenges. It's a warning system. So what we've learned throughout this pandemic, and what, frankly, the scientists told me very early on, in February, they said, you have to move well before it looks like you have to move, because it goes out and multiplies out like this. So, for example, if you live in one of these counties, one of the yellow counties, now is the time to cut this thing off. It's so much easier to do it. So much easier to do it with if somebody comes down with it, tracing, a person's isolated for the period of time, anybody they talk with or they come in real close contact with, and you just cut it off. You cut at the knees. And it's so much easier. When you get here, it's harder. And when you get here, it becomes much, much harder. So you got to look down the road. Now, we are losing a lot of people every single day. And we not only have people who are dying, we have people who have long-term health issues. So I would not, as we look at the number of people who are coming down with this, I would in no way minimize that. But I would also say that the real concern is the future and how this bodes for the future and how this stuff multiplies and it just goes out like that.
Governor, can I emphasize something that I heard Dr. Thomas say, and I listened to a lot of these calls when it was being designed. It wasn't necessarily designed to be a triggering tool. It was designed to be an information tool. It was designed as an early warning system. He talked about it as a weather forecast. It's like, look, you may have some severe things coming at least, but unlike a weather forecast, you can actually do something about this. You can take the precautions individually and collectively to change your future. And that's what we want it to be. We want people to say, hey, this is happening. Maybe I ought not go do that family reunion or whatever it might be that we thought was a good idea a few weeks ago, because we're seeing a spread. And hey, there's a lot of 20 to 29-year-olds in this group. We know that they've been out doing a lot of things. They could be asymptomatic. Maybe we ought to rethink what we're going to do. That's what we hope people will use it for, to inform, making better personal decisions, taking more personal responsibility in the ownership of the solution.
So, for example, if you're in Hamilton County today, you know more, a little bit more at least, than you knew this morning. And what you know is, hey, we're doing a little better. Maybe some of these things that we're doing and we're putting in place, and the mayor and the county commissioners and other people are urging us to do, maybe some of that's working a little bit. And you know that you've slowed that rate of increase down. That tells you something. And it tells you something if you're in Scioto County and you say, I didn't know that. I didn't know that this was bad. So again, these are indicators for people to be able to react to.
Thank you.
The question, the next level, the fourth level, we have nothing tied to that at this point. Doesn't mean we might not in the future, but we have nothing tied to that at this point.
Hello, my name is Susan Kratzer with Hannah News Service, and I was just wondering, what's the National Guard, what's the status of their operations right now, and do you have any plans for once aid from them ends in certain areas like nursing homes, will there be just any kind of support after them?
National Guard is today, I believe, doing some community testing, the pop-up tests. They also are in nursing homes. They're going to stay with the nursing homes for another week or so. They're making very, very good progress with the staffs there. We then will, at that point, move to a different system as far as the nursing homes, as far as the testing, where every nursing home will be required within a certain number of days to completely test all staff members. And that will be up to those nursing homes to do that, and we will monitor that, and we will monitor the results. The Guard at that point will move more out into the communities. What I've asked our team to do a few days ago is to look at our mid-level counties, look at our counties that may be getting ready to turn red, and talk to the local officials and see, do you need more testing in the county? Can we come in for a day? Do you want us to come in? You want the Guard to come in, do pop-up testing, say in Mansfield, Lorraine, and so the scheduling of the Guard as we go forward is going to be a lot of it is going to be that community testing. They can come in, they can set up, they can get it done, we can get the results back, and that's helpful to that particular county. So they're going to be on a mission to find places where the local officials believe there is not enough testing. There's not been enough opportunity for testing. And so again, if anyone's watching this today from a county and you don't not think that there's enough testing in your county, talk to your local health department. If they don't think there's enough testing, they will be in touch with us and we will come in with the National Guard. We are very, very happy to have the Guard moving forward. I just signed a letter to the President thanking the President for the subsidy on the Guard, but also asking that be extended. So we would have more opportunity throughout the rest of the year to have the Guard out 5, 6, 7 days a week.
Thank you.
Hello, Governor. This is Luis Gil with Ohio Latino TV. Governor, I would like to go on the same line about your speech last night. It seems like you were torn delivering your speech. What's the right thing to do for Ohio and Ohioans? So many people were not expecting. They don't know what to expect, but they were not expecting for you to come out and just simply ask, wear your mask. And in short, is it up to us, if all to Ohioans, to come out of this crisis? And in short, what do we got to lose? It's just to wear the mask for 3 weeks or 4 weeks.
Well, I was torn. I guess anybody in this position is torn. You always wonder, what are the things to say to people. But we scheduled that. It's the first time since I've been governor that I ask, to have time that time of night. We normally do this 2:00 press conference, but I wanted to talk directly to the people of the state of Ohio and to lay out for them what was going on, what I was seeing every day, and frankly, what my concerns are. I owe that to the people of Ohio. I owe it every day to tell them what we're seeing. But I want to do it in a more maybe cohesive environment or cohesive speech than I do sometimes when I'm here, because I wanted to tell them that every morning when I get up and turn on the news and I see what's going on in Florida or Texas or California or Alabama, other states, my worst nightmare is that that's coming to Ohio. And we have good evidence that when you look to where those states were a month ago, basically it's where we are today. And we got trend lines. I mean, look at this map, how it has changed 3 times. You've seen it. We now have 60% of the population of the state of Ohio living under red, which means we have very specific problems, and it's moving up, moving clearly in the wrong direction. So it was, as a former prosecutor, I guess it was my argument to the jury, people of the state of Ohio are the jury, and to tell them these are the facts. These are the essential facts that we have. This is what we know today. This is what we have to do to get through this. And what is at stake is what the fall is going to look like, what the winter is look like, our future. Our future as a state is at stake. No one wants to see us shut down. No one wants to see business shut down again. No one wants to see us hunker down. But if we're going to avoid all those bad things, we have to take action. And we have it within our collective selves to change the outcome. We really, really do. So that's what I was trying to do, trying to talk to the people of the state. And look, as I said at the beginning of the speech, there'll be additional orders in the future. But again, whatever those orders are, what's more important is what people do every day. And that's why I wanted to talk at 5:30 when I thought maybe people maybe are getting home, people turn on the TV, watch a little news, and they might come across Mike DeWine on there, and maybe they'd listen to a few minutes, and I'd have the opportunity to tell them what was on my heart and what I'm seeing and what I'm concerned about.
Thank you.
Good afternoon, Governor DeWine. Ben Schwartz with WCPO in Cincinnati. Governor, I know you've been answering a lot of similar questions to this today, but I do want to ask, Governor, what will happen if people in counties nearing level 4, like Athens, for example, with a whole lot of community spread, simply don't listen, don't wear masks, and the virus continues to spread? Do you see them going into a stay-at-home order for solely just the county or something like that?
Yeah, Ben, I don't know. We're going to do what we have to do. Local health department's going to do what they have to do. But, buck stops with me. I'll make the decisions. But what really will happen, whether we issue an order or don't issue an order, if it's is so widespread that people are scared, then the economy kind of shuts down. You know, you look at Athens, for example. Let's take Athens County. And John and I were on the phone with the health director, along with other health directors on the phone. I said, look, what's going to happen? What's going to happen in the fall when these kids come back to school, when OU is back, and you've got thousands and thousands of kids? So, and that's, you know, that's the concern. I mean, it's July, and we're seeing this in Athens now, so we're concerned. And so it's time. Okay, there's a warning. Now it's time for us to get control of that. And by us, I mean the people who live in Athens, people who run the bars, people who, you know, are there. It's time to get control of the situation, because you're going to have, you know, tens of thousands of students coming back in the fall. And it's not just unique to Athens, but it's got a lot of students coming in.
Governor, Stephanie Kuzerum with WKRC Local 12 in Cincinnati. I was wondering, besides the OHSAA, who are you consulting with specifically before making decisions on how fall sports should begin? And what do you hope to learn from them? And what are they advising for the start of competition for both contact and non-contact sports?
You know, I missed part of that, and I apologize. In regard to making what decision? That's the part I didn't get.
In making decisions on how fall sports should begin.
Look, we're monitoring these numbers, and we're looking at, and we're trying to see what is going on. I'll take the first part of that. John's been working directly with schools. I know he's also been working directly with the Ohio High School Athletic Association. So, John, you want to get the particulars on that?
Sure. You would be surprised how many people there are to consult with. We know about the professional teams who we've been consulting with them. We know about the Ohio States, but there's also the Mid-American Conference, other conferences from Division I to Division III who are interested in this at the college level, high school sports. But then you also have AAU and club sports and things like that, and people who own athletic facilities who run sports leagues in them. So you have that diversity of voice. It reminds me of the reopening schools. It's hard to come up with one set of plans that address the unique circumstances that everybody operates under. And that's the complexity of this. You want to try to treat people the same. You also understand that there are unique sets of circumstances. And we're doing this in an environment where we've had an increase in the number of cases and certainly in some parts of the state. So we're trying to balance the fact that we know sports are an integral part of Ohioans' lives, that kids really value them as part of their character and personal and physical development. We understand the magnitude of both and the consequences of either decision. That's why it's taking time to work with all of those different groups to try to get this right. And it's been complex, but when you're listening to all of these voices, it takes time to pull it all together in a changing environment as it relates to coronavirus. So know that it's been a very inclusive process. We understand that there's a need to get this information out, and we're working to come to that conclusion, hopefully here in the very near future.
Well, let me also point out that this ball game, if I could say this, is constantly changing. We're taking all the information in, but we don't have a crystal ball as far as exactly what this virus is going to do. I mean, what you're starting to see in college, athletics, certainly, you're starting to see teams that are being tested, and then you're starting to see what the results are. You're seeing that in the pro sports as well. So, all of that information is coming in. It's information that we are all of us, everyone out there watching on TV, is processing as well. So a lot of this is we're pulling in from all kinds of different sources, and it's a constantly changing and it's a moving target.
Are any of those voices athletic trainers, which are considered healthcare professionals of the sidelines?
Well, we consult with the schools. Athletic trainers are included in that. I don't know that we've talked specifically to an association of athletic trainers. I know we've talked to individual athletic trainers. They certainly, their voices matter in this as well.
Thank you.
Hi, Governor. Tom Bosco with ABC6 here in Columbus. There still seems to be uncertainty as to single patients with multiple positive tests for coronavirus. Are those being counted, and how do those affect the overall counts and the overall numbers that you're looking at in the state?
I'll tell you what I know. My understanding is that one person becomes one case, no matter how many times they have tested, and that process is done at the health department level. John, do you have any more on that?
It's a great question. I get it often. I directly ask the health department about this, and what they explained is that when you get tested, you're going to give your name and you're going to give your birth date, and they cross-match. So even no matter how many tests you've had, they're going to cross-match that and make sure that data is only there for a single individual. If you got tested 3 times, it's going to be deduped into one case per individual, per name and birth date.
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. You declined last night to go to a statewide mask order. With the addition of today's red counties, more than half of Ohio's population is now under a mask order. Governors and health authorities in 24 states now have issued mandatory mask orders, including 6 just in recent days, including fellow red state governors. What do they see, or what do they know that you don't when it comes to imposing a mask order?
Well, as you know, Randy, we were probably one of the first states to impose a mask order for business. So we did that very, very early. As you just pointed out, we have now 60%, as of tomorrow night, 60% of the population of this state will be living in a county that has a mask order. We may come to that. We may make a decision that the entire state will be under a mask order. What we've tried to do is to do 2 things. One is to give people the information that they need to make these decisions. Ultimately, order or no order, what people do when they go out of their house. Do they put a mask on? Do they have a mask? Do they put a mask on when they go into a business? The trend line is clear, and the evidence, as I pointed out last night, is overwhelming. So I thought I would try, Randy, one more time with an address in the evening to talk to the people of the state of Ohio about the importance of wearing masks. My experience in life is that people react generally better when you ask them to do something, when you give them the evidence, than they do when you tell them to do something. So I'm trying this, and I made an impassioned plea last night. I think we have the facts on our side. I know we have the facts on our side. Clear the scientific evidence is there, and I'm asking people of the state, no matter what part of the state they live in the next few days, to think about it, pray about it, and I hope that in the next few days they make the decision, even if they're in a county that is yellow right now. They need to know that their county may not be yellow in the future. They need to know that their virus is out there lurking in their county where they live. So I'm giving them a few days, and we hope that we'll see a lot more people who have masks on. I'm heartened, frankly, that we are seeing. And the culture, I think, is moving in this direction. I think when you have two big companies, for example, where virtually everybody shops, Walmart, Kroger, in Ohio, that's a real trend. So we're going to give it a little while, and I would not rule that out as we go in the future. But I think, again, people rather be asked than rather be told. And the bottom line is how many people are being careful. Because masks are important, but as we learned and we hear all the time, we heard from the health directors today, it's not just masks, it's people coming together. And there's only so much that, we can get into people's lives. Ultimately, it's going to come down to what they do when no one else is looking. What they do, do they have that block party? Do they have that party in their backyard where they've got a ton of people there? These are things that we can't control. But in the end, if they're armed with the sufficient facts and the evidence, and they see what a real threat that this is, and they know that we could become Florida in a darn short period of time, I hope that convinces them. So we'll see how good I'm doing at convincing people in a few days.
Thank you, Governor.
Good afternoon, Governor. It's Laura Bischoff, Dayton Daily News. Based on the current trends in those 19 red counties, and especially in light of the case numbers increasing among young adults, what concerns you about college students returning to campuses at University of Dayton, Wright State, University of Cincinnati, Ohio State, in mid-August, which is just 4 weeks away?
A lot. I think everybody should be concerned. The colleges are doing what they can. Some of them have alternative plans. Some are going partially distance learning. I think the next few weeks are going to tell the tale, frankly. We're talking about K through 12. We're talking about college. We all want kids back in school. What we do today, literally today, tomorrow, the next day, is going to determine whether that occurs or whether that does not occur. And it's not going to take an order from Mike DeWine. People are going to figure it out. And if these trend lines continue, if we continue to see more of these counties, like I said, it's not going to take an order. You're going to see colleges that are going to be dealing with their customers and their clients, and people aren't going to want to come back. Parents won't want to send their kids back. So we've got to get control of this. We've got to get control of it now. But we're 4 weeks away. You're absolutely correct.
Thank you.
Hello, this is Jessie Bulmer with the Inquirer, and I'm told I'm the last question. You've talked about the importance of, the dangers of traveling to hotspots. You've also said repeatedly that Florida is a trouble area. Are you planning to go to the RNC events in Jacksonville?
Well, again, I don't have a crystal ball to see exactly how it's going to take place yet. I'm a delegate for the president. We'll see. I'm not going to make that decision. I don't have to make that decision. Quite candidly, virtually every waking hour, I'm focused on Ohio. And the thought of even being away from Ohio that long a period of time is probably not something that I think is a great idea, but we'll see. Well, thank you very much. Unless there's some breaking news, we'll see you all back on Tuesday, and I hope everybody has a great weekend. Thank you very much.
All right, everybody, from Ohio to Colorado, where they are still speaking about their coronavirus update, a new mask mandate for those above the age of 10 while indoors. Let's listen in.
Slightly in the areas of mask wearing ordinances. So this data from these two different data points was key to me in deciding, yes, local requirements and county requirements can increase mask wearing, and no, it does not make people think that they can forget about social distancing. That's very important in coming to this decision. Next slide. This is even more important data. It's hard to get your arms around, but what this basically shows is that the areas of our state that have had mask wearing requirements have had slower spread of the virus. The virus has spread less in areas that have had mask wearing orders by a statistically significant amount, and that is incredibly important data point for me in making this statewide. What this also shows is even the areas with mask wearing requirements have still been increasing. So we still need to focus on that social distancing, but they've been increasing at a lower rate than the cities and counties that don't have it. Somebody mentioned repeat the details of the mask order. It's really simple, wear a mask. I mean, you can get into the details. Basically, it's a practical way to say wear a mask. I mean, obviously no one says wear a mask when you're eating or, you know, when you're working out by yourself. But you don't have to worry about the details. You just have to know you should wear a mask when you're in public. You're going to a store, you're going to the office, you're going to a place where others congregate. You need to wear a mask. It's practical. Obviously, where you can't wear a mask, you're not going to wear a mask, and nobody would ask you to. But anywhere where you're with others, public congregation, you need to do it. It's super important. Look, we have a choice in Colorado, either more mask wearing and more attention to social distancing, or more damage to our economy and loss of life. I mean, that's an easy decision to make when you put out that that's basically the decision we have. And of course, like anybody who cares about liberty and freedom, I'm resistant to institute a statewide mandate. But it's clear that at this point in time, this is the least bad of the options that we have at our disposal. It will increase mask wearing. It will decrease the spread of the virus. It'll provide clarity across different borders. And it's the right thing to do. And I want to give you an example of how effective masks are. A recent study from Missouri. The CDC published a study where they looked at the activities of 2 hairstylists in Springfield, Missouri, who both worked while they were unknowingly contagious with COVID-19. Both stylists wore masks at the salon where they worked, and 98% of the clients that they served also wore masks. Between the 2 stylists, they saw 139 clients, and despite both stylists being contagious with COVID-19, and despite the close proximity of haircuts, 0 clients contracted COVID-19. That is an example of how we can have a sustainable economy and we can get our haircut with COVID-19. As I mentioned, given the effectiveness of masks, we also will be helping school districts have the personal protective equipment that they need to be able to protect their staff. We will be able to get them medical grade masks. We're going to send them to the school district building, 1 per teacher per week, and then that will complement their efforts to have personal protective equipment for their staff and increase protections for teachers and students for school districts, regardless of what the environment looks like in the area and what format the year has. Finally, before I introduce Mayor Hancock, I just want to make one final point. You know, wearing a mask is not a political statement. I don't know how in anybody's mind this became a game of political football. It's simple, it's common sense, and it's data. The virus doesn't care what political party you're in. The virus doesn't care what belief system you have. The virus doesn't care what your ideology is. The virus is the virus. And it is a threat to every single one of us. And I completely understand and sympathize with concerns of businesses and workers and the desire to stay safe. And this will help do that. It'll help people who work, for instance, in retail and public-facing environments who have been wearing masks as a requirement since they've been able to reopen. But this will provide additional protection for them, knowing that their customers, maybe 65% were wearing masks before, now everyone will be wearing a mask, and it'll help save the lives of many of our retail workers as well. You know, if you drive a car, you wear a seatbelt, you obey the speed limit, you drive sober. Doesn't matter whether you agree politically with speed limits or with drunk driving laws, but we follow the law. If you have a political axe to grind, you do that through your elected representatives. But we have responsibilities as Coloradans and as Americans to follow the law. And the mask order is the law of Colorado. As I said throughout this crisis, we're going to monitor the data very closely. We're going to take appropriate actions as we need to protect our health care, our capacity, lives, the economy. and do what we can to make sure that Colorado can remain a positive outlier with regard to a nation that is having large problems in tackling this virus in a cohesive way. With that, let me turn it over to Denver Mayor Mike Hancock, who's been a very important partner in working hard to keep the residents of our state's largest city safe. Mayor Hancock.
Thank you, Governor, and thank you for this order. This is a tremendous tool for all of Colorado as we begin to continue our efforts to really get ahead of this spike. You know, when we instituted mandatory face coverings in Denver more than about 2 months ago, it was a decision based on science, as you just alluded to. Denver's health order was part of a bigger strategy to blunt the curve and the spread of the pandemic. Following the governor's guidance, staying at home, leaving only if essential for essential reasons, physically distancing 6 feet or more, not gathering in groups. These are strategies that kept Denver and Colorado ahead of the curve, and we intend to stay there. And that's why we're here today and why the governor has made this very wise move. You know, since we instituted the order, we've heard from businesses who've asked for support and signage, and we've supported that. But we've also heard from residents who report when they see a violation or someone not wearing a mask in public. And so this statewide order is a powerful, powerful tool for all of us across the state. Let me just give you one example. I shared this with the governor and Mayor Kaufman earlier. Denver is one of the top 3 cities in terms of our airports seeing passengers come through our airports. Well, we know during this pandemic that people are either seeking beaches or mountains. And with the beaches really being places where there are hotspots, they are coming to our mountains. Well, if you're up in a resort in our mountains, while the staff might be wearing masks, the only tool they have is to ask for compliance for people to wear a mask, to volunteer to wear a mask and comply with that request. Well, this state order now gives them the tool to say no one has a choice anymore. We all must wear masks to protect each other. So what we're going to be doing over the coming days in Denver is we'll continue to follow up on every one of the complaints and concerns that we hear from people with warnings and citations and appeals like this, asking our neighbors to do the right thing, to comply, and to mask up. We called our regional partners and we're grateful. Last week, several mayors joined together and wrote a letter and asked for our regional partners to mask up as well. And we want to thank Tri-County Health as well as Jefferson County for stepping up to the plate. This is how we find balance and learn to live in a COVID reality, tempering our progress when the data shows we need to slow down and do the right thing. That means taking action like this when we see 80 new cases a day and not waiting for those numbers to jump to 2,000 as we've seen in other cities like Miami to react. We've seen a growing number in cities across the country. I commiserate with my friends and counterparts all over this country who are having to roll back their openings because they understand just as we do how devastating having to shut this economy down would be to our businesses and to employees. So with the leadership of Governor Polis and partners like Mayor Kaufman, we are showing the nation how Colorado leads by prioritizing the health and safety of residents and the businesses that support our communities. So we recognize that we cannot do this alone. None of us can do this alone. And so through this order, we get the opportunity to all work together to keep each other safe. And Governor, again, I want to thank you for this because this, again, gives a very powerful tool to all of our businesses and workers throughout Colorado.
Thank you. And we have 2 Mayor Mikes with us. Mayor Mike Kaufman of Aurora has been a very important partner as we work to keep businesses open, keep folks safe, and I'm proud to turn it over to Mayor Kaufman.
Thank you, Governor. I strongly support Governor Polis's statewide face mask mandate because I believe that it is the best and that it is the least invasive and least costly public health option that is available to us to stem the spread of the COVID-19 virus. The alternatives are to shut down businesses and to force our schools to remain closed if no preventative actions are taken, and the COVID numbers increase to the point where further restrictions are required. Yesterday, I got a call from the Cherry Creek School superintendent yesterday morning, Dr. Scott Siegfried, and he talked to me about a mask mandate, and this is what he said. He said, when you consider the simple steps we can take to mitigate the spread of the virus, such as wearing a mask, I have one simple question. Why wouldn't we do everything possible to help ensure that students can have school this year? As a community, I hope we do the right thing to protect teachers, staff, students, and their education. And let me just say, I know there's going to be some grumbling about this. I get that. It's a mandate from government. But, you know, and yes, I get that some people are going to say this is a hardship. But let me tell you this, I meet with small businesses every day that haven't been able to open up, and then that if things get worse, will have their businesses shuttered again. That's a hardship. Children not being able to go to school, that's a hardship. So that, I mean, I think we need to put it in context, that this is really, again, the least invasive approach that we can do at this time as a preventative strategy. We have got to get children back to school. We have got to open up this economy. And that's what I fear most, is the inability to do that. And that's why I'm here today supporting the governor. Let me tell you this, before I wasn't on board when the numbers were going in the right direction. And the current strategy was just working. Hospitalizations moving down. Yes, there were more positives, but we were doing more testing. But now it's different. And now I'm worried. A lot of people are hurting because of the restrictions that have been imposed for the time that they were imposed, and some of them are still on us. And we do food drive once a week in Aurora, food distribution drive, and we help about 500 families. And that's really the depth of the suffering that has happened. So if people think wearing a mask is a hardship, they need to think about the others in our society that have been suffering, and that would suffer more if we have to reenact even more of these restrictions and not go forward and open up this economy. So I want to thank the governor for doing this, and quite frankly, the governor and I have had calls over the last couple of weeks. Well, I've asked the governor for this. Tri-County Health just passed a mandate for the 3 counties that the city of Aurora is in: Douglas County, Arapahoe County, and Adams County. But it was done with an opt-out clause. And so it's going to create a patchwork within the Denver metro area. And the fact is, the majority of the workforce in Aurora, the 54th largest city in America, 3rd largest city in Colorado, 382,000 in population. The majority of the workforce leaves Aurora during the morning, comes back in the late afternoon. And so the notion that we can have this patchwork and it would be effective is just not possible. And that's why over the last 2 weeks, I asked the governor for action. And he didn't tell, he never shared with me where he was on it. But thank you for listening, Governor, and thank you for your action today in putting Colorado on the right track.
And yeah, you shouldn't have to like look at a map and see what jurisdiction you're in to know if you're going to be safe when you're going to the store. Workers in stores, customers, and businesses deserve to be as safe as reasonably possible everywhere in Colorado, because we care about every Coloradan, and we're all interconnected. You might live in Aurora and work in Denver and visit your kids in Thornton. I mean, they're all, we're really interconnected, and it's really important we approach public health and keep our economy open in an interconnected way. Thank you to both mayors. As you can see, this is not a partisan thing. We are united using data, using science, Democrats and Republicans, independents, rural, suburban, urban. left, right, center, to protect people of this state and protect our economic opening. I want to reiterate, a big part of getting it right as numbers rise is also protecting those who are most at risk. And if you have pre-existing conditions, if you're an older Coloradan, stay home as much as possible. If we want to help get our state through this crisis, in addition to wearing masks, reach out to an elder offer to bring groceries to their home, ask if you can be of help so that they don't have to go out. Be a good friend. Be a part of every community support system. We need compassion now more than ever, and we need those everyday heroes, including you, to step up again and again for neighbors in need. That begins by wearing a mask, but it doesn't end by wearing a mask. This will continue to be a difficult time that demands a lot of us. We wish that wearing masks was a silver bullet and solved everything. It doesn't. We have to keep up the social distancing, not have large groups, avoid interactions, really focus on staying safe. Masks are an important part of that. They complement that, but we need to do better in other areas too. And it'll likely continue to be difficult for the next few weeks and months. Now, this is the situation we are in, not the situation that we want to be in or that we wish upon it ourselves, but we must take it seriously or it will deteriorate as it has in other states. As it's written in Proverbs 23:18, for there will be a future and your hope should never fail. And look, we have a bright future in Colorado. We're going to get through this. There will be a vaccine or cure, but in the meantime, we have to live in a way that's sustainable from a social perspective, a health perspective, a psychological perspective, an economic perspective, and we are not currently living that way. We were living that way late May, early June. We need to live like that. Masks and increased usage give us a little more freedom, but we cannot take this virus for granted. The minute we do, it will overtake us as it has overtaken our brothers and sisters in other parts of the country. We're going to get through this, but we need to step up our game, and we need to take this more seriously than we ever have. With that, we're happy to take some questions.
Governor, a week ago we sat here and you said that a mask mandate was unenforceable. I wonder what makes you think that Coloradans would listen to this mask mandate now that you've said that you couldn't enforce it. And also I wanted to ask if this is an inflection point now that we're seeing these cases rise, if we should have done this earlier and maybe we were too overzealous to loosen some restrictions.
So the two areas that convinced me that this would work is looking at the impact that mask ordinance have had, increasing mask wearing 15% over areas that have not had those ordinances. It's not so much because of the enforcement of those ordinances. They're not widely enforced, but the mere clarity of message of those ordinances in the areas that have them have successfully increased mask wearing by 15% and also led to a reduction in the spread of the virus. The state has a few ways to work with local law enforcement around enforcement. This creates a nexus to violating state laws around trespassing, which if somebody were to run into a store naked or without a mask, they are trespassing. And this gives that store the ability to call local law enforcement to enforce trespassing charge to make sure that they can keep their customers and their workers safe. And in addition, we also can make sure that businesses are following this protocol by making sure that they have that their licenses are always have to follow the health requirements. That's what restaurants.
All right, everybody, I'm going to interrupt Colorado. It is still going on live, but I have been recording on it, and we've been watching the recording that's about a few minutes behind. And that's because we have an update from Louisiana live right now that I want to be able to show you here on News Now and on coronavirusnow.com.
For the people of Louisiana, and they are firmly based on the authority that I have in Louisiana law, based in the Constitution and statutory law as well. And I will also direct some comments to businesses across the state of Louisiana. One of the things that the legislature paid particular attention to recently was trying to make sure that civil liability was limited. In fact, there was immunity provided to businesses across the state of Louisiana with respect to employees and customers who might claim to have contracted the disease on their premises and so forth. And that immunity was granted in several bills that I signed into law. But all of that immunity is contingent upon the businesses following the guidelines of the CDC. And if you don't honor those guidelines, then you run a very real risk of not having the protections that the law affords you with respect to those liability limitations. And so I think the Attorney General's opinion was wrong on many fronts, but in every front actually, but it could also cause confusion to business owners in a way that would potentially cost them a benefit of the laws that were passed just recently. And I'm asking that people comply, and I guess when it's in a mandatory order, it's more than asking. But whether you comply because you are worried about losing your immunity, or whether you do it because it's the right thing to do, and I assure you it's the right thing to do, whatever your motivation, just need people to follow the rules. Dr. Birx was very clear on Monday, publicly and privately. Given the amount of COVID in Louisiana today, how widespread it is, with, by her information, on Monday, 44 parishes having positivity factor of more than 10%. We know that 61 of the 64 parishes have high incidence rates of COVID cases of more than 100 per 100,000 over the last 14 days. That the only way to get back on top of this virus without going back to a stay-at-home order or to phase one is to have a universal mask mandate, to close bars, and to limit gathering sizes. That's precisely what we did. It was sort of fortuitous that became effective on the day of her visit. So just want to encourage people to understand where we are. We've got a lot of work to do. Everybody has a role to play. Yesterday we launched the Frontline Worker Fund. We've already received, as of just before I walked in here, about 125,000 applications. Surpassed the 200,000, and that's the cap on how many of these $250 awards that we can actually either today or tomorrow. So I am encouraging people to apply as quickly as they can. We do know that the $250 in terms of the monetary amount isn't enough for these people who kept working and made sure that society kept functioning and that the most essential things were available to the people of Louisiana, but it is what we can afford. It's what the legislature chose to do with $50 million of CARES Act funding. So if you've not yet applied and you're an eligible frontline worker, and to find out whether you're eligible, you can get more information online as well. And we do encourage you to apply online because that's the fastest way to do it. And it is sort of a first come, first serve program. So you can go to frontlineworkers.la.gov, frontlineworkers.la.gov to apply. We do have an announcement today on rental assistance as well. The Louisiana Housing Corporation, in partnership with the State Louisiana Office of Community Development, has created the Louisiana Emergency Rental Assistance Program to provide up to $24 million in emergency rental assistance to residents facing financial hardship as a result of COVID-19. The program is available to start taking applications today. This too will be administered on a first-come, first-served basis. The initial round of funding to kickstart the program is $7 million, which is immediately available. We anticipate additional funding soon for the remainder of the additional $17 million for the total of $24 million. We know that there are thousands of Louisiana citizens who will likely need assistance in addition to the funds that we have, and so we're going to continue to look for additional funding out of CDB Community Development Block Grant allocations not yet made to Louisiana, but authorized under the previous CARES Act, but other funding opportunities that may come down, including Phase 4 of the legislation that Congress should take up at the end of this month. And hopefully there will be some funding there for rental assistance programs as well. This program is designed to help renters who've experienced financial hardship as a result of shutdowns, closures, layoffs, reduced working hours, or unpaid leave due to the pandemic. So all of those individuals are encouraged to apply. The program can also provide financial assistance to Louisiana renters who are not current on their rent and are at imminent risk of eviction due to COVID-19. Eligible renters will have payments made on their behalf to their landlords. So these payments do not go to the renters, but they'll go directly to the landlords. The payment amount depends upon income, household size, and fair market rent prices. And so what I want to do is call up Keith Cunningham of the Louisiana Housing Corporation. He's going to describe the program in more detail. We have from the Office of Community Development, Pat Forbes, here today. He will answer any questions you might have about the funding, specific funding that has been made available for this and what we're trying to get online going forward. But I'm going to ask Keith to come up now and tell you more about the program. And then on the back side of his presentation, I will come up to conclude my remarks.
Thank you, Governor. Thank you for an opportunity to come and talk about this very important program, much needed program, the Louisiana Emergency Rental Assistance Program. This program is done, as the Governor indicated, in conjunction with several partners. The main component of that is the $7 million originally available for this program. The program will be accessed through a 211 service. That 211 service that is currently in use to provide information can be used to access information regarding this program. There's also a website, LouisianaRentHelp.com, which will also be an opportunity for individuals who are in need of rental assistance to go to that website and begin the application process. Currently, the program is available to individuals who are at 30% or below average median income. And what that represents in the state of Louisiana is for a household of one, $13,000, all the way up to $25,000 for households of 4 or more. And again, this program is designed to help those individuals who are unable to pay their rent due to impacts of COVID-19, the closures, and the isolation and self-quarantine related to the COVID-19 pandemic. There are some individuals who will not be able to participate in the program, and I want to be clear. Individuals who are already receiving governmental rental assistance will not be applicable to this program. Individuals who are living in public housing will not be applicable to this program. But individuals who are experiencing difficulty and who do meet those qualifications will have an opportunity on a first-come, first-served basis to receive that benefit. That benefit will allow for 3 months of rental payment moving forward, and 3 months of back rental payment as additional emergency solution grant dollars are made available to the program. Again, this is an opportunity for us to help those individuals who need assistance paying their rent, but this is not an indication that an individual does not have to meet that obligation. If you are behind in your rent, if you do have issues with your rental payment, please make sure you contact your landlord. Please make sure you keep in contact with those individuals as you work through this process. Even as this program is offered, we don't want to indicate that there's any assurance against anyone having to pay their rent. That burden still exists. This opportunity is to help those who have that need to meet that burden. And the last thing I want to make sure that we mention about the program is that as it is on a first-come, first-served basis, we intend to allocate this money in a judicious fashion very efficiently, but we're also aware that additional dollars will be made available. And so we'll try to continue to operate this program in a way to provide the assistance that individuals need throughout the state. Governor, if there's additional questions, we'll be ready to answer. But for now, that is the gist of the entirety of the program.
Thank you. And Keith will come back in just a moment. And again, if you have questions about the details of the currently available funding or what we're looking at going forward, Pat Forbes will be here as well to answer any questions that you might have about that. Obviously, Louisiana remains at a very critical stage of our COVID-19 response. We can turn this around again. We've done it once, and in fact, the Vice President remarked the other day that of all 50 states, Louisiana is the one that had the steepest growth in cases to begin with, flattened the curve, and now in this second resurgence is dealing with this. And so he too had confidence that we in Louisiana would do what's necessary in order to flatten the curve. I believe we are going to do this again, but I know we can't do it without everybody playing the part that they have to play. I do want to let you all know that every couple of 3 weeks I have the opportunity to have a conference call with hundreds of pastors across the state of Louisiana. Last week we had such a call and received a request that I'm happy to honor today. And I know it's a little bit unusual, but I think it's something it's important, at least for me and those people on the call and many other Louisianans. So I'm going to call for 3 days of fasting and prayer for our state for July 20th through the 22nd. So that's the 20th, the 21st, the 22nd. This will be the spiritual diet and exercise that I, as a Catholic Christian, believe is very important anyway. So we'll be doing lunch fasting for those 3 days and certainly praying as well. Praying for the people of Louisiana, praying for those who are sick, praying for those who care for those who are sick, and certainly praying for the families of those who have passed on. So if you're inclined, please join me and the First Lady and faith leaders across Louisiana, regardless of your denomination or your religion. And we would ask that you join us in prayerful reflection and fasting. Again, it's lunch fasting on those 3 days. At this point in time, I'm just going to remind everyone, we know how to be good neighbors. It's time to do that in Louisiana again. And if we will do that, we're going to get through this sooner and better. And with less people becoming sick, less people entering our hospitals and taxing our healthcare delivery system, and certainly with less people dying. We'll also do it in a way that will allow us to have more of our economy open, more of our schools open, and have as much normalcy as possible before we do fully get back to normal at some point in the future. And I'm optimistic that we can do this and that we will do it. So with that, I'm going to take your questions. I do have Dr. Biu here to answer questions today as well as the individuals that have already spoken. Yes, ma'am.
What would be your message to the hundreds of bar owners across the state who are worried that their businesses are not going to survive this shutdown?
Well, first of all, I would tell them what I said on Saturday. That is not a decision that I wanted to make. It's very, very difficult, but I do think it's absolutely necessary in order to protect the public health and make sure that we do, again, get back in front of this virus, that we flatten the curve and reduce the demand on our healthcare delivery system, and ultimately we're going to save lives. Clearly, I don't relish restricting any business of any kind, and that's particularly true of shutting them down. But it is very, very clear across the world, across the country, here in Louisiana, that bars and have contributed significantly to case growth, and that's borne out by the contact tracing that we've done. We have traced more outbreaks and more cases to bars than to any other setting, and that's true despite the fact that all of Phase 0 and Phase 1, they were closed. And it's also true that it's a best practice recommendation coming from the White House Coronavirus Task Force. On Monday's call with the nation's governors, Dr. Birx, who then came to Louisiana the next day on Tuesday of this week and repeated the same thing, included 3 things as being best practices right now for states like Louisiana, and those are mask mandates, bar closures, and limiting crowd sizes. And so it's not something that we want to do. Certainly we feel for them. We really do hope that the ability to have curbside pickup, it will be something that they can take advantage of. We know that that's not going to offer them the full range of services that they're accustomed to and so forth. But at the end of the day, very difficult decisions have to be made, and this is just one of those. Yes, sir.
Governor, over the past several days, we've talked to people who have at one point in recent days been in line somewhere in Louisiana, a lot of times in this area, to get a test. Whether the lines be too long or something else, they get out of line, leave, do not test regardless, and days later receive a call that they have tested positive when they have, in fact, not done a test at all. Is LDH aware of that? How is that, maybe taken out as positive, fake positive, false positive, kind of what is being done to make sure the numbers are as accurate? And
well, first of all, that's the first I've ever heard of it. I can't answer whether LDH has heard of anything happening like this, but the good news is I have Dr. Biu here. He can come up and I assume you heard his question. Okay, Dr. Biu will come up and address it.
So thanks for the question. I'll tell you that we have heard that it's usually, I know a person whose cousin said. That's the way that we get those questions. We have not any credible reports of that. Certainly, I think what we've seen in the last week is across social media a campaign to try to erode public trust in testing in general. I think those stories are a good example of that. I think questions that are raised about whether the Department of Health is listing cases as every positive test that's run, which is not the case. If you're a case on our board, it means that you have been tested at least once as a positive. If you're tested 12 more times, we don't add you 12 more times, you're just still that one case. These kinds of stories, I think, are insidious and pernicious and quite frankly scary from a public health standpoint, because I don't think that there is a widespread effort to raise numbers. We certainly have nothing to gain from that. What there is a risk of, though, is people feeling that testing doesn't work or that they don't want to get tested, because testing is the key beginning point to understanding your risk and the community's risk for COVID, having people know that they need to isolate, take care of their health, and for people who might have been exposed to that individual, know that they also need to quarantine. So again, we don't have any credible reports of that, but we hear a lot of rumors. And I would just emphasize, again, we've been very transparent with our data and would encourage people to reach out to the Department of Health where they have questions.
Anybody else with questions for Dr. B?
Yeah, well,
Sam.
on that, Red River Parish and also West Feliciana Parish have made essentially these claims that they have some sort of list of cases, right, and they believe there's duplicates on them. I think Mike Johnson, the congressman, actually posted about it today. So can you address that specifically, I guess the Red River Parish instance?
Sure. So early in the epidemic, many states, including Louisiana, began sharing information specifically with first responders. And it's really in the first responder systems that information is supposed to be listed. So that as people were responding to calls, they would know whether the individual that they had interacted with posed a risk of spreading COVID, kind of like an early contact tracing specific to first responders. Part of the data sharing agreement that we had with individuals was that data really was not for somebody to just pour over and look at. It was specifically to be entered into that system so that as somebody is dispatched, they would only have visibility in the person that they're responding to. We continue that practice to this day. What I believe we're seeing from Red River Parish Office of Emergency Preparedness is looking at their data, they feel that there are duplicate cases. And I think it's probably just a misunderstanding on their part. We've changed the way that we give that data. We now only provide new cases. I think in their posting they noted that they're looking at a cumulative list. They're not. And we hand both automatedly and manually deduplicate, as we've talked about before, move out of state people out of state, move out of parish people out of parish every day. And when we looked at Red River Parish's numbers at the time of their posting, they did have 96 cases. And we were not able to corroborate what they feel is, I think, something as low as 56 cases. So I do think we have a call set up early next week to hopefully have a productive discussion, which was what I hope would have happened at the beginning about data. I know that there's many questions about that data, but again, I go back to the importance, especially as public officials, of giving sound public information in the middle of a pandemic and not raising undue concern. Please. Yeah, to be clear, you are only ever a case once. So you test positive. If we test you every day for the next 10 days or however many, you may have 10 tests reported. I would not recommend that since we're feeling a pinch on tests. But you are only once listed as a case. Now, there are times, because of the way that sister hospitals may report their labs twice to us, that data may initially show up twice in our system, and that's why we have an automated system and a manual system to go through and remove anybody that's listed twice. And sometimes it's as simple as Robert being listed as Bob in the next lab. And so it takes something your computer can do and something that a human eye has to do to identify those are two people. But no, you are listed as a case once, no matter how many tests you have. I do want to sort of follow up on something else you said there, which is some employers are requiring people to test negative before returning. We are strongly recommending that that not be the practice. And in fact, when the Vice President and Ambassador Birx were here, they also emphasized that. With the strains that we're seeing on access to testing facilities, it is not appropriate to test otherwise healthy people to prove negativity for COVID-19. Really, you have to be a vulnerable nursing home resident or somebody who is otherwise particularly ill that we have concern, or immunocompromised that we have concerned you may not clear the virus as quickly for us to think you need to be retested. Most of the public, once positive, should be symptom-free for at least 3 days, more than 10 days after their positive test, and that is all that they need to be able to return back to work and what other engagement they do with the public. With a mask on, please. So we're not currently recommending something like that. When we look at gating criteria, we're really looking at a state policy level, movement into a phase, and potentially movement back in phases. I think even that, we're in a bit of an interesting moment where that paradigm is shifting. And you see that in the governor's latest order. We now have information and evidence from our own contact tracing, from studies done across the country, observed during this epidemic, that tell us we may not necessarily have to go back to a stay-at-home order if we can emphasize, the following things, because these were the things that seem to have the biggest impact. Ambassador Birx is working with a team at the Children's Hospital of Philadelphia, modeling, and the measures that she gave as recommendations to the state, certainly to our governor, were designed so that you could keep the economy open while apparently keeping below a reproductive number of 1. We haven't seen that data. I can't corroborate that, but that's the way that it's been explained to us. And so what I would say going forward for schools or whoever else is that as we have specific information, whether it's the risk of bars, whether it's the benefit of masks, that I think is important for them to operate on. And certainly there's always the risk that as a state, if our numbers in our hospitals get out of control, that would be something where we would need a cooling off period. But to be clear, we now are in a situation where we can act on best evidence. And I know I'm going long on this, and the last thing I'll say about best evidence is just this week the CDC released a study about mask wearing, highlighting the work of 2 hairstylists in Missouri, both of whom were actively shedding COVID, unaware of their status because of a turnaround time on tests, both of whom, according to Missouri rules, wearing masks, and all of their clients wearing masks. And over the course of 8 days of cutting hair together, they interacted with 136 different individuals, including coworkers, as well as people whose hair they cut. Not a single one of them went on to get COVID. I cannot underemphasize the importance of wearing masks The CDC and the federal government and even the White House are very clear that there's a reason we're saying wear your masks. It is going to make a difference between you potentially exposing somebody or being exposed. Right.
Can you be a little bit more specific? I know you don't want to give locations, but in terms of colleges, are we talking about staff or students getting infected? Are we talking about people in the athletic department, in the lab? I mean, the reason I'm asking is because I think when you say bar, I have a pretty good idea of like that type of setting. But college, are these people on campus when they're getting infected, off campus?
So it's a good question. I do not have that specific information, but we'd be happy to follow up with you, and we can talk with our epidemiologists and get that for you.
When you're talking about discouraging employers from using, from requiring tests for people to go back to work, then why are we encouraging evaluators to these federal surge testing sites for anyone who has no symptoms to go and get tested if we have a testing shortage? Wouldn't we want to prioritize those tests for people who are either first responders or people who have symptoms?
So in the Baton Rouge surge testing sites, there's a specific emphasis being placed in Baton Rouge on trying to suppress both symptomatic and asymptomatic spread. That's what the federal sort of setup of that system is. They've given us the access to the test. They're driving a lot of the protocols that we're using. So it's a unique situation there.
Ladies and gentlemen, the President of the United States.
Thank you very much, everybody. Please. That's a nice crowd on a nice cool day. It's beautiful, though. Might be hot, but it's beautiful. We're here today to celebrate and expand our historic campaign to rescue American workers from job-killing regulations. Before I came into office, American workers were smothered by merciless avalanche of wasteful and expensive and intrusive federal regulation. These oppressive, burdensome mandates were a stealth tax on our people, slashing take-home pay, suppressing innovation, surging the cost of goods, and shipping millions of American jobs overseas. Millions and millions and millions. It never ended. Nearly 4 years ago, we ended this regulatory assault on the American worker, and we launched the most dramatic regulatory relief campaign in American history by far. No other administration has done anywhere near. Thank you. At the heart of this effort was a revolutionary promise. For every one new regulation issued, we pledged that 2 federal regulations would be permanently removed. We not only met that ambitious goal, which at the time people said was impossible, we vastly exceeded it. For every one new regulation added, nearly 8 federal regulations have been terminated. Been an incredible achievement. As you can see behind me, we have removed the gigantic regulatory burden Americans have been forced to carry for decades, freeing our citizens to reach their highest potential. Our historic regulatory relief is providing the average American household an extra $3,100 every single year, and we're going up from that number. We're going up from that number. Think of that. $3,100 per household. Joining us today is Vice President Mike Pence. Thank you, Mike. Commerce Secretary Wilbur Ross. Wilbur, thank you very much. Labor Secretary Eugene Scalia. Thank you. Thank you, Eugene. Health and Human Services Secretary Alex Azar. Thank you, Alex. Transportation Secretary Elaine Chao. Thank you, Elaine. We had a great day in Georgia yesterday, cutting regulations like nobody's ever seen before. EPA Administrator Andrew Wheeler. Thank you, Andrew. Thank you very much. OMB Acting Director, Russ Vogt. Thank you, Russ. And Small Business Administrator, I love her name, Jovita Carranza. Jovita, thank you. Thank you. And CMS Administrator, Seema Verma. Thank you, Seema. Great people. Those are great people. They're doing an incredible job. I also want to thank the many state and local tribal leaders who join us in this great cause. Thank you very much, and thank you for being here. We appreciate it. Thank you all very much. What we have achieved together is truly without precedent, never happened before. The previous administration added over 16,000 pages of heavy-handed regulations to the Federal Register. That's why nothing got done. Under my administration, we have removed nearly 25,000 pages of job-destroying regulations, more than any other president by far in the history of our country, whether it was 4 years, 8 years, or in one case, more than 8 years. The prior administration piled up more than 600 major new regulations, a cruel and punishing regulatory burden that cost the average American an additional $2,300 per year. Think of that. The average American, $2,300 regulation, hitting low-income Americans by far the hardest. These regulations also inflicted a steep economic toll on African American communities. By contrast, our reforms are putting more money into the pockets of hardworking Americans. In addition to saving every family more than $3,000 per year, my administration has just issued another reform that my Council of Economic Advisors estimates will lower the price of new vehicles by more than $2,200 per vehicle, and I think we're going to get that up to $3,500 per vehicle. It's very exciting. And by the way, the vehicles will be better, they'll be stronger, and they'll be safer. Our regulation cuts are also delivering massive savings on broadband internet services, and some home energy bills will be really historically cut. It's actually amazing. As well as historically low gasoline prices. Gasoline prices, you look today, I think it was $1.99. At the same time, we saved our oil companies. We're now the largest, since we've been here, the largest energy source in the world. Nobody's even close, so it's great. But we saved them. They had a hard time a number of months ago, and frankly, for a long time, but we've saved them. But $1.99, they were telling me, in some cases lower than that. We're bringing back consumer choice in home appliances so that you can buy washers and dryers, shower heads and faucets. So shower heads, you take a shower, the water doesn't come out. You want to wash your hands, the water doesn't come out. So what do? You just stand there longer, or you take a shower longer? Because my hair, I don't know about you, but it has to be perfect. Perfect. Dishwashers, you didn't have any water, so the people that do the dishes, you press it and it goes again, and you do it again and again. So you might as well give them the water, because you'll end up using less water. So we made it so dishwashers now have a lot more water, and in many places, in most places of the country, water is not a problem. They don't know what to do with it. It's called rain. They don't have a problem. And old-fashioned incandescent light bulbs, I brought them back. I brought them back. They have two nice qualities. They're cheaper and they're better. They look better. They make you look so much better. That's important to all of us. But they're better and much cheaper. And they were mandated out, legislated out, and we brought them back, and they're selling like hotcakes. We stopped the egregious abuse of the Clean Water Act, which extreme activists have used to shut down construction projects all across our country. When I signed that legislation, I had many farmers and construction people standing behind me, people that haven't cried since they were a baby, some of them never even when they were a baby, and they were crying. Many people were crying. We gave them back their life. They took away their land. They took away their rights. They took away their life. By reining in EPA overreach, My administration has returned the agency to its core mission of ensuring clean air, clean water, and a truly pristine natural environment. Our air now and our water is as clean as it's been in the last 4 decades. Yesterday, our country achieved yet another groundbreaking milestone by completing a sweeping overhaul of America's badly broken infrastructure approval process. It was totally out of control. Instead of taking up to 20 years to approve a major project, we're cutting the federal permitting timeline, it's already been done, to a maximum of 2 years or less, in some cases even less than 1 year. And it's possible that it won't qualify. It's possible that it won't be good environmentally or safety-wise, in which case, at least in a period of a year or two, we'll raise the hand and you won't make it. But most projects will make it, but you won't go for 10, 15, 18, or 20 years. There are many horror stories that we could relate. We're reclaiming America's proud heritage as a nation of builders. My administration has also eliminated massive regulatory barriers in our battle against the China virus. These actions save countless lives, speeding up the production of equipment. That means ventilators like nobody's ever seen before. Probably the greatest source of manufacturing, the greatest achievement since World War II. We're now making ventilators for countries all over the world. In medicine, accelerating the delivery of life-saving treatments and ensuring that we will have a vaccine in a record time. We're doing fantastically well on that. That'll be for another time, another meeting, but we are doing on therapeutics and vaccines incredibly well. No administration in history has removed more red tape more quickly to rescue the economy and to protect the health of our people. When you think of it, we are all set up that as we get the vaccine or therapeutic, and we're set up militarily, we're going to be delivering it in record time. It's all set to move. We put an investment up front, and we have logistical people, generals, great people. They're going to be delivering this all over the country as soon as we have it, and we've made tremendous progress. You've been reading about it. In total, we've taken more than 740 actions to suspend regulations that would have slowed our response to the China virus. This includes lifting restrictions on manufacturers so that our great auto workers could produce more than 100,000 ventilators. So we've done over 100,000 in 100 days. Think of that. And we didn't have ventilators. We weren't set up for ventilators. We became a country that's making a lot of them, helping so many others. Countries that are never going to be in a position to make them. They're complex, they're expensive, they're big. Very, very, very tough to do, and we've saved a lot of lives. And there's never been a person in our country, even though we started with almost nothing. I say the cupboard was bare when we took over. We started with nothing. There's never been a person in our country, even though we had just absolutely no, we were going on empty. Never been one person that needed a ventilator that didn't get it. Think of that. Not one person. As complex as they are, as big, as expensive, take a long time to get them done. Not one person has ever needed a ventilator that didn't get it. We made telemedicine, thank you. Great job. Great, really a great job. The people here, they get no credit for it. I don't want any credit. They should get the credit, but they get no credit. But we've done a great job helping so many other countries now. We made telemedicine available to all American patients and allowed doctors to work across state lines. I will tell you, the telemedicine is something that's really gone up by thousands and thousands of percentage points of percent, because what happened is people that wouldn't even think of using telemedicine all of a sudden started using it, and it's really turned out to be good. Really turned out to be good, and it solved a lot of problems. So that's something, there's been great advancement. Furthermore, I've ordered federal agencies to look for ways to make these health care reforms totally permanent. Vice President Pence is also working closely with state, local, and tribal leaders to streamline occupational licensing. Over 30 states have taken steps to reduce these barriers to unemployment and to employment. and including a state that I love very much. I have a little history in that state, the great state of Alaska. Thank you very much, Governor, for being here. Mike Dunleavy. Mike, thank you very much. In Idaho, Governor Brad Little, who is here today with us as well, set a new record for regulatory relief. Good job, Brad. Good. Good governor. Great governor. Two great governors. The American people know best how to run their own lives. They don't need Washington bureaucrats controlling their every move and micromanaging their every decision. With each regulation we cut, we are not only returning the money and the power to our citizens, we are draining the Washington swamp, and they're not happy about it, I can tell you that. I think you know that. The swamp was deep, I just didn't know how deep. Deeper than I thought. Joining us today are a few of the countless Americans who are personally benefiting from our pro-worker reforms. Joe Cambria owns Cambria Truck Center in New Jersey, good state, New Jersey, and it's been really something that he's seen firsthand, how our regulation cuts have helped create thousands and thousands of jobs. Joe, please come up and say a few words. Thank you, Joe.
Thank you, Mr. President. Our company, Cambria Truck Center, has been selling and servicing heavy-duty trucks since 1969, when my grandfather, uncle, and father started the business. In the past 3.5 years, the Trump administration has kept its promise to right-size regulations. I want to thank you for that, President Trump. Regulatory reform in the energy sector creates jobs, reduces costs for our communities, and puts trucks to work. Streamlined permitting and creating an environment that allows for efficient construction and infrastructure repair and development has the same effect. As a result of these regulatory reforms, our industry has seen record sales of heavy-duty trucks, which has been a boon to dealerships like ours, as well as the environment. When new trucks replace older models, there is an environmental benefit. Current powertrains have near zero emissions today, and we're going electric, as well as increased safety, like shorter stopping distances and collision avoidance technology. Safer on the road. It has also been nice to hear "Made in the USA" again. Bringing manufacturing back to our shores helps our industry and our entire country. In short, when we cut red tape, we create an economy that is responsible and sensible. We as Americans all win. Thank you, President Trump.
Thank you very much. Thank you. Good job. Good job. That was easy, wasn't it? Huh? Thank you very much. Great job. Dr. Amy Johnson is a nurse practitioner in rural Virginia. Amy, please come up and share with us how important expanded health care and telehealth has been for you and your patients. Thank you. Thank you very much.
Thank you, Mr. President. Good afternoon. My name is Dr. Amy Johnson, and I'm from Bedford, Virginia. Telehealth deregulation has been of substantial benefit to my colleagues and I over recent months during the COVID-19 crisis. Prior to COVID restrictions, our small local hospital that had limited access to specialty services used telehealth for neurological, mental health, and palliative care consults. However, telehealth was not something that was used within our primary care setting. Since the deregulation of telehealth restrictions and expansion of guidelines through CMS, we've had the opportunity to integrate video and audio visits as part of our patient care experience. During the COVID crisis, there were days when almost all of my visits were done via telehealth. This allowed me to continue to care for my patients, including those that were the most vulnerable, without risking exposure to illness by bringing them into the office setting. Since we've gone back to a more traditional model, we've continued to offer telehealth visits, which are a valuable option for home health and hospice patients, patients with limited mobility, and patients that remain at high risk. As a farm safety specialist, I can see the use of telehealth expanding to offer more services to our farming population and rural Americans, including much-needed mental health services, which are unfortunately very sparse. In addition, access to primary care and to specialty services can be improved in medically underserved areas with deregulation and the use of telehealth services by healthcare providers, increasing the use of preventative healthcare modalities, allowing for more intensive management of patients with chronic diseases, and decreasing healthcare disparities. Thank you, Mr. President.
Thank you very much. Great job. Thank you. So that's been a great help to you. Telehealth, it's been an incredible thing. Great job. Thank you very much. Jim Chilton is a rancher from Arizona who was crushed by the Obama-Biden administration's ridiculous Waters of the United States rule. It's been a catastrophic rule, but it's gone now, which gave bureaucrats power to regulate every puddle on private land as though it were a lake. Jim, please come up and tell us of your experience, which I know wasn't a good one, but it's a good one now. Please.
I appreciate the invitation, President Trump, to be here. And I appreciate the opportunity to thank you for the deregulation in every area, including the waters of the United States, cutting the red tape, setting us free as private property owners. Thank you. Our ranch has approximately 100 dry washes flowing across it. These are little washes with no water. The Corps of Engineers, the Environmental Protection Agency, who wrote the Obama 2015 regulations, ruled that any dry wash that had more than 12 inches of sand in the bottom became a water of the United States. Hence, we were subject to regulations and oversight from Washington, D.C. and San Francisco. It was outrageous. I believe that the 2015 rules and regulations were overreaching, caused red tape, and threatened me and other farmers, ranchers, businessmen, and landowners with the possibility of going to jail and facing huge fines. Thank you, Mr. President, for the navigable water protection rule that you promulgated. It has set us free. The heavy hand of government is no longer on our shoulders. Thank you, Mr. President. Thank you,
Jim. Thank you very much. Thank you, Jim. That was my honor, Jim, and thank you very much. It's terrible. It was that you had to suffer so long. They took your property away from you. And you want to take care of your property better than any government is going to tell you to take care of your property. You'll take care of it better, so we don't have to worry about that. Thank you very much. Beautifully said. Thank you. I want to, just as president, say that I will always fight to defend your rights and your freedoms. I will fight very hard for your rights and your freedoms. The hard left wants to reverse these extraordinary gains and reimpose these disastrous regulations. They want to take what we've taken off, Jim, and they want to put them back on. And I guess they can do that. You'll fight them for a little while, but eventually you'll lose. And they want to bury our economy under suffocating, relentless landslides of Washington red tape like we had before I got here. We must never return to the days of soul-crushing regulation that ravaged our cities, devastated our workers, drained our vitality and right out of our people, and thoroughly crippled our nation's prized competitive edge. It's what we have. We have great, great people, the greatest people in the world. Our entire economy and our very way of life are threatened by Biden's plans to transform our nation and subjugate our communities through the blunt force instrument of federal regulation at a level that you haven't even seen yet. You think that was bad? You haven't even seen it yet. They want to go many times what they put you under in the past. Under the unity platform Joe Biden published with socialist Bernie Sanders, they are proposing, and this is all in writing, it's done, they agreed, they are proposing to re-enter the job-killing, unfair Paris Climate Accord, which will cost our country trillions of dollars, trillions and trillions of dollars, and put us in a very, very bad competitive position relative to the world. Not surprising to you, China will be greatly advanced under this ridiculous agreement. So will Russia, so will many other countries. They propose to mandate net zero emissions from all new homes and buildings, skyrocketing the cost of construction and putting the goal of home ownership out of reach for millions, destroying the look of the home, the beauty of the home. I'm somebody that's built many homes, many buildings. If you take a look at this, it doesn't look good. You still have to sell, right? You still have to sell. But they've put it out of reach from a cost standpoint, totally out of reach. It's not practical. It's not good, and it doesn't work. They want to eliminate carbon from the U.S. energy industry, which means abolishing all American oil, clean coal, and natural gas. No coal, no gas, no oil, nothing to fire our massive plants. The result of this federally mandated shutdown would be the wholesale destruction of the entire energy industry and many other industries, the economic evisceration of entire communities, and the unfettered offshoring of millions of our best jobs to foreign countries and foreign polluters. Millions and millions of jobs would go. Thousands and thousands of countries would be at a level that you've never seen. Companies would be disappearing left and right, just like they did with NAFTA, which we terminated for the USMCA, which is another beauty that we've done, not for now, but another great beauty. But thousands of companies, plants, factories would be closed. Under this dismal future, energy would be unaffordable for the vast majority of Americans, and the American dream would be sniffed out so quickly and replaced with a socialist disaster. The Democrats in D.C. have been and want to, at a much higher level, abolish our beautiful and successful suburbs by placing far-left Washington bureaucrats in charge of local zoning decisions. They're absolutely determined to eliminate single-family zoning, destroy the value of houses and communities already built, just as they have in Minneapolis and other locations that you read about today. Your home will go down in value and crime rates will rapidly rise. Joe Biden and his bosses from the radical left want to significantly multiply what they're doing now. And what will be the end result is you will totally destroy the beautiful suburbs. Suburbia will be no longer as we know it. So they want to defund and abolish your police and law enforcement, while at the same time destroying our great suburbs. The suburb destruction will end with us. Next week, I will be discussing the AFFH rule. AFFH rule, a disaster. And our plans to protect the suburbs from being obliterated by Washington Democrats, by people on the far left that want to see the suburbs destroyed, that don't care. People have worked all their lives to get into a community, and now they're going to watch it go to hell. It's not going to happen, not while I'm here. The Biden-Bernie plan would also use the weapon of federal regulation to tie the hands of our police departments by abolishing cash bail. Think of that. Think of that. Bail. No problem. They killed somebody, let them out. Take a look at what's happening. Crime in New York City up 368% from just a short while ago. They got rid of a lot of police, and they're in the process of doing it $1 billion. They probably want to abolish. It's not even believable. When I first heard about it, when you first heard about it, you didn't think it was real. You didn't think it was believable. Just like the Green New Deal. How crazy is that? But they're actually trying to put it into play. It'll mean the end of this country. So by getting rid of bail, they are incentivizing jail and prison closures. They want to get rid of prisons. They don't think anybody should go to prison. Setting loose violent criminals, appointing left-wing social justice prosecutors, like you have in Philadelphia, where people creating and doing the most criminal of acts are let go, in many cases, immediately, and making our wonderful cops, our great, great police, cops, subordinate to distant bureaucrats who have never spent a day in their lives fighting crime. Unlike the socialists, we believe in the rule of the people, not the rule of the unelected bureaucrats that don't know what they're doing. We believe in the dignity of the individual, not the iron grip of the state. Our regulatory reforms are vital, not only to the success of our economy, but the strength of our democracy and the survival of liberty itself. My administration will continue pressing forward until we have made every last vestige of Washington fully, completely, and totally accountable to the citizens of the United States. We are putting our faith in the workers who power our country, the doctors who care for our country, the truckers who sustain our country, and the farmers and ranchers who preserve our country in all of its majestic beauty. The American people are the ones who made our nation great, and together we will make it greater by far than ever before. God bless you, and God bless America. Thank you very much for being with us. Thank you very much. Thank you. Thank you very much. Thank you. Thank you. Thank you very much. Thank you. We must have said something right. I guess we said it absolutely right. It's about our country. It's about our country. We want to be strong. We want to respect everybody, but we have to have strong law enforcement. And that's taking place in the areas that we're responsible for. We want others to call us for help. There's nothing wrong. Let Chicago call. Let Seattle call. We were going into Seattle, all set to go, and then they did it themselves. They heard we were coming in, and the hands went up. They gave up. I mean, it's so terrible when you see what's happening. Minneapolis, we said, get the guard in there. 3 nights, get the guard in, get the guard. We got the guard in. The National Guard, they've done a fantastic job. As soon as they showed up, it was like a knife cutting through butter. You saw that, right? After 4 days of horror. It wasn't the police's fault in any of these places. They were told to leave. The police are, generally speaking, they do a great job. They were told to leave. But you saw what happened. Minneapolis, grab your gun and run. That's not what they wanted to do. But the National Guard came in, and we did a great job. No problem after that, do you notice? We just passed a statues and monument executive order, and they were going wild. They see that beautiful, look at it right there, it's so beautiful, the Washington Monument. If they had their choice, they'd take it down, and I guarantee you they'd rename it. They want to rename it. They want George Washington out. They want Thomas Jefferson out. They want Abraham Lincoln out. They want abolitionists out. They don't know what they want. They just want to destroy our country. We're not going to let it happen. We're not letting it happen. So I'd now like to ask Vice President Mike Pence to say a few words. Thank you, Mike. Thank you.
Thank you, Mr. President. It's a privilege to be with you today. Thank you for bringing together all these great, hardworking Americans, to be able to hear their stories, be able to reflect on the fact that before the coronavirus hit our country, thanks to your leadership, we built the strongest economy in the history of the world. In 3 short years, Mr. President, you kept your promise to the American people. We cut taxes across the board. You fought for free and fair trade. You unleashed American energy. And you rolled back regulations to help all Americans. And after 40 years of over-regulation, Mr. President, you delivered 4 years of regulatory freedom. And in our first 3 years, the results were extraordinary. Businesses large and small created 7 million new jobs. Wages rose at their fastest pace. In more than 10 years, 2 million Americans were lifted out of poverty, 7 million Americans lifted off of food stamps, and the highest median income in the history of our country. And Mr. President, as you just reflected, a centerpiece of that was lifting red tape off the American people and American free enterprise. I remember those days in the campaign 4 years ago when you promised that for every new regulation, we'd eliminate 2 rules off the Federal Register. But as you just said, Mr. President, for every new regulation put on the books, you actually repealed nearly 8 regulations off of the American people and the American economy. And this president has already signed more bills rolling back federal red tape than any president in American history. They tell us that we've saved $220 billion in our economy, and as you said, more than $3,100 for every American household. And beyond all of that, the regulatory reform now has America as the largest supplier of oil and natural gas in the world and a net exporter of energy for the first time in 75 years. That's what your deregulation agenda delivered. And today, Mr. President, as we continue to respond to the coronavirus pandemic, at your direction, we're ensuring that our states, our hospitals, and our extraordinary healthcare workers have not only the supplies they need, but the freedom and the flexibility to give every American the same level of care that each one of us would want a family member to have. And as we meet this moment in this pandemic, we're also opening up America again. It's extraordinary to think, Mr. President, at the height of this pandemic, our economy had lost 22 million jobs, but because of the strong foundation that you laid of less taxes and less regulation, in 2 short months, May and June saw record-breaking job creation. We've already added 7 million jobs back to the American economy, and we're just getting started. This record job growth, Mr. President, is a tribute to the resilience of the American people, strength of their character. It's a resilience to your leadership, to the agenda that you advanced in our first 3 years. But as you said, Mr. President, it's also a tribute to governors across the country who not only supported your agenda, but also in more than 30 states, governors actually delivered on that same agenda of less taxes and less regulation. And while I've been leading the White House Coronavirus Task Force, it's also been my honor, Mr. President, to lead the governor's initiative on regulatory innovation and to work with these extraordinary governors. The truth is, because of your leadership and example, governors across the country have been reducing the burden of regulations at the state level. And that's what's contributed to the strong foundation on which we are standing, and the American recovery has already begun. Fortunately, as you mentioned, we have 2 of those great governors with us today. Now, the first is a governor who in his very first year in office cut or simplified more than 75% of his state's regulations and cut the administrative code by 20%. Would you all join me in welcoming Idaho's great governor, Brad Little, to tell us Idaho's story of deregulation.
Thank you, Mr. Vice President. Mr. President, it's a great honor to be here. As the Vice President alluded to, our route to rebound is dependent upon the red truck, not the blue truck. What we did what we did in Idaho, where we had the third lowest unemployment, the third fastest income growth of any of the states, particularly for those at the lower end of the income, was to match up with your regulatory reform and make more opportunities available. Whether it be the spouse of a military veteran that came there that wanted to have their license and their home state transferred, which today I can proudly say takes us 1/2 day to get that done so that those people can be there. Right. Whether it's a small business that wants to break through and remove the regulatory friction that existed there before. But as this economy changes as a result of what's taken place, you have to free up all Americans to have that freedom to create a new opportunity. One of the things that we did that we heard about from the good doctor was telehealth. Between CMS, the department, and what we did in Idaho, we increased telehealth availability in Idaho by 4,000%. Idaho is a rural state. Idaho is a state where accessibility and the cost of health care is always an issue. It's the combination and the teamwork of your administration and what we've done that made that available to where we will rebound in Idaho, and thank you very much, Mr. President.
Thank you very much, Brett. Thank you. Thank you, Brett.
Thank you, Governor Little. And finally, Mr. President, allow me to introduce the governor who told us in December when you kicked off the governor's initiative on regulatory innovation that in his first year in office, his administration modified or rolled back 239 different regulations in over 100 professions. He is making sure that Alaska is open for business and prospering with less taxes and less regulation. Join me in welcoming Alaska's great governor, Mike Dunleavy.
Thank you, Mr. Vice President, and thank you, Mr. President, for having us here today. What you've done here for us, for governors and the people of this great country, and Alaska, we are part of the great country, by the way, Mr. President. You know that. You are. The President has been up in our state. We've met at least 8 times, and when he stops over in Anchorage, Alaska, on his trips, he always wants to meet, and the first thing he says is, can we meet the troops, and what do you need in the state of Alaska? This is a small state population-wise, way up north, but this president sees the importance of that state and its people. This is really about hope, Mr. President, restoring hope and opportunity. And this is what you've done. This is really about the art of the possibility. As the previous Governor Little said, this is what you've done is historic, and it's going to continue to be historic. In Alaska, for example, we have communities that are 500, 600 miles off the road system. The telehealth regulations that have been put in place now are not only going to be good for medicine, but they're going to save lives as a result of the work that you and your team have done. We look at our resource development. We look at businesses, small and big, and you've renewed hope that it is possible to achieve the American dream. These regulations over the past 40 years have really, in many respects, killed the American dream. As you said, strangled the American dream. And in the end, really what this comes down to is how does it impact the individual American, the individual Alaskan in my case. And I want to tell you, what you've done is when the landowner goes and decides that they want to do a little landscaping on their property, do they have to look over their shoulder and wonder if big government is watching them? Can they do what they need to do on their private property? You've restored the hope that they can realize the American dream. And this goes for our corporations, this goes for our entities, our nonprofit entities, this goes for our native corporations in Alaska. What you've done is restore hope and opportunity, and we're looking forward to more years of this opportunity, Mr. President. So thank you very much.
Thank you very much, Mike. Thank you. So we have many exciting things that we'll be announcing over the next 8 weeks, I would say. Things that nobody has even contemplated, thought possible, and things that we're going to get done, and we have gotten done. We've started in most cases, but it's going to be a very exciting 8 weeks. a 8 weeks, like I think, Mike, we can honestly say nobody's ever going to see 8 weeks like we're going to have, because we really have. We're taking on immigration, taking on education, we're taking on so many aspects of things that people were hopelessly tied up in knots in Congress. They've been working on some of these things for 25, 30 years. Wasn't happening. But you'll see levels of detail, and you'll see levels of thought that a lot of people believed very strongly we didn't have in this country. We're going to get things done. We're going to get things done that they've wanted to see done for a long, long time. So I think we'll start sometime on Tuesday. We'll be discussing our one plan on suburbia, but that's one of many, many different plans. Then we're going into the immigration, the world of immigration, the world of education. We're going into the world of healthcare, very complete healthcare. And we have a lot of very exciting things to discuss. But cutting of regulation has been really something that I felt we could do, and we could do fairly easily. Nothing's easy in this country. We had statutory requirements where we'd do phase 1 and then we'd have to wait 90 days. We'd do phase 2 and we'd have to wait 60 days. We'd do phase 3 and we said, let's do phase 4. Sir, I'm sorry, you have to wait 1 year. But we were able to do things that nobody has ever been able to do, or even close, on deregulation. And these trucks, this really is a great little example. I don't know who thought of this idea, but it's actually quite simple and quite good. Is that Brooke? Quite simple and quite good. I don't love having that big sucker hanging over my head. I want to get out of here as fast as possible. But I do want to thank you all. Incredible people. You've done an incredible job. And to the speakers, please, thank you very much. Great job. Thank you very much. Thank you, everybody. Thank you. Thank you. Thank you, Brett.
All right, guys, just want to say thank you again for being here with us on News Now. If you want to rewatch any part of this little speech, ceremony, whatever you want to call it, with President Trump, Vice President Mike Pence, you can do so on our YouTube stream. We are going to be clipping it in its entirety for you. We do a lot of video clips each and every single day of memorable moments, I kind of like to call them, of things that are important to either go back and take a close listen to, or even just some moments that you couldn't believe that happened. So once again, thanks for being here with us. Here is a live look at those latest numbers of COVID-19 here across our country. We do have more than 3.5 million Americans who've tested positive for COVID-19. President Donald Trump the other day had mentioned that they had more than 45 million, I believe it was, who have been tested. So we do see that number 3.5 could be related to the amount of testing, and that's an emphasizing point President Trump always mentions. All right, guys, we do have a very special thing we're going to bring to you next. It just popped up here on our board. The top U.S. infectious disease expert, you know him from being on the White House Coronavirus Task Force team, Anthony Fauci. He's actually doing a Facebook Live session with Mark Zuckerberg about COVID-19. Going to stop talking, jump right into it so you guys can listen in as well right here for you on News Now.
And what do we do to improve from here?
Well, as you described accurately, Mark, we do have a serious situation now. I mean, it's a mixed bag. There are parts of the country that are doing well. The northeastern part, particularly the New York metropolitan area, was hit very hard. There was a period of time when more than 50% of all the new infections and hospitalizations and deaths were right in New York City. And there was a time when they were essentially leading with regard from a bad standpoint, namely illness and death. They've done very, very well right now. They've come back down. They're opening in a very measured way. However, as you alluded to, simultaneous with that, in another region of the country. Southern states, particularly exemplified by Florida, California, Arizona, Texas, have seen surges that are really quite disturbing. Surges, as you mentioned, that have gone up to over 60,000 cases a day. That obviously is something that we must address in a very, very cogent way. And if you look at the reasons for that, you ask the why. Why is, it's a complicated answer to that. But one of the things that became clear is that when you look, and I'm not going to name any specific states, but there were some states that actually, when you look at what the guidelines were for opening, the checkpoints that you'd have to get past before you went to the next phase, some of them went too quickly and officially jumped over them. That, as I had said in previous discussions, is a recipe for getting into trouble. In other situations where the states actually officially, the governors, the mayors, put out and delineated exactly what should be done, but the citizenry of the state or the city had the impression that you went either from lockdown to put caution to the wind. And what we saw were clips of people at bars congregating without masks, not staying distant, in crowds. And that's what I believe is at least part of the explanation for why we've seen this surge as went up. That's the first thing. The other thing that's important in the comparison to other countries, which is, in some respects unfair, but in some respects is fair, that when you looked at what happened in the European countries, when they had their peak and they locked down to the tune of about 90 to 95% of the country truly locked down. So they went up and then they came down to baseline. And when I say baseline, I mean literally handfuls of new cases, 10s, 20s, 30s, not hundreds and thousands. When if you look at the United States as a whole, when we went up and peaked and started to come down, we never really went down to baseline. We plateaued at around 20,000 cases a day, each day, until we got into the resurgence, which then came back up to 30, 40, 50, and 60. So because of that, what I think we need to do, and my colleagues agree, is that we really got to almost regroup, call a timeout, not necessarily lock down again, but say we've got to do this in a more measured way. We've got to get our arms around this, and we've got to get this controlled. If we don't do that, Mark, we're going to wind up getting a situation where in other states, we may be seeing the same thing. So it's a mixed bag in this country. Some areas doing well, but some really we've got to really pay attention to and do something about it.
All right. Well, Doctor, I strongly agree that we need somewhat of a reset here. As someone running a business, I've said that I believe the best way to improve both public health and economic opportunity in this country is to focus on beating this virus first. And I also have to say, I think you might be quite generous in your description of the government's response here. I was certainly sympathetic early on when it was clear that there would be some outbreaks, no matter how well we handled this. But now that we're here in July, I just think that it was avoidable, and it's really disappointing that we still don't have adequate testing, that the credibility of our top scientists like yourself and the CDC are being undermined, and until recently, that parts of the administration were calling into question whether people should even follow basic best practices like wearing masks. But look, the U.S. is a resilient country with a lot of ingenuity, as you say, and we can't forget that the U.S. is helping to lead the way on vaccine research, which I want to make sure we get to in a bit. And I also get that our understanding of facts changes as time goes on, and we all have the opportunity to reassess what we've learned and to change course going forward. And I know I try to do that personally, and I hope that we as a country can do that now too. And I know that you've also faced some critique that your guidance has evolved as we've learned more. So I'm hoping that you can tell us a bit more about how your understanding of what we should do has evolved, and maybe some of the areas where your guidance for people around the country has changed.
Yeah, Yeah, I mean, obviously, when you're dealing with something that's changing in real time, Mark, that's really the nature of science. You look at the data and the information you have at any given time, and you make a decision with regard to policy based on that information. As the information changes, then you have to be flexible enough and humble enough to be able to change how you think about things. And I think, one of the important things that we're emphasizing right now that really evolved from a situation that did change is our insistence now on wearing masks. I mean, masks are very important. They protect you from giving infection to someone else. If you happen to be inadvertently infected, and I'll get back to that in a moment, because there's such a significant percentage of the cases that are actually without symptoms. So anyone at any given time could be infected, don't even know it, and feel perfectly well. So you have a responsibility. You can get protected. Now, early on, when we were in a situation in which there was a real concern about the lack of personal protective equipment on the part of the health providers who needed it, who put themselves in harm's way every day to take care of people who are ill with this virus, that we were thinking we would run out of masks and other things for them. So the recommendation was not to wear a mask because of the shortage of it. Two things happened. One, it became clear that we had enough of the equipment, so there was no shortage. It became clear that cloth coverings that you didn't have to buy in a store, that you could make yourself, were adequate. And thirdly, and probably the most compelling thing, is when it became very clear that anywhere from 20 to 45% of people who were infected didn't have any symptoms. So the risk of your being in contact with someone who said, well, you look good, I look good, we're not infected, was not the case, that you could be spreading it asymptomatically. You put all of those things together, which had us evolve from saying maybe we should hold off on masks because we needed them for the healthcare workers, to saying now everybody should be wearing a mask when they're outside and should be trying to distance. That's one example of evolving as you get more data and you get more information.
That makes sense. I'd like to dig a bit deeper into this idea of what doing a reset now would entail. And to be clear, you're not suggesting that we do another lockdown. So what steps do you think we need to take to get this under control now?
Okay, so if you looked at had things been done perfectly, it should have been that wherever you were, a state or a city, in a particular dynamics of infection of where you are, you could judge where you should be. Should you be at the gateway waiting for 14 days going down? If so, could you go to phase 1? Could you go then to phase 2 and then to phase 3? When I say a reset button, I say, okay, time out. Let's everybody regroup, because if you were in a situation where you should not have jumped over one of the checkpoints, you got to think about pulling back, starting all over again, and doing the gradual entry into, quote, normality in a way that's in accordance with the guidelines. Number 2, if in fact you are in that, you've got to be really very careful that your citizenry understands the importance of abiding by these guidelines. You have to wear a mask, whether that mask is mandated, whether it can be feasibly, locally mandated. I would recommend as strong as you possibly can to get people to wear masks, to avoid crowds, to keep distances. Outdoors, always better than indoors. So when you're talking about the kinds of recommendations, that's what you've got to do. And quite frankly, Mark, if you look at it, that hasn't been done in every single instant. So we've got to go back and re-look at what we're doing and re-enter. The most important thing is that there has been this unusual and unfortunate mindset of there's public health measures and there's getting the economy back. And these are two opposing forces. as I've said so often, and I want to repeat it with you here, Mark, is that we should be looking at public health measures as a vehicle or a gateway to opening the country again, to getting the economy back, not as the obstacle in the way, but as a gateway. And if we do it in a measured way, I strongly believe we can turn this around in the southern states that are getting hit right now, and we can prevent it from happening in states that are still at that point of trying to open up. You've got to do it correctly. You can't jump over steps, which is very perilous when you think about rebound. And the proof of the pudding is look what's happened. There really is no reason why we're having 40, 50, 60,000 other than the fact that we're not doing something correctly.
Yeah, that makes a lot of sense. So I want to make sure that I want to get to your guidance for young people specifically, who are a very important part of how we slow the spread of this. And I know a lot of younger people are watching this right now, and I know this because the last time we did a live video, I think all the streams were viewed, I think more than 50 million times, including by a lot of young people. And young people are going to be really critical to getting this right, because right now a lot of the new cases are younger folks. So what should young people be doing to stay healthy and to make sure that they can keep the people around them healthy?
Mark, thank you very much for asking that question, because I think it's critical to everything that's going on right now in the country. If you look at what's going on with the new infections, the age range of the infection, the median age, is about a decade and a half younger today than it was a few months ago. So you're absolutely right. Young people are intimately and heavily involved in what's going on now with this pandemic. So let me just say one thing, and I address it to the young people who are watching this. It's totally understandable that you see the data. Young people are smart. They know what data means. And the data tells us that if you're a young person, the likelihood when you get infected of getting seriously ill is much less than an older person, the elderly, or people with underlying conditions. That's just the truth. That doesn't mean that some young people, and we have ample examples of that, who are young and otherwise healthy, can get seriously ill. I mean, really seriously ill, or can be knocked out on their back and brought to their knees pretty quickly. But let's take the majority of young people who get infected and don't even know they're infected. You can get the mindset, well, listen, if I'm infected, I don't know I'm infected, I'm not feeling sick, who cares? I'm not bothering anybody else. That is incorrect, because by allowing yourself to get infected, you are propagating the pandemic. And let me explain what I mean by propagating it. You can't think of yourself in a vacuum, because if you get infected and you don't know it, then you're going to might innocently, and I'll use the word innocently because I don't think there's any malice here, you can innocently infect someone else, who then might infect someone else. And then all of a sudden, a vulnerable person, an elderly person, a person who's immunosuppressed, a child with cancer on chemotherapy, when they get infected, then you have a serious problem. So what I would urge and almost plead with the younger people, because I know if they really understood this, they would take it seriously, that you have to have responsibility for yourself, but also a societal responsibility, that you're getting infected is not just you in a vacuum. You're propagating a pandemic. So when I see the pictures of people at bars, enjoying themselves, totally understandable. I get that. I was there at one point in my life, or see people in crowds, and you say, well, they think they're not doing anything that is particularly harmful, but they might be. So my message to young people is consider your responsibility to yourself, but also the societal responsibility, because the sooner we put this down, the sooner you're going to get back to normal, and you'll be able to freely have fun, go to the bars, go with crowds, but not now. Now's not the time to do that.
Yeah, and I want to push on this point a bit more because you mentioned that young folks can get sick too, but you're focusing a lot on how young people risk spreading COVID to more people. But from the people I know, it seems like getting COVID, even if you're young, is an absolutely brutal experience. A lot of people get sick for weeks or can be sick for months at a time. And we don't know yet what the long-term side effects are. And so I'm curious if you can just talk about that a little bit more and about that part of it for young folks as well. What do we know so far about how COVID affects younger people? Maybe just address that set of issues a little bit more as well.
I mean, there are countless examples. I'm glad. Thank you for bringing that up, Mark, because, as I've often said, I've been chasing viruses and looking about and going after outbreaks for decades. I've never seen an infection with this broad range of manifestations, from nothing in 20 to 40%, 45%, to getting sick for a few days, to getting knocked out literally at home in bed, feeling horrible with then even post-infection syndromes, to maybe in the hospital, intensive care, and death. If you look at the statistics, like you said, the young people are heavily weighed towards not getting seriously impacted. But be careful when you talk about what do you mean by seriously ill. There are many, many young people who get infected. They get sick. They feel horrible for weeks and weeks. And then one thing they notice, and we're getting a lot more information on this, that even when they clear the virus and they test negative and they don't have any virus, they can feel out of sorts for weeks and weeks, almost similar to a myalgic encephalitis chronic fatigue syndrome thing, where they just don't feel right for weeks and weeks and weeks. So this is not an infection to take lightly, even with young people, And
what do we know so far about long-term side effects? Do we know anything about this yet, or do we just simply need to watch how this plays out for longer before we're gonna know if there's significant damage to organs or anything else that we need to worry about?
Yeah, I think you hit the nail on the head. It's going to be time. We've got to wait and see in the long range. Now, if you look at likelihood and initial experience for people who get sick and maybe are out for a few days, they get a sniffle, a little sore throat, the virus tends to stay in the upper airway, maybe a little short of breath, and then they're good. They get better and they're fine. It is very unlikely, Mark, that those individuals are going to have any chronic long-term issue. It's the people who really get knocked out badly, particularly those who might require hospitalization, that it's going to probably take months to a year or more to determine if there are any long-lasting deleterious consequences of the infection. We just don't know that now. We haven't had enough time.
Okay. You made a comment recently comparing the severity of COVID to the 1918 pandemic. Can you say more about that?
Yeah, I'm glad you brought that up, because I want to clarify that. I had used the word comparable, and I think that may have been taken out of context because people would have thought, my goodness, we're having this now. Is it going to be the 50 to 100 million people in 1918 that died? No, they're not comparable in that way at all in severity. They're very, very different. I was just talking about 102 years then. We're historically now looking at a historically important outbreak, because we haven't had anything like this really for 102 years. But I don't want anybody to think there's severity comparability because of what was experienced in 1918, which just, I mean, if you look at it, it was 50 to 100 million deaths in a population 1/3 the size now. So I wanted to clarify that. Thank you for giving me the opportunity. This is a serious situation we're facing now, but it's not 1918.
Yeah, that makes sense. Now, a lot of the comments that people have written in are about asking about reopening schools, right? So how should we be thinking about reopening schools? What does the science tell us on this issue? What is your view of the appropriate threshold in terms of deciding when to reopen? And a lot of parents just want to know how they personally should be thinking about this. So I'd love to hear you talk about that set of issues.
Yeah, thanks, Mark. A great question, because it's something that we're addressing now as we're into the summer and getting ready to opening the schools. So I think as a default, I have a general concept, and then I'll fill in the blanks. The general concept is that to the extent possible, our default should be to try and get the children back to school. The reason I say that is that the unintended ripple effects, downstream consequences of keeping the children out of school can be profound. The American Academy of Pediatrics has spoken about that, the deleterious effects on children, the impact on parents who have to modify their work schedule if their children stay home. There are a lot of unintended negative consequences. Having said that, with the thought that the default should be to try and get kids to school, you've got to look at where you are location-wise, because, as I've said often, the United States is a large country, geographically and demographically quite different and varied. You could be in a part of the country, a county, a city, a state, in which the level of virus infection, the dynamics, is so low, you could send kids back to school without any modification or any worry. But there are also some areas when you look in the dynamics of the infection are so intense, you have to say, wait a minute, let me think about it. Do I have to close the school for now? Or can I go back? But in order to be safe, do I need to do it in a modified way? Alternate days, morning, afternoon, or whatever, because paramount to drive it is the safety and the health of the children, as well as the safety and health of the teachers. So you've really got to make sure that's a driving force in your decision. So a wide degree of variability, default, always try to get the schools open. If you can't do it in a natural way, do a modification. And some of the school principals and the superintendents have very creative ways of doing that, of modifying the class structure, outdoors maybe a little bit more, protecting the vulnerable. It can be done. It can be done.
Okay. And is there anything else that you'd say to parents who are worried about either having schools reopen or the safety of sending their kids to schools?
Yeah, I mean, I think they have to, and I know parents, at least I as a parent, when my children were at that age, I certainly would be concerned, is to listen to the recommendations. You know, the CDC has guidelines. The health officials locally will make a decision, hopefully, and I cannot imagine they won't, based on a concern for the safety at the same time as the need to get the children back to school. CDC guidelines are there. They can be used very well.
Yeah. So I want to talk about the racial disparities here, which I think are really troubling. The CDC has reported that Black, Latinx, and Native Americans are 4 times as likely to be infected with COVID and twice as likely to die as white Americans. So what can you tell us about what we're seeing here and what is being done by the government to address this?
Yeah. That's a very good question, Mark, and a very disturbing phenomenon that is a reality. And there's an explanation for it, and there are things that we can do about it immediately, but things that are going to take decades for us to correct. So if you look at the fact that if you look at minorities, as you mentioned, African Americans, Latinx, Native Americans, and Alaskan Americans, if you look at that group, although you don't like to generalize, but it is a fact that as a demographic group, the kinds of jobs that they generally have do not allow them as much to do the kind of telecommunication that we're doing right now, that put them in so-called essential jobs where they're outside in a situation exposed enough to have a greater incidence of infection than someone who could call a timeout and do work from the quiet and solitude of their own home. So they have a greater chance of getting infected. Once they do get infected, as a group, if you look at the underlying conditions that lead to a higher likelihood of a bad outcome, those demographic minority groups have a much higher incidence of that. And I'm talking about hypertension, obesity, cardiovascular disease, other types of chronic lung disease, diabetes. Those are the things that put you at a higher risk. So the immediate things that we can do now is that, how do you address that? What you do is you put resources where you have a demographic concentration of individuals so they can get tested easily, contact traced easily, have access to care, get under the care of a healthcare provider quickly to try and mitigate the advancement of disease. You can do that right away. We can concentrate resources in those places, making sure they get things that they need right away. The broader picture of the social determinants of health that lead to minority groups having a higher incidence of diabetes, of obesity, of lung disease, of heart disease. Those are the kind of things that we as a society need to address and commit to doing over a period of decades, because that's not going to change overnight. But let's at least do the things that we can fix now. And we could fix access to care. We could fix ease of testing. We could do that now.
Yeah. Okay. That's important, and I think it makes sense. I want to make sure we have time to discuss some of the science and potential treatments. Earlier on, I know that a lot of scientists were hopeful that there might be existing drugs, including things like hydroxychloroquine, that might have been effective against COVID. But unfortunately, it seems like nothing has really emerged as a clear treatment of existing drugs that were already on the market and had already been reviewed as safe. And even drugs like remdesivir, which is probably one of the more effective newer medications, doesn't seem to have as huge of a positive impact as we might have hoped. So what's your take on the drugs that we've found so far, that we've tested? And are there any treatments that you're optimistic about over the coming months?
Good. Okay, great question. Thanks, Mark. So if you look at advanced disease and early disease, we have had two advances, and this was in a randomized placebo-controlled trial, not those other types of anecdotal things which give you information that generally confuses people. If you look at remdesivir in individuals who are hospitalized with lung involvement, and you look at the impact of remdesivir, there was a highly significant but modest effect in diminishing the time to recovery. So that's one well-proven good drug. Dexamethasone, which is a glucocorticoid, an anti-inflammatory steroid, clearly showed in hospitalized patients on ventilators or requiring oxygen, but not people with early disease, that if you gave it 6 milligrams a day for up to 10 days, you significantly diminished the death rate in ventilated patients, in patients requiring oxygen, but not in early patients, which is interesting because it goes along with what we know of the pathogenesis of the disease, that when you have early disease, you want to block the virus and keep the immune system revved up and working. When you have late disease, it's less the virus doing damage than the aberrant inflammatory response, which is the reason why dexamethasone works. So we have two good things going. What we really need is your question about what do we have in the mix right now. What we really need are drugs that when given early can prevent a symptomatic person from requiring hospitalization or very dramatically diminish the time that they're symptomatic. And some of the promising ones are other direct antiviral drugs, which we're screening and targeting. Also, convalescent plasma, which we're doing a trial to see if it works, hyperimmune globulin, and importantly, monoclonal antibodies. Monoclonal antibodies are very precise bullets that you have by developing from a person who's been infected or vaccinated, making antibodies, clone their B cells, and give it to people early on. You can do it as an outpatient, you can do it as an inpatient. All of those things are being geared up now and are either in clinical trial or will soon be going into clinical trial.
So when you talk about things like monoclonal antibodies, how would that be administered and who could get that? Who is the audience that might be helpful for?
Yeah, well, first of all, it can be administered intravenously. Once you get the right titration, you can do that subcutaneously or intramuscularly. You can do it for two things, Mark. Excuse me?
Through a shot.
Yeah, through a shot. Yeah, either right through the vein or just like you get a gamma globulin shot. You could do it that way. Now, that can be done either for prophylaxis or for treatment. So, for example, if you're in a situation where you have a nursing home situation where there's an outbreak and you want to prevent people from getting ill, you can just do it that way. Or after a person is infected, you can give it to them as a treatment. This was very successfully done in a randomized placebo-controlled trial. It wasn't a placebo, it was a drug that was serving as the control. You might remember, Mark, of Ebola in West Africa, where we showed that 2 types of different monoclonal antibodies were very effective in Ebola. And we hope we're going to see the same thing now with COVID.
And what do you think the time frame for something like that might be?
Well, the trials have already started, Mark. I would hope that as we get to the late summer and early fall, we'd be able to have enough efficacy data. Because remember, whenever you do this, they may look promising in an animal model. You always got to be concerned about safety, and you got to be concerned about, are you really giving someone something that works? So the clinical trials are underway for some and will soon start in another. I hope by the end of the summer, we'll have enough information as we get into the fall that we might be able to utilize these. It'll be really good if we have bookends, drugs for advanced disease and drugs for early disease to prevent advanced disease.
Yeah, got it. That makes sense. And if that's coming over the next few months, I mean, that's a good cause for some optimism.
Yeah.
Longer term, of course, developing a vaccine is going to be critical. So I'm hoping that you can talk a bit through where we are in that process at this point, and what the process from getting from where we are now is to having a vaccine that could be given to people broadly, and when the soonest would be that kind of a vaccine might be available.
Yeah, I'm actually cautiously optimistic about this, Mark, because of what we've seen. As you probably know, given the technologies we have and the different platforms, we moved from literally the day that sequence was put on a public database to getting that sequence, pulling the gene and sticking it into a platform to make a vaccine was measured in days. And then 62 days later, we were in a phase 1 trial. So where are we right now? There are multiple candidates, not only one. So I might talk as the prototype of one, but there are more than one that will be going into advanced trials sort of in tandem sequentially. One right now that 2 days ago, it was published in the New England Journal of Medicine, the phase 1 data, which we did some time ago, for safety and to see what kind of response it was induced. The thing that makes me optimistic about this whole enterprise is that this vaccine, which was an mRNA vaccine from Moderna that was developed here at the NIH, but as I mentioned, it's not the only one, that induced in the people who were in the phase 1 trial levels of neutralizing antibodies, which are the antibodies that are the real bullets to stop the virus. That is the gold standard of protection, is neutralizing antibodies. It induced it at levels at a moderate dose of the vaccine that were as high or higher than what you see with convalescent plasma after natural infection. And one of the hallmarks of vaccinology is when you get a vaccine, you'd like it to induce a response that's at least as good as natural infection, which would predict that the vaccine would likely be successful, even though the proof of the pudding is always you got to do the big efficacy trial for safety and for efficacy. At the end of this month, July, we're going to be starting the phase 3 trial of this candidate. And as we get into the summer, a month later, another candidate will go into phase 3 trial. And then a month later, another. So that over the next 4 to 5 months, you're going to see sequentially these candidates going into clinical trial. Having said that, if everything works out the way we hope and we don't get any unpredictable potholes and bumps in the road, we should know as we get into the mid to late fall, early winter, but probably late fall, whether we have candidates that really are safe and effective. And I hope and anticipate that we will have one or more. If that's the case, by the time we get to the end of this year, the beginning of calendar year 2021, we may have vaccine one or more candidate that is actually safe and effective. That being the case, we can start distributing doses widely at that time. And the reason why I think we can do it is that even as we're doing the clinical trials now, we being the enterprise, the companies, are going to already start making doses at risk, which means they're going to make doses even before they know the vaccine works, which means if it works, they've saved months. If it doesn't work, we've lost a lot of money. But we figure it's worth the risk. So the risk is not in safety, and the risk is not in scientific integrity. The risk is financially to try and make these steps truncated. So that's where I think we are. So I'm really quite cautiously optimistic that we'll be able to have something as we get into the end of this year and the beginning of next year.
Yeah, that's a good note of optimism. I think it might be useful to talk through the process of vetting a vaccine, both so that people have some sense of what it takes to get from an initial candidate to something that's ready to go, but also because, while I know that the vast majority of people would be very excited and optimistic if they could get a vaccine that would prevent them from getting COVID today. I know that there are some people, it's a fringe, but it's unfortunate, who question the overwhelming scientific evidence on the safety of these. So I just think going through the process and showing how overwhelmingly focused it is on making sure that these vaccines are safe would be helpful to go through as well.
Sure, very good. I'll do it succinctly. Well, you get a candidate like the one we did. You get it, you put it in the form to be administered, and you put it through animal studies, animal tox studies, animal efficacy studies. So before you even think about going into a phase 1 in humans, you got to have, is there a reason to believe that this is going to induce a response? You got to see it induced in an animal before you see it induced in a human. And does it protect in disease in an animal? Then you get that candidate and you go into phase 1. Very limited number of people. Our phase 1 had 45 people, 15 at each dose. You want to see, is there any immediate safety signals? And you want to see if it induces the kind of response that you would predict would be protected. Then you go to the next phase. So if phase 1 is 45 people, phase 2 is hundreds of people. You get there, you continue safety, you continue immunogenicity. If it looks good, you then move to phase 3. Phase 3 goes from hundreds of people to thousands of people. The trial we're going to start at the end of July is going to involve 30,000 people. So when you have that many people in a trial, not only are you looking to see if it works, but you're constantly keeping your eye on safety to make sure that a vaccine actually doesn't enhance disease and make people work. Once you do that, at every given point in the trial, an independent group called the Data and Safety Monitoring Board looks at the data and says, trial's going okay, you can continue. Looks next month or the month later, trial's going okay, you continue. Or, wait a minute, it looks like you're never going to really get an answer because nothing looks like it's working. You have futility, stop the trial. Or what we're hoping for, Mark, that they look at the data and say, wow, this looks good enough that ethically you can't continue with a placebo. You've got to say, this works, let's start distributing it. Those are the individual steps of developing a vaccine.
Okay, that's very helpful to go through. While we're on kind of the basic safety measures for some of the common sense things that we're hoping to roll out. I have a question here asking if there are any known adverse effects about wearing a mask at all. You know, I mean, there are some memes that go around, you know, are people breathing in more carbon dioxide? Are there any issues like that? From all of the studies around this, has anything negative been found?
Not at all, Mark. There has not been any indication that putting a mask on and wearing a mask for a considerable period of time has any deleterious effects on oxygen exchange or anything like that. Not at all.
Yeah, and my understanding is this has also been studied even in people when they're running and exercising and things like that. And I haven't seen anything that suggests that there would be any issue, but I mean, you obviously are the expert on this.
Well, no, I mean, I wear a mask when I'm outside all the time, particularly making sure that I don't remove it when I'm close to people. And, you know, it doesn't bother me. I even run with a mask on. Sometimes it gets a little moist there, depending on the cloth that you're wearing. But there's nothing to indicate that wearing a mask has deleterious effects.
Okay, well, it's good to just get a chance to make sure that that is crystal clear for everyone. And just reading a few more questions from the thread here. You know, one that has come up a bunch is, you know, some people are wondering, if someone isn't showing symptoms, then how is it that they could be contagious? I mean, I kind of get why that might not be obvious to a lot of folks. So it's probably worth just taking a few minutes to talk through that and how that works.
No, that's a great question, Mark. I'm glad you asked it. Yes, and the reason you can be contagious, if you look at how you transmit from one person to another, the virus resides in the nasopharynx, in the back of the throat. So that's the reason why when you speak or cough or sing, the virus in droplets comes out. You may not see it, but when you do certain lightings and lasers, you can see it. What we have found out that when you measure the level of virus in the nasopharynx of asymptomatic people compared to people who are symptomatic, there doesn't seem to be any difference, which means there's as much virus in the nose of a person who's asymptomatic as there is in a symptomatic person, which means it is very, very likely that when that person talks or sneezes or whatever, that enough virus will come out to infect someone else. So there is not a lot of difference in virus load, even though people can be very different with regard to their symptoms.
Yeah, so related to your point about droplets, there's some recent pieces that I've seen suggesting that are wondering whether, to the extent to which this is aerosol or droplet. There's a question from the thread about, do we have any data on how this moves around differently inside versus outside, or how long this can linger in the air for?
Yeah. Okay, so the linger in the air question relates to whether or not it's aerosolized, or another word people use is airborne. So there are different types of droplets. So most of the droplets, when people speak and you see that little spray come out, are greater than 5 micrometers. Those are the kind that they're heavy enough, Mark, they don't go any more than 3 feet, at the most 6 feet, which is why we say when you're outside, stay at least 6 feet apart from someone. There are other droplets that are less than 5 micrometers. Those are the ones that can, quote, aerosolize. And aerosolize means instead of coming out from your mouth and dropping within 3 to 6 feet, it can kind of float around the air and stay in the air for a period of time. Right now, it is unclear, and it is because we don't have enough data, that there is likely some aerosol that comes out. And you could show that by these lasers and lights. We don't know the extent to which aerosolized or virus that stays in the air for a long period of time is involved in the transmission. We certainly would like to know that, but it's very difficult to determine that, even though we know that some degree of aerosolization does occur. If you turn back the clock and go to SARS back in 2002 and 2003, there was a clear-cut instance in a Hong Kong hotel where aerosolization absolutely occurred, spread through different floors, and infected individuals. Why that person who was the source of the aerosolize, or whatever the source was, we still haven't figured out. But that was a good example of a coronavirus spreading through aerosol. But right now, today, well, I can't tell you with scientific certitude what proportion is spread through aerosol. That's one of the unknowns we're just going to have to work out.
Got it. Okay. Maybe go back to vaccines for one more minute. I mean, we're trying some novel strategies with some of these vaccines, like the RNA vaccine. I think the Moderna candidate might be an RNA vaccine, and I'm not sure if there are any. This might be the first kind of major RNA vaccine. So I'm curious to just hear you talk about the advantages and disadvantages of the different strategies for types of vaccines that can get developed, and maybe even beyond COVID, if an RNA vaccine ends up being possible and working, what are some of the advantages for treating future outbreaks and things like that in the future?
Yeah, good question. So there are multiple, we refer to them for your listeners and viewers as platforms. So mRNA is a platform. Viral vectors are a different platform. Soluble proteins, recombinant proteins. Killed inactivated is another platform. So we had multiple platforms. There are three that are being actively done. One is the mRNA. The other is viral vectors, where you take a virus, stick the gene of the spike protein so that it expresses itself, and then you get an immune response when you inject that. The other is just taking a protein and inject it with an adjuvant. The reason that the novel technologies we used that were very easy to just get out of the blocks and go with it, test, assess, what I explained to you, the timetable, we went from a couple of days, bingo, into a vaccine, done. So if it works, which we believe it will be a major advance of ease, of facility, of scale up, and ultimately of cost. We'll do it. It hasn't been proven the way some of the others have been by years and years of experience. So that's one of the things. If it works, which I hope it will, I think it will, people will be saying, wow, we have a red hot platform here. We're going to start using that for a lot of other vaccines. The other ones that we have are the viral vector ones, the ones I described, be an adenovector, a vesicular stomatitis vector. That's another one that we've had some experience with, particularly with Ebola, in which it worked very well. And then there's the ones that have been used more commonly, which is the soluble proteins that you could make with recombinant DNA technology. So there's multiple platforms. We're hoping, and I believe we'll be successful, I hope we are, that more than one of them will prove to be safe and effective. It'll be good for the effort, and it'll be good for the field of vaccinology, because it's really unprecedented that we have so many different platforms going on at the same time to determine safety and efficacy.
Yeah. All right. So I think we're almost out of time. So I wanted to check in and see if there's anything else that you wanted to cover, or are there any other thoughts that you'd like to leave this community with?
Yeah, I just want to reiterate what I said before, Mark, and thank you for giving me the opportunity to say it, that we are all in this together. We are going to get through it. We will get through this difficult situation. At best, it's difficult. I mean, it's a very significant issue that we're dealing with right now, but we've all got to do it together. We're in it together. And since I know we're looking disproportionately to a lot of young people that are watching this, please assume the societal responsibility of being part of the solution and not part of the problem. Because we're going to get through it. We're going to get this under control in the southern states, and hopefully we're not going to see these kind of surges, so that we do get down to the baseline that we hope we would. Because once we're down to that baseline, Mark, it's going to be so much more easy when you open up the country, as it were, to put your clamps on when you get individual infections. They don't soar off the ceiling. They stay clamped down. That's the message I want to get one last time.
Great. Well, thank you, Dr. Fauci. I think I say this on behalf of millions of Americans who will watch this. We appreciate your leadership and your dedication to helping us navigate this. You have a lot of people's confidence, and a lot of people out there continue to have faith in science and want to make sure that this is led, that our response is led by science. So thank you for everything that you are doing in what are some trying circumstances, and please stay healthy and good. And thank you to everyone out there for tuning in today. I hope you all stay good as well, and I'm looking forward to seeing you all soon.
Thank you, Mark. Thank you for giving me the opportunity to be with you. I really appreciate it. Thanks.
All right, guys, once again, that was a special interview brought to you by Facebook. Obviously talking with Dr. Fauci, as you could see there, talking about the research into treatments and vaccines and where we are now. What are we going to be seeing in the next few months? We are currently waiting on an Arizona press conference. This is going to be with our very own governor, Doug Ducey, as you can see. Things are getting ready. The interpreter making sure that their placement of where they're going to be standing is also in the right area. And so this is supposed to be getting started here in just about 5 minutes. Until then, let's listen in here while we're waiting. I'm just going to switch us back to our map here. While we're waiting, why don't we just listen in for a few minutes to Washington's Governor Inslee and other health officials on the cases that are still rising in the state of Washington. And then, as I mentioned, as soon as Arizona's Governor Doug Ducey does step out, I'm going to be bringing that to you right here on our News Now stream.
When we go to work, when we recreate, when we're being social, all of those things impact our ability to move forward as a state with the things that we want to. And we really can't go safely forward unless we all do our part. And there are many things at risk to this, as you say. We have at risk schools opening in the fall if we don't, with in-person classroom, if we don't get a handle on this, because right now it is just simply moving in the wrong direction and going to be too dangerous if this continues. So really, this is about the impacts that we can all make and pitch in together and do that leadership that you've talked about for so long. So I know that we don't want to jeopardize any of the momentum, but we are jeopardizing the momentum and the gain that we made with the stay home, stay healthy order. So as you said, really what we need to do is decrease the number of people to contact with in those social environments. In talking with the folks in local public health and who are interviewing the people who are diagnosed with COVID, what we're hearing is it's these social interactions that indeed folks are starting to see become more apparent in the cases, including now we're seeing some of the impacts of the July 4th weekend activities. It's now about 2 weeks later, and during that time period, that incubation period, that's when we would be seeing the cases, and the people who are talking to the people who are recently diagnosed are learning a lot about these interactions, as you talked about, whether they're birthday parties, a cocktail party, something that people feel is pretty innocuous. So we all need to pay attention. I think the bottom line is our attention to this can't be a part-time job. This is a full-time job. Every interaction we have to think about doing it safely, wearing those face coverings, keeping our distance. And if we do that, we can bend the curve again. And it's absolutely essential that we do that. So thanks, Governor, for your words around this and the leadership we're taking today.
You bet. And that word leadership is important. I will note that I think all of us have some leadership capability here. You know, whether you're a parent of a 19-year-old that wants to go out and party during the night and is going to be with 50 other people, look, there's a leadership position. If you're a 19-year-old and you're going to go to a party and you think, maybe that's not the best idea to not be socially distanced, that's a leadership position. And we're really hopeful people do show leadership. Lastly, I'd like to draw attention to the fact that Congress needs to pass another stimulus bill. They need to do it now. We have so many people who need financial support now. They're making good use of the extra $600 in their unemployment benefits, and those need to continue, and Congress needs to move to do that. We are hopeful that Mitch McConnell timeline for the aid is not followed, because it would be too late. We need assistance now. This pandemic is not going to go away by the end of this month. We know that, and neither will the need for aid, both for individuals and for states, so they can do their business. People need help, businesses need help, communities need help, states need help. So I have one simple message: pass the damn bill so we can do our job and take care of our people. With that, I'd like to stand for questions.
First question comes from Rachel with AP. Governor, you've warned of potential additional rollbacks. Can you give specifics of what activity could be modified short of a stay-at-home order?
Yes, these are not decisions at the moment, but we would have to look, if this trends continue, even in the short term, if these trends continue, we would have to look at the things that are least problematic for people's daily survival, least essential for our economy, and most dangerous by bringing people together in social settings. Clearly, those would involve bars, those could involve indoor dining at restaurants. They could involve other recreational activities, bowling alleys and the things like that. The things that were the last things that we had to shut down would be the first things we'd have to go back on. And why? Because science may dictate that. And the science is that this is a trajectory of tremendous danger and fatalities that we're on today. And we will have to be confident that our new measures of masking initiatives, this restriction, additional restrictions on social gatherings, and evidence that businesses are complying with the masking requirement would be enough to reduce this rate so that we can go about opening our schools and the like. And, at the moment, that's a great question. So we're taking action in the last few days in our masking requirements. We're taking action today. But I just have to make sure people are aware that something has to change fairly significantly, or we're going to be back been to the soup just like we were in March and April.
Rachel, would you like to ask a follow-up? Yes. Schools, you spoke with School Superintendent Reichdahl yesterday. Can you just talk a bit about what that discussion entailed and whether there were any decisions made?
So there were not any dramatic decisions made. We talked about the status of the school district discussions and planning. Primarily, I talked to a number of superintendents yesterday morning and then the superintendent yesterday. And as you know, basically he and the departments of health have set forth templates about how to go about education in this fall. And they set out basically some requirements that we will need to meet in order to be able to do that. Requirements about distancing of students, of hygiene, of screening of people. And so we know what those requirements are, and the school districts are now considering those to figure out how to go about education in the most successful way, taking those into consideration. And at the moment, it doesn't appear that those plans are set in concrete. We know that many of the districts are looking at plans that would involve a certain number of days in classroom instruction and certain remotely. There's also a number of school districts have told me they would consider an option where parents, if they wanted to, could opt for remote instruction. And there may be some schools that have found a way to do it with total on-site instruction. So at the moment, the situation is districts are trying to make individual decisions that are consistent with their own community settings, and that those discussions are continuing. There are discussions with a variety of the community, parents, educators, and the leadership of these school districts. So the state is continuing to try to figure out what works on a community by community basis. But I do want to perhaps reiterate what is maybe obvious. Our ability to open schools is dependent on our ability to knock down this virus.
All right, guys, I do want to just take a break in that because it looks like we are getting things set up here for our Arizona press conference to get started. Now, remember, health officials have been planning to help boost Arizona's coronavirus testing with free screenings in 2 low-income Phoenix neighborhoods as our state tries to help get that growth rate down. Here's our governor, Doug Ducey, stepping in. Going to be listening in live right here on News Now.
Good afternoon, everyone. Thank you for joining us today. I'm joined today by Dr. Kara Christ on my right and Major General Mick McGuire on my left, the leaders of the Department of Health Services and National Guard and DEMA. I want to give you the latest update on where we are in Arizona. And I want to begin again by just saying thank you to all our healthcare workers, all our nurses and doctors. I've talked about this month as our maximum challenge to date. We know how hard they're working. I want them to know how grateful we are, how much we appreciate what they do for our citizens, and to the citizens, I want to say thank you as well. We're going to be able to share some things in terms of the direction Arizona is going. It could only be making improvements with your participation, partnership, and commitment to your fellow brothers and sisters and neighbors and friends. So I want to begin with a thank you to everyone, but specifically to those folks in the healthcare industry today. And I want to remind you, I've been saying this now for several weeks, you are safer at home. This virus is widespread in our state and in our country. People have been listening to this message, and it has been making a difference. Here are the latest numbers for the state of Arizona. 134,613 total COVID-19 cases, 3,501 average cases per week for the week of June 28th, 3,249 cases per week for the week of July 5th. And to date, we have lost 2,492 souls in Arizona. And I want to say to all of our citizens, I know the sacrifices that you've had to make, but coronavirus has touched no one more closely than those directly affected with the loss of a loved one. And our hearts and prayers remain with all of those families, and the actions that we'll want to take going forward will be to minimize virus contraction, sickness, and any death. In terms of our direction, our COVID-like illnesses in emergency rooms, which is oftentimes a leading indicator. And if you think of that, you go to the emergency room when you get sick. From there, you can go into a hospital bed. That is trending downward. Our COVID patient ICU hospital bed use, that's up, okay? And so much of the surge in cases that we had was in June. So those that became sick from the emergency room to a hospital bed to the ICU. And our percentage of positive tests, that is trending down for the first time in some time. And that is a good sign and a good direction. Let's take a look at the COVID-like illness surveillance. That's the blue line, and the influenza-like illness surveillance. If you can see, these lines were inverted as far back as December. The orange line is the flu, and it was flat. And the COVID line, the blue line, was flat. All the way up and including to the stay-at-home order. The flu has behaved like the flu the entire time through this. Coming out of the stay-at-home order, if you watch the COVID line all the way until June, it remained flat. And then a severe spike up over the next several weeks. And the first downward trajectory of the COVID-like illness surveillance in this past week. And a pretty dramatic leg down there. So that is a direct effect of the decisions that Arizonans have made over the past week, and we can see more of this if we do more of that. I want to talk about the COVID-19 cases by day. Those of you that can see that screen and see where June comes in, you might recall that for weeks and weeks I would come in and present this slide and say there's not much of a trend here. There's a lot of data and information. About 3 or 4 weeks ago, I came in and said there is a trend, and it's going in the wrong direction. And it continued in the wrong direction for several more weeks. Today, we see the first evidence of the trend headed in the right direction in terms of fewer cases. So we need to continue to press this to have fewer cases, which will result in fewer sicknesses, fewer hospitalizations, fewer deaths. Percentage of positive tests. We had weeks, the gold line is the percent positivity. The blue mountain is the number of tests that are done, both PCR tests and this is just all PCR tests. And like I said, the line is percent positivity. We had weeks where the line was as low as 5.1, 4.9, and 5.9% positivity. Then, through June, we had weeks where it was above 20 for several weeks. We now have it trending downward, and we need to continue to push that downward, and we're going to talk about how we do that. To show you where we are with hospital capacity. The orange line are COVID-like cases. They are on the rise. That began in June. We do have capacity, and the graph I'm showing you does not include the 2,660 additional surge beds, which we have not had to use up until this point. This is the intensive care unit hospital beds for COVID-19. Again, the orange line shows an increase in COVID-like illness inside our ICUs, pretty flat until June. That's where the increase happened, and this does not include the 600 additional ICU surge beds which have not had to be used, so we retain capacity. This is ventilators for COVID-19. The COVID use of ventilators is increasing. Again, that began in June. Lots of capacity remains. This is testing by day. This is our serology test, is the orange part of the graph. The diagnostic is PCR. You can see that an ever-increasing amount of tests in the state of Arizona. We need even more, but we're at over 950,000 tests in the state of Arizona, and more on the way, and we're going to talk about why that will be important and how we'll apply that knowledge. Let's talk very quickly about some recent actions that we've taken with the intention to slow the spread of this virus. Prohibiting large gatherings. The local mask ordinances that have gone in effect in nearly all parts of our state. The fact that we have paused the operation of gyms, bars, nightclubs, water parks, and tubing. Delayed the first day of school and have reduced restaurant capacity to 50% with much tighter guidance. What we've been in since this began and we have more knowledge about the coronavirus is the very unhappy but necessary business of breaking up large gatherings and congregations of adults. The virus is highly contagious and it spreads in groups. So the fact that bars and gyms and movie theaters, no concerts or spring training or large events happening, large venues are not in business, college sports, Major League Baseball, NBA, NFL may be preparing to play and compete, but that does not at this time include in-stadium fans. That's where we are today in Arizona. That's been the effort, along with what we've done previously and what we've done in the last several weeks to break up those larger gatherings of adults. Also, I want to say thank you to Arizonans, to our local mayors and county supervisors. This effort to get people wearing a mask in the state of Arizona. Nearly 90% of our state now has a local mask ordinance. I want to say thank you not only to the leaders, but thank you to the citizens for your compliance. It's making a difference, and we're going to show you the difference that it's made. What we've gone through and the challenges that I'm sharing with you really is Arizona's new normal, and it's our new normal for the foreseeable future. I really want to ask people to get their heads around that this is going to be a challenge that's going to be ongoing for the foreseeable future. And the better decisions that we make now, the better habits and disciplines and rigor that we have, the more success, the more people that we will save and protect around the coronavirus. This is our graph from the Arizona Department of Health Services. Many folks on the coronavirus task force, Dr. Deborah Birx, for one, talks about risk reduction, about making better decisions so that you can avoid contracting this virus and protect others. So if you were to look at a CDC website or the Texas Health website or California Health website, you'd find similar charts, likely different graphics. But this is informed by public health. This is not my opinion. This is not senior staff's opinion. This is the opinion of public health experts. So if you want to make better decisions, take a look at this graph. You can see that we've done a lot around our higher risk type activities to limit them in the state of Arizona and used government guidance or mandate where necessary. So let's take a look at the results. See where we are. I introduced this number 3 weeks ago. This is the R0 number. It's the average number of people who become infected by an infectious person. This is how the disease is spread. If you remember, I shared this on June 29th. We were at 1.18 in the state of Arizona. And if you go to the far left of the graph, you can see that's where the highest numbers are. To the further right, those are the states that are below 1. That is the objective. Is you want to be below 1, you will naturally have decreasing cases. 10 days later, Arizona had moved 8 basis points to 1.1 on this graph. That was after we started to ask people to please make decisions around being safer at home. So we saw a pretty dramatic movement. Here we are now, the next week, moving 12 more basis points. So in total, we've moved 20 points in less than 3 weeks. And today, Arizona is below 1. We're at 0.98. Yesterday, we were at 0.98. 697. So I said, if you want to help our doctors and our nurses and our healthcare workers, if you want to help lighten the heavy burden that they have, the decisions that you make, the limiting of mobility will have something to do with that. Today, Arizona is below 1. And to show where we are in comparison to some other states, and the fact of your good decisions and your actions that you have made have put us below 1. You can see where other states are, how fluid this number can be, and how dramatically we moved from one side of the graph to the other in less than 3 weeks. Thank you very much. What you're doing is making a difference in Arizona. Now let's take a look at another graphic that will show how the number of cases have changed from last week to this week. This is the New York Times graphic. They show it for every state and every country in the nation. This is how you can determine hotspots. The blue part of the map is in decline. The red and darker colors are where the virus is spreading, and the yellow is where it is stabilizing. So look at the dramatic change in Arizona's map in 1 week, week to week. Those are the good decisions that Arizonans are making around the state. Thank you. Newly reported cases in the state of Arizona, and if you can see, we were flat from March to April to May until June. A rapid rise upward, a flattening, and the beginnings of a slight decline. We want to push that decline further. We want to do more of what we're doing right now, but much of this gives us reason to be very cautious, but have some hope and optimism for what is possible in the very near future in the state of Arizona. We do look at other national outlets in terms of what's happening. This is the New York Times showing what's happening across the country. You can see our nation flat in April, May, and through June. A dramatic spike up in July while we are flattening and beginning a decline. It just shows how dangerous this virus is and how fast it moves. So the rest of the country is experiencing much of the increase that we had in June in July in macro numbers. This is another graphic in the Times that shows where new cases are increasing. For weeks and weeks, we were not on this page. And then what has, to me, seemed like forever, we have been on this page. And I've been getting up. If you touch this page and touch your state, all the statistics and graphics come up, and you can see how other states are doing and what best practices or interventions are making a difference. I got up very early this Monday morning and pulled up this page. I kept looking at it. I thought maybe it wasn't fitting right on my phone, and actually went and got my iPad. On this page on Monday, where new cases are increasing, I couldn't find Arizona because Arizona wasn't there. Arizona had moved to a new page. And I want you also to note that there's 40 states on this page, along with Washington, D.C. and the Virgin Islands. But Arizona had moved to this page, where new cases are mostly the same. So that's, again, we've gone from increase to a flattening, and where we want to be is